The next bill on the calendar for today is Senate File 1458. The clerk will report the bill.
Senate File number 1458, number 2 on the calendar for the day, an act relating to state government, establishing the Health and Human Services budget.
There is a DE amendment at the desk to insert the House language into the Senate file. The clerk will report the amendment.
Dean M. moves to amend Senate File 1458, the second engrossment as follows. Delete everything after the enacting clause and insert the following language of House File 1638, the second engrossment.
On the motion to insert the House language, the member from Washington, Representative Dean.
Mr. Speaker, members, that just gets the bill before us in the way that we want to talk about it.
On the motion to insert the House language, all those in favor say aye. Those opposed, no. The motion prevails, and the amendment is adopted. Representative Dean, to introduce your bill.
Thank you, Mr. Speaker and members. It is my pleasure to present the House GOP Health and Human Services Finance Bill. That is a combination of several committees' work that I would like to recognize at this time, particularly Chair Tara Mack and Chair Joe Schumacher for their work within this bill. Within our committee, I would like to thank my Vice Chair, Joe McDonald, and the committee leads, Representatives Liebling and Loeffler. I would like to thank the research folks who helped put this bill together and really do a great job. It's a very, very complicated committee, and it's very, very hard work, and we have some of the best researchers anywhere. Randall Chun, Daniel Pinelli, Jamie Olson, Lynn Aves, Sean Williams. Our fiscal analyst is Doug Berg. Really did a great job. Our DFL leads on this bill, but also I want to thank our fine committee administrator, Holly Iverson, also Rachel Stuckey, who worked with Representative Mack's committee, and of course wouldn't be complete without thanking my slightly above average committee legislative assistant, Mr. Stolarczyk. So we want to do that as well. It is a compliment. It is a compliment. Also, we had 2 freshmen on the committee. We had Jeff Backer and Nels Pearson, who did a great job. They now know what a ICFDD is and what all of the TLAs are, which if you're on the Health and Human Services Committee, you know a TLA is a 3-letter acronym. And we have a lot of them. It's a lot of work, and we've got really great staff. We also, in this bill, we've gotten a large amount of work. As you know, that if you've been on the Health and Human Services Committee before, you know that we tackle a lot of issues. There is really nothing that the Health and Human Services Committee does that is bad stuff. It is all good stuff. And it is the work of really good-hearted Minnesotans all across the state of Minnesota doing good things to help their neighbors, and this is how we pay for it. And it's a tough job because you have to really choose between doing 2 good things and oftentimes, and we have to prioritize that, and it's difficult decisions. But it's a great committee. The advocates are great. The lobbyists are great because Minnesota is a place where health care is a priority and where we really do it better than any other state in the country. And I think that folks on both sides of the aisle agree that that is the case, and we both want that to not only be true now but down the road. We have 2 different ways of getting there. We understand that, and we're going to debate the differences of how we need to move forward. One of the things that we are really looking at within the Health and Human Services Committee this year was looking at trying to take care of the vulnerable Minnesotans, those in most need, the developmentally disabled, the frail, the elderly, and the unborn. We protect those Minnesotans, and that is a very, very high priority within this bill. And it's one that we're very proud to put forward for consideration and hopefully for your vote today. With that, I want to just yield to a couple of members who really focused in on some key aspects of this bill that we're going to talk about today. We're going to talk about some things that are controversial. We're going to talk about how we're going to deliver care to low-income Minnesotans. That's going to be controversial because it's a change. We understand that. We want to really discuss the merits of that and how to do that. We want to discuss the fact that if we don't get a handle on Health and Human Services budgets, Minnesota is not unlike any of the other 49 other states. We need to get a handle on the growth in this budget because, as we will show, that if we do not get a handle on Medicaid spending and on our overall HHS spending, we can never, ever get to where we want to be in higher ed or K-12 or any of the other areas that are suffering because this area is growing unsustainably fast, and we know that. With that, members, I want to yield first to Representative Krisha, who will talk about one of the areas that we're talking about specifically with vulnerable Minnesotans. With that, I'd ask Representative Krisha to yield.
He will yield. The member from Morrison, Representative Krisha.
Thank you, Representative Dean, and to Representative Mullery, who also served on the Child Protection Task Force with me, and so many other ones in a bipartisan fashion. I had the honor, not necessarily the privilege, but the honor to carry this legislation through the committees. And I started off in the Health and Human Services Policy Committee. And in that committee, I told the first story of why I'm where I am today on this legislation. And that involves a young girl by the name of Rebecca, 25 years ago when I first started teaching. And as a young teacher, Rebecca came to my classroom. I was an 8th grade teacher at the time, and Rebecca enjoyed reading. And as a literature teacher, that's one of the best things in the world is when you have a student who actually enjoys reading. You don't have to constantly prod them. And she absolutely loved reading, but she struggled. She struggled socially. She struggled with her weight. She struggled with her looks. And she always came to school, unfortunately, with odors. She came with her hair undone. Oftentimes she had lice. And this is a child who really, really, really wanted to succeed. But at home, the biggest advocates she had weren't behind her. At home, those two people who should have been behind her, pushing her potential, helping her go on to do great things, were holding her back. And I remember as a young 24-year-old teacher thinking to myself, my goodness, what can I do? What can I do for this child? And I remember going into the meetings, the special ed meetings. I remember trying to get into the home. I remember doing everything I could to just try to reach this family, but I couldn't do it. I was fought by the bureaucracy of the schools. I was fought by the special education system that pushed us through legal, that pushed us into areas that I just couldn't get to. And here, every day in my classroom, 10 feet away from me, was a student that was crying out for help. 25 years later, I have the opportunity to look at the statistics, to look at the improvements that we can, because these children are calling out for it. I talked about this earlier with the knock on the door. When these children receive a knock on the door, and it's from Child Protection Services, that's a call to arms, members. That is not a time that we should sit back and just say, well, let's hope we can find it. That's a time to stand up and say, no, this is the time to get in there. I couldn't do it at 24, and with this bill, Representative Dean and Representative Mack, this is a chance for us to make a difference. You made a comment, Representative Dean, that there's areas of growth. Unfortunately, one of those areas of growth in the state is the children that we maltreat, is the children that we abuse. In 2009, there were 44 life-threatening and 21 deaths. In 2010, there were 33 and 13. In 2011, there was 30 life-threatening and 14 deaths. In 2012, there were 52 life-threatening and 8 deaths. And in 2013, there were 36 life-threatening and 8 deaths. Members, 19,000 reports in 2013. Let me say that to you again. 19,000 reports of child maltreatment and child abuse. I know many of you have kids and grandkids. I have 4 daughters and I have a son in the Air Force. And I will tell you this. I hope we can vote green on this bill. I hope we can get it through. But more importantly, when I go home at the end of this week and I finally get to see my daughters, and when they come running out, I know that I get to be their hero. And I just wish these poor kids would have the same opportunities, because they need a hero just like you and me. They need somebody who's pushing them behind. I don't know where Rebecca is today, and I hope to goodness she's been able to break the generational cycle. But I do know this: we have an opportunity to do some very good work in the child protection, and we have an opportunity to make some changes, and that's what the governor brought us together for the task force. So Representative Dean, thank you again, and I look forward to supporting your bill.
Representative Dean.
Thank you, Mr. Speaker, and thank you, Representative Kresha, for your very, very good work in child protection. It's a very, very difficult issue. Also want to thank the Democrat members who were also helpful within that and moving, I think, some excellent and overdue provisions forward. Also, I also neglected to thank Leah Montgomery, the DFL researcher, Heather Kirschbaum, Chelsea Whitman, Brian Cook, Sean Williams, and I want to thank again my unbelievable staff person, Holly Iverson, who just told me that I forgot those people, which is great staff work, by the way. So thank you again for that. The next piece of the bill that I want to talk about that really, again, goes to protecting Minnesota's most vulnerable folks is Representative Schumacher, who really delivered a generation overdue rehaul of looking at how we pay for nursing homes and protecting nursing homes in Minnesota, particularly small towns and rural areas across the state of Minnesota have been really struggling. And that's important to the people who live there, the residents, it's important to their families, and it's important to the economy of Minnesota that we maintain strong nursing homes. So I want to yield the floor to Representative Schumacher to talk about this important reform.
He will yield. The member from Rock, Representative Schumacher.
Thank you, Mr. Speaker. And members, as Chairman Dean said, the bill in front of us today prioritizes Minnesota seniors and those who care for them as they age. Briefly this evening, I wanted to provide some highlights of how our seniors and their caregivers are prioritized. First, our bill provides a track for senior caregivers to turn their jobs of taking care of our elderly into actual careers. With Representative Baker's House File 614 and Representative Fransen's House File 627, the Nursing Facility Scholarship Program gets an increase. A Home and Community-Based Service Employee Program is established, and it includes incentives for leadership and apprentice programs. We make it easier to take advantage of the scholarship programs by lowering the number of hours needed to work while balancing school and family obligations. In addition to helping our senior caregivers make careers into what they see today as just jobs until something better paying comes along, our bill provides payment reform for our state's nursing homes. This reform to our system is nearly 30 years in the making. It brings nursing home funding throughout the state up to the cost of their care, and by bringing it under a single rate system throughout the state, we no longer have the disparities between metro rates and the rates in other parts of the state. Members, the nursing home payment reform package is different from the patchwork process we've seen since the 90s. It's a long-term reform that entices quality through our quality component incentives, pays for the cost of care, and will give the workforce the much-needed increase in wages that they deserve. These provisions in the bill have all taken all session to put together, and I look forward to convincing the other bodies to get on board with what we're doing with long-term care reform.
Representative Dean.
Thank you, Mr. Speaker, and thank you, Representative Schumacher, for the great work that you have put forth in the area of taking care of our seniors across the state of Minnesota in what is really a difficult thing. Those members that have been around here for a few years understand that the way we pay people in nursing homes makes it unfair geographically. And one of the things that we wanted to try to do was to make things a little bit more fair across geographies and across systems for patients, for providers, and for payers. And that's something that I think in this section of the bill that Representative Schumacher has really grabbed a hold of and said, you know, let's make it more fair for nursing homes, for their patients, for the people who take care of them, for the facilities, but also for the economies in greater Minnesota. that when you hear from your local nursing homes, you're going to say, this is something that is real, and this is going to make a huge difference in the districts of all 134 members of the House of Representatives. So we are very proud of the work that Representative Schumacher put forth, as well as his committee. And next, I want to recognize Chair Mack, who is the chair for the Policy Committee and did some really strong work in the areas of providing high-quality access and trying to lower costs across the state of Minnesota, also dealing with some very, very difficult issues with MNsure, also issues with providing lower-cost care at a high quality. And I'd like to yield the floor to Representative Mack.
She will yield. The member from Dakota, Representative Mack.
Thank you, Mr. Speaker and members. And members, we've gotten a great intro into the bill so far, and I just want to go over a couple things that traveled through the Health Policy Committee. And members, I think the bill in front of you tonight represents a lot of the hard work on both sides of the aisle. There's no doubt that we don't agree on everything that's in here or the direction that it's going, but I think that a strong argument can be made that it really does move priorities forward. There's true reform in here. And as we continually try to bend the cost curve on health care and our public programs, we're always keeping an eye on how we can make sure that we're taking care of the people who need our help the most. I know that when I come to the Capitol, members, and particularly when I walk into that room for Health and Human Services, I ask myself what our goal is for that day. Why am I serving that capacity, and what are our priorities? Because we always know we can get bombarded with all of the asks, all of the money requests, all of the good ideas out there, and we have to balance those ideas and balance what we're going to fund. And so I know that when I approach that table, I think to myself, I am here to make sure that we are looking out for those who can't look out for themselves or need a little bit of help and a step up. And I think the people that really fall into that category, members, are the elderly, the disabled, and the most vulnerable children. And members, I am very proud to say of the work that we've done that in a way that I think truly prioritizes those groups of people in the Health and Human Services bill this year. This bill makes those a priority. It encompasses, as you've already heard, Representative Schumacher's reform in terms of how we pay for long-term care. Members, that is a overdue issue. I'm proud of how we've fully been able to fund it and what that means for people in this room who have aging parents, people in this room who maybe have family members that work in nursing facilities. We all represent people in those capacities, members, and this will make a real difference in their lives. The disabled community members, the bill addresses that in many ways. We have the MAEPD issue, Medicaid employed persons with disabilities, and the premiums that they've been dealing with. This offers some relief. We do some reform within the community when we have people who are on community-directed service supports. We make sure that those folks, once they've aged out of the school system, that we continue to make sure that they get the supports they need so that they can be active members of our community. Representative Zerwas brought forward the ABLE Act, which makes sure that parents who are trying to raise children with disabilities, that we give them an extra tool to make sure that they can create savings accounts to plan for their children's needs into the future. We also have the State Quality Council that Representative Hamilton worked on, another key component and key issue that's very important to the disability community as they plan for the future. When it comes to vulnerable children, members, you heard Representative Krisha talk about the very important work within Child Protective Services. I think on a bipartisan basis, in the last several years, the state has let our counties down in some of the resources needed to make sure that they are protecting our most vulnerable. This bill gets us up to speed, members, and I think we can all be very proud of the proposal in this bill for Child Protective Services, particularly how we're coming to the aid of our counties and really trying to put our weight behind them and saying we're behind you, making sure that you're our legislative arm out in the communities. You are the line of defense for these kids, and I'm really proud of the work that the task force did, that Representative Krisha did, and the money that we were able to put forward in this bill for that initiative. This bill also provides for safe harbors for kids, sexually exploited youth. We have Representative Will's Homeless Youth Act, making sure that kids that are out on the street, I think that doesn't sit right with anybody in this room, and we're trying to take active steps to fight that battle. And finally, members, another provision that we've heard from many parents, again, in the situation of trying to raise kids with disabilities. We know that that's a huge challenge, and we heard pleas all session long for some relief when it comes to TEFRA and what can be very challenging payments, very enormous financial burdens that come with that. Thanks to Representative Peterson, we're able to offer some of those parents some of the much-needed relief that they're asking for. Members, when it comes to some of the other reforms, outside of, as we look at how we're actually delivering health care and delivering our public programs, it's no secret that over the last couple of years, conversations around MNsure and the challenges that are facing MNsure and how that's translated to the individuals in this state needs to be addressed. And this bill contains a couple provisions, particularly House File 5, the bill that I offered to try to bring some much needed reform to MNsure. And members, whether you want to continue to fight and make sure that MNsure continues to exist, whether you want to see MNsure, disappear. I think that there's varying views on that. But this bill in here tries to say, no matter what direction we go forward, for the time being, there's some real needed reform. We need a board that more accurately represents the people that are using MNsure. We need to make sure that the taxpayers are protected from paying bonuses to some of the MNsure executives where they're not merited. We need to make sure that we are providing people of the state early release of rates so that they are able to shop in advance of having to purchase their health insurance. We need to make sure to eliminate many of the irresponsible and unneeded exemptions that MNsure was granted 2 years ago when it was originally passed, to make sure that they're in line with what we expect of any other agency in terms of oversight, in terms of how they do their procurement process. And also, members, it gets rid of what I think is a dangerous provision in the MNsure original language, and that's the active purchaser, where MNsure would have the ability to pick and choose which plans can be sold within MNsure after they've already gone through the rigor of our Commerce Department. So, members, I think a lot of real common sense reform when it comes to MNsure. I think some cost-saving measures. And again, we could all, go round and round on the fate of MNsure and which direction we should go. However, I would say that no matter which direction we go, many of these reforms need to happen to protect Minnesotans, to protect the state budget, and to make sure that many of the reforms that we've been looking for the past 2 years can come into fruition and make sure that we get going in the right direction when it comes to MNsure. And so, members, as we move into amendments here, and I'll turn the floor back over to Representative Dean, but I just want to assure you that this bill is full of reform and opportunity for all of us to make a difference in people's lives this year. It makes real differences for our counties and some of the relief that they've been asking for. It makes real difference for kids in this state, our most vulnerable, who are in dangerous situations and need us to protect them. And it makes a huge difference to those who are working in our disability community, those who are serving them with the 5% increase that we're giving to their rates in 2017, as well as the parents who are raising these kids and need some help from the state. So, members, I'm incredibly proud of the bill that's been put together. Thank you to Chair Dean and the incredible work that he's put into this. I think he's crafted a very sound bill that I will be proud to vote for at the end of the night, and I hope you can all join me. Thank you.
The member from Washington, Representative Dean.
Thank you, Mr. Speaker and members. We talked a little bit about the priorities of fairness, also about the priority of making Minnesota a state that cares for its most vulnerable and actually prioritizes it and actually funds that priority. We also want to talk about how we want to reconnect all Minnesotans with nation-leading health care by cutting red tape to control skyrocketing costs and layers of redundant and harmful bureaucracy that are keeping many Minnesotans from the health care that they've grown up to expect and they deserve. We look forward to the debate ahead, members. Also, I want to talk just briefly about the global budget. This budget seeks to spend less money than the Senate, less money than the governor, and we understand that. We also have a way to pay for our programs that they simply don't. We understand that moving forward, we're going to have disagreement about that and a disagreement about the priorities that we might have. But nothing can change the fact that the priorities of this side of the aisle always start with the most vulnerable Minnesotans and work their way out. And they connect back through middle-class Minnesota, who has been hit hardest by Obamacare and by the imposition of federal legislation in the last couple years. We can talk about that as well as the escalating costs that we need to get a hold of in Minnesota as well as every other state. With that, Mr. Speaker, I would welcome amendments to the bill.
Mr. Speaker.
Representative Thiessen.
Thank you, Mr. Speaker. I move that this bill be re-referred back to the Committee on Ways and Means.
Representative Thiessen moves that the bill be re-referred back to the Committee on Ways and Means
I'd like a roll call, Mr. Speaker.
and has requested a roll call. Seeing 15 hands, there will be a roll call. To your motion, Representative Thiessen.
Thank you, Mr. Speaker. Representative Dean just ended with the argument that he figured out a way to pay for this legislation. One of the ways that he figured out how to pay for this legislation was purported savings of just over $300 million from a public programs verification audit. $300 million was booked for that. We have a fiscal note that shows the savings for this biennium at $16,529,000. So that's a difference, members, and I should have done the math before I got up, of course, but of about $285 million. There's a $285 million hole in the spreadsheet in this budget. There really is no way that we can proceed with this bill tonight with that kind of hole. And I've distributed the fiscal note to the Speaker and to Representative Knobloch, Representative Dean, Representative Mack, and Majority Leader Pepin. We're getting copies made for everybody else. But members, there's really no way that we can proceed with this bill tonight with a $285 million hole in this budget. Now, this fiscal note is coming late, but I think that that's well explained because there was actually an earlier fiscal note on Representative Dean had a bill to do this, similar kind of auditing, eligibility audit. That found savings of about $15 million, even though it had been booked for significantly more. Representative Dean, in either his committee or in Ways and Means, actually changed the language and made the argument that the fiscal note didn't apply anymore because the language had been changed at a late hour. So the department has been doing work to try to fiscal note the new language, and that's what we just received relatively recently. So, Mr. Speaker, again, I just don't think that there's any way we can proceed with this bill tonight with a $285 million hole in this budget, and I would ask that people support the motion to re-refer it back to Ways and Means so that we can come up with a budget that is actually in balance and in accordance with the targets.
Discussion on the motion to re-refer. The member from Washington, Representative Dean.
Well, thank you, Mr. Speaker and members. Our bill has gone through the committee process. We didn't take all of the bills that we would have liked to have taken within this bill, and we certainly didn't include all of the provisions that we wanted to include because we wanted to go through the process. And one of the things that we have done is costed out the different portions of this. One of the things that's controversial is that the other side of the aisle says that Minnesota is doing everything it can do to make sure that we are finding every person who is ineligible for a program. We're making sure that we've done every single person who claims to be eligible for a program is getting funded and no one else. There's nobody else we can find. We are not paying for any procedures, any medicine, anything else. We are doing everything that we possibly can. We are unlike every other state in the country. I would direct members to the fact that Minnesota, we like to say that our health care is pretty good. Our women are strong, our men are good looking, our children are above average, and we're good at health care. The last one we're not exaggerating about. However, when it comes to looking for fraud, looking for waste, looking for abuse within the system, and you look at what we spend relative to other states, guess what we're ranked? Are we ranked number one when it comes to finding people who are ineligible, finding waste, fraud, and abuse? Are we 5, 10, 15, 20, 25, 30, 35, 40, 45. No, we're 50. We are dead last, okay? But the other side of the aisle says we are doing absolutely everything we can to pull money out of the system. We are unlike Pennsylvania, who pulled out $300 million. We're unlike Illinois. We're unlike all of the other states that have said that we're going to stop wasting money. Now, Representative Traskowski, Representative Pearson came forward with bills looking at pulling out waste, fraud, and abuse, and really focusing on waste by looking at examples in other states, and we calculated that we could do this. And here at the last minute, Representative Thiessen comes in with some phony fiscal note that just showed up at the last second. I'm unsure of that. We've never seen this before, but we're just supposed to take this as gospel truth. I'm wondering if Representative Knobloch would yield.
He will yield. Representative Dean.
Mr. Speaker, and I'm wondering, Representative Knobloch, you're the chair of the Ways and Means Committee. You've examined all the fiscal notes for our bill and for the budget and worked very closely with me through the entire process. Can you talk a little bit about the fiscal note that we've seen before you? And I don't know if you've had an opportunity to look at it or take a peek at it, Representative Knobloch, but fill me in on what you know.
The member from Sherburne, Representative Knobloch.
Well, Mr. Speaker, Representative Dean, you know, I appreciate the argument that Minority Leader Thiessen is bringing, but you've got kind of an unusual situation here. Yes, we normally go along with the fiscal notes that we are sent, and there's good reason for that. But the way the fiscal note process works is that the department is contacted to get information, to provide information, and give their views. However, in this case, we have a department that has for years and years and years been criticized by the nonpartisan legislative auditor for not doing their job in this particular area. And so there are, I've got a report that goes through April 2014 that I'd like to just read a couple conclusions from our nonpartisan legislative auditor. There's been another one since, but this one says, in concluding about the study they did, quote, the Department of Human Services did not ensure that medical assistance, Minnesota Care, and Children's Health Insurance Program recipients who enrolled through MNsure were eligible for the benefits they received. The department did not ensure that data accurately and securely transferred from MNsure into the state's medical payment system, and the department had many instances where it did not comply with the federal and state legal requirements related to recipients' eligibility for medical assistance, Minnesota Care, and the Children's Health Insurance Program. And so, members, we've got a department that has been criticized by the nonpartisan legislative auditor over and over again for years for not doing the work on eligibility that they should be doing. And now they come forward with a fiscal note saying, well, there's not a lot of money available if you look into eligibility. Well, I don't think that we really can give the department much credence in a case like this. We've got another State Department saying just the opposite. And if you look at the legislative auditor's report and drill down to it, the sampling they did is that 9% of all the people on medical assistance in this state, when they sampled them, were not eligible for medical assistance. Members of the House, we are projecting to spend $10 billion of state money, that doesn't count the federal money, state money in the next 2 years on medical assistance. If you took 9% of $10 billion, that's $900 million. Representative Dean isn't claiming $900 million, but members, I bring this up to say, and that doesn't count all the other programs either, but members, I bring this up to say that we've got a nonpartisan legislative auditor that is saying that the Department of Human Services, who is preparing these fiscal notes, is not doing their job. And so I guess if you also look at the other work that Representative Dean and his committee have done, the comparison with other states, what they've gotten from programs like this, members, I think that we've got to trust our nonpartisan legislative auditor in saying that the data they give us, which is where Representative Dean's numbers come from, are what we should trust.
Representative Dean.
Well, thank you, Mr. Speaker. And I would just wonder exactly what we're going to be talking about here if we're moving forward. Representative Thiessen, if he would yield, is this the fiscal note from Representative Pearson's bill? Is that what you're referring to? Because I don't think Representative Knobloch has seen this piece before. That didn't go back through the chairman of the Ways and Means or through me. We have seen fiscal notes for both Representative Drazkowski's and Representative Pearson's bills, which were very narrow focused in nature. Representative Drazkowski's, I believe, shows a modest savings in the first year and $145 million in the second biennium that we've constructed our numbers from. But to somehow say that this is a new fiscal note for this bill is purely trying to derail the conversation and trying to move the object, Representative Thiessen. So to say that this belongs with this bill is inaccurate, and I understand what you're trying to do, and I understand where you're going to go with the argument. We can talk about that tonight as long as you'd like to, Representative Thiessen, but this does not reflect the bill, and I think you know that.
Mr. Speaker?
Representative Thiessen.
Thank you. Didn't hear a question there, but I'll just take the floor then if that's okay. Representative Dean, in fact, this is the language, this is a fiscal note conducted on the language in your bill currently. I know you've continually tried to change the language of your bill, Representative Dean, but it actually addresses the language in your bill currently. You know, when people's voices rise like they just did and they don't actually respond to the facts, I think it tells you something, that they don't have a leg to stand on. This is a legitimate fiscal note based on the language in Representative Dean's bill. No one is saying that there's not fraud that we can root out of our system. In fact, this fiscal note says $16 million in this upcoming biennium. It says $142 million in the next biennium. That's not nothing. No one in this body is saying that there's not fraud that we can root out of the system. What we're saying is you ought to follow what the fiscal note says. That number that Representative Knobloch was talking about, if you actually talk to the legislative auditor, which I said, he said no one should be using the report that Representative Knobloch cited the way Representative Knobloch is using it. He said that to me, and he said that, if you would have asked him, he would have said that to you, Representative Knobloch, because that's actually one of the reasons is that it's actually talking about mistakes that were made to the positive and mistakes that were made to the negative. It's also focused on a very narrow, it's not the $10 billion you were talking about, because most of that money, as you know, goes to nursing homes and PCAs and long-term care. It was focused on the medical side, which is a much smaller number. What we know is that you just pulled the number out of the air, the $300 million number. That was just a number that was made up. And Representative Dean, to accuse me of coming up with a phony fiscal note, this is a legitimate fiscal note coming from MMB. So I hope that you apologize for that accusation now that you're standing up again. The bottom line, members, is that the Illinois example for, which was claiming $300 million in savings, they hired someone, paid him a contractor paid him $9 million, and they found $12 million in savings. So they did get on net $3 million in savings, although they were claiming they were going to get $300 million. If that's the example you're relying on, I think we need to check the facts on that. But that's all really beside the point. The point right now is that we have a fiscal note that shows a $16.5 million savings in this biennium, $142 million savings in the next biennium. The number in the spreadsheet that you're supporting your budget with shows $300 million. Now, a fiscal note could be off by half. A fiscal note could be off by 4 times, maybe. A fiscal note could be, or a quarter, I suppose, however you want to look at that. A fiscal note could be off, by 6 times, maybe. Is a fiscal note going to be off by $270 million, multiples at like 20 times? I don't think so. So if you want to quibble around the edges about this, that's fine. But this fiscal note very clearly says, if you're going to go forward with this, it really gives the lie to what's been going on. Representative Knobloch did the right thing when House File 2 first came up before this body. If everybody can think back to that. When House File 2 came up, We got a fiscal note on that House file. Even though it was going to be on the floor and was important to move forward, Representative Knobloch said, let's take this back to Ways and Means so that we can deal with the issue, so that we can understand what's going on. We now have a fiscal note. Even if you disagree with the fiscal note, you have to take it back to Ways and Means to at least understand where the fiscal note is coming from and how it differs from the number you came up with. Even if you ultimately say this fiscal note is wrong and the number in our spreadsheet is right, you have to take it back to Ways and Means. You did that on House File 2. It's unfortunate about the timing of this, but again, the timing has to do with the fact that the language has changed time after time. Those two bills that Representative Dean talked about, that's not the language he put in the ultimate bill here to try to find a way to justify the $300 million. We now have that fiscal note. Members, if there's going to be any integrity in this body, if there's going to be any integrity in the budgeting we do, we need to send this bill back to Ways and Means. You can have the hearing tomorrow. You can pop the bill back up, and we can move on with this. But we need to understand the difference here. So, members, again, I would urge a yes vote.
The member from Washington, Representative Dean.
Thank you, Mr. Speaker. Well, members, I think now that we're starting to look at it, it's some truth is starting to rise to the surface from what Representative Thiessen has brought out at the last minute as a last-minute fiscal note just arriving somehow minutes before the floor session. Actually, that is coming from the Senate. Also, I think that's important to know, first of all. Secondly, this deals with Section 34 of the bill and ignores the majority of the dollars that are going to be collected, which are in 35. Doesn't even address collection at all whatsoever, which is where we intend to have the majority of these savings coming in. And this is nothing new. This argument is nothing new, that there is nothing under the sun, according to some people, that you can find if you go out and look for money that's being wasted within our Medicaid system. I can tell you this, Minnesota is not unlike the other 49 states. Medicaid is eating our budgets. It is growing unsustainably, and we can't have this kind of waste, fraud, and abuse within the system. I was over the Easter break. I listened to Reagan in his own words, and in 1980, Ronald Reagan said that he was making the same arguments. And he said, you know, I get pushed back all the time when we go out looking for waste, fraud, and abuse in our medical system. And he said, you know why it's so hard? Because hard to find it. You know why it's so hard to find waste, fraud, and abuse in medicine? Because you got to put on your hat and coat and go look for it. That was true in 1980, and it's true today. What this does, this fiscal note, members, it completely ignores the section of the bill that actually collects the money. It's from the Senate. It's at the last minute. I anticipate that we're going to have this discussion a little bit more because I saw a unicorn amendment from Representative Liebling. We're all going to learn that a group of unicorns is called a, what is it, Representative Liebling? Is it a pride or a gaggle? What is it called? A cherish? Okay. We're going to talk about that later. I understand that. Understand that you don't want to go out and find waste, fraud, and abuse within a system. You want to make fun of it. You want to say it's not real. But members, let's move on. Let's have the discussion, and let's go forward.
The member from Olmsted, Representative Liebling.
Mr. Speaker and members, Representative Thiessen did a great job explaining what I needed to say about this bill, but I do want to respond to Representative Dean in his continued assertion that Democrats believe that there's nothing to be found in waste, fraud, and abuse. Every member of his committee knows that that isn't true. And I really resent, on behalf of all the members, I resent the mischaracterization of that. We all said, yes, we do want to go after every wasted dollar. Not one member in that committee, and I would say that not one member on this floor wants to waste $1 of public money that should be going for health care for a person who legitimately is eligible for it. We all agree with that, Representative Dean, and you know we do. You absolutely know it. And you absolutely know that the Commissioner of Human Services agreed that it would be fine to go out and hire a vendor And even she says, yes, everyone knows that we're not getting at all of the fraud, all of the ineligible people who might be on our programs. We all know that. So don't use that straw man argument. That is absolutely unfair and absolutely disrespectful of every member in this body to say such a thing. You can't say that, Representative Dean. You know it isn't true, and every member of your committee on both sides of the aisle know it isn't true. And the issue here is how much we can find. That is the issue. That is the issue, and you have never answered the question of how you came up with the money, with the dollar amount in this spreadsheet. And you've been asked repeatedly, and you've never been able to explain it. And in the Ways and Means Committee, I asked you for details, and you have given us none. And so finally we get a fiscal note that at least gives some detail. And as Representative Thiessen said, you can argue and debate about the detail in that fiscal note, but to just stand here and impugn the integrity of all of the members by saying that we somehow don't agree that we should ever go look for fraud and that we think that everything's being done that can be done, that is absolutely, absolutely unsupported. And I hope that you would respect the members of this body after giving that wonderful opening statement about how wonderful we all were and, you know, all the members of your committee, and then to impugn our integrity in that way, I think it's absolutely disgraceful.
The member from Sherburne, Representative Knobloch.
Well, Mr. Speaker, members of the House, first, let me say it is an unusual situation for us to say, no, we don't believe this fiscal note. And you're right, Representative Thiessen, earlier this year we had a case come up where with House File 2, right before we were bringing it up, we had a fiscal note suddenly show up for almost $1 million, and we did take it back to committee. We were really shocked. We had done a little bit of research and had expected there was going to be no cost at all. And interestingly enough, members, after we talked to the department and talked to them further and examined the fiscal note, that fiscal note eventually went down by about 60%. And so, you know, it started out high, it dropped about 60%. In this case, though, this is an issue that we have been looking at 3 months. We had a major hearing in the Ways and Means Committee back in January on this very issue. We had the Department of Human Services in. We had the legislative auditor in. We've been working on this issue and talking about it for 3 months. It's not something that we just pulled out of the air right now. And members, while it's not commonly done, I think members know that, or at least senior members know that fiscal notes are advisory only. And here you have a case where, yes, you have a department that gives a low fiscal note, but then you've got the Office of Legislative Auditor, a nonpartisan institution that has been criticizing the Department of Human Services for years for not doing their job on this issue. And if you get into the details of it, members, I think you'll find that there's a lot more money here. Representative Thiessen talked about, I guess, some of the things that the legislative auditor said to him. I haven't had those conversations with the legislative auditor, Representative Thiessen. I wonder if maybe you misheard something. One of the things I know the legislative auditor had said is that actually, if you look at the report, 17% of all the people on our state's public health programs are on the wrong program or shouldn't be on a program at all, according to the legislative auditor's report. Now, I have to qualify that by saying in some cases they should actually be on a better program. In some cases, they're on MNsure, and they should be on medical assistance. They should be on a better, more costly program. But if you go through and drill down into the details, in the vast majority of cases, or in a large majority of cases, they're either A, just ineligible for a program, or shouldn't be on as good of a program as they are. And we're not interested in kicking people off programs that are supposed to be on those programs and qualify for them, but we are interested in saying that if you don't meet the qualifications for the program, maybe you got on the program and maybe you were eligible when you got on it, but then things improved for you, your income got better, you no longer qualify, those sorts of people should no longer be on the program. And so, members, this is an issue that has had numerous hearings. We've got state agencies in conflict. Members, we are not required by law to take the fiscal notes as gospel and putting the budget together. And In Ways and Means, we chose to accept this as a number and pass the bill out. And so, members, there's no need for this bill to go back to Ways and Means. I'd urge you to vote no.
The member from Hennepin, Representative Thiessen.
Thank you, Mr. Speaker. Well, I can see, I suppose, where this is headed, although I hope that the members on the other side of the aisle do stand up for the integrity of the process here. In fact, I can guess Representative Knobloch would like to too, but he understands the situation he's in. Here's the deal. It did arrive from the Senate, but it's a DHS, it's a traditional fiscal note like we always get. The only reason it arrived from the Senate is because Representative Dean and Representative Knobloch wouldn't request a fiscal note on the language that's actually in the bill, and when we tried to get the fiscal staff to get the fiscal note, staff from the House Republican caucus told them, no, do not do a fiscal note. That should tell you something, members. The fact that your staff actually instructed the fiscal staff not to do a fiscal note on this language should tell you that they know it's wrong. It's a cover-up. This is the absolute worst kind of lawmaking that we can be doing. And even Representative Knobloch, to say that the legislative auditor has come up with a fiscal note, I mean, that's baloney, and you know it. The legislative auditor does not put a number in that report. You know that to be the fact. And the other reason that this fiscal note is where it is because you're getting rid of Minnesota Care. One of the things that the legislative auditor focused on was the Minnesota Care program. Since we're taking Minnesota Care and putting it into MNsure in your bill, throwing lots of people off of health care as we go, you can't find any more fraud and abuse in Minnesota Care because it's not going to exist under Representative Dean's bill. Right? So let's get back to reality here. Representative Knobloch, you know that with a fiscal note deviation of this much, no time in your legislative career, whether it's the last 2 years, and I'll tell you, it didn't happen over the 8 years you were gone, and in the 14 years before that, before 2006, there has never been a deviation from a fiscal note to this extent. Actually, there might have been in 2011 when Representative Abler brought his bill to the floor. But aside from that, there has never been a deviation from a fiscal note to this extent. Hi, Jim. So members, we have a fiscal note from the department. It came through the Senate, yes, but only because House leadership wouldn't allow a fiscal note to come forward. Again, that should tell you something. And this fiscal note says $16 million in this biennium, $142 million in the next biennium. It doesn't include Minnesota Care because the bill gets rid of Minnesota Care, which is where most of the legislative auditors' points about finding fraud were found. And you have $300 million this biennium. You're off by $285 million. You're off by 20 times. You know that this bill has to go back to Ways and Means, at least to understand the fiscal note. Oh, and to Representative Dean's other point, the fact is his language in Section 35 calls for the department to do what it's already doing. There's no difference there. So you at least have to take it back to Ways and Means. You can actually go back, well, you'd have to call the meeting tomorrow, I suppose, but get this bill back out and we can get this work done, but at least we'll have some faith in the numbers we're working with. I would urge the members to vote yes to refer it to Ways and Means, and let's do this the right way.
Representative Hillstrom.
Thank you, Mr. Speaker and members. And members, I first started questioning the numbers that were in the bill in Ways and Means. Members, I actually have prosecuted welfare fraud cases. So as we were sitting in Ways and Means, I asked Representative Dean questions about the $300 million that he was booking in savings. Because one of the things that I know about some of these welfare fraud cases is that it's not just state money that they're taking, it's also federal money. So I was very concerned that the $300 million might actually be $600 million in savings that you have to get from the state. So I asked Representative Dean if he was planning to get the money in savings by putting people off the program that they're not eligible for, or if he was actually counting savings in money that he thought he would recover from folks who had committed welfare fraud. And in fact, he said that $300 million was the number for both. Well, members, as someone who has prosecuted these cases, I can tell you that it takes a very long time to recover the dollars from people who have committed welfare fraud and then are ordered to pay restitution as part of a criminal matter. It takes a very long time. And the federal government, they get their money first. The federal government gets their money first. So as Representative Dean is booking $300 million, and we're hearing that the fiscal note is for much less than that, what Representative Dean is actually booking is $600 million. Members, I said it was fuzzy math in Ways and Means. I still think it's fuzzy math. And now that we have a fiscal note, I know it's fuzzy math. And members, I think it should go back to Ways and Means.
Representative Loeffler.
Thank you, Mr. Chair. Members, the statement was made on the floor that we had many hearings on this, and we did not. We did not have many hearings on this. And as has been said, the proposal kept changing, and we kept trying to keep up with it. And we kept asking for models. And the models that were given were Illinois, Pennsylvania. And so I looked not just at what is in the press, and it's pretty damning what comes out of some of the information about how it's worked in there, but I went to the source because I felt like we really need credibility here. The Center for Medicaid and Medicare Services does a Medicaid program integrity audit of every single state. And I went to their audits of Pennsylvania, of Illinois, of another state that NSCSL thought was pretty good. Not a single one got near $100 million. And these are with federal auditors who have actual targets. I mean, they actually have performance targets of how much they're supposed to find. And they could not find this in the audits that they sent out, totally objective, to see whether or not there was full compliance with federal requirements on both eligibility and program payments. So this is based on the federal auditors as well as the information that we've gotten from MMB and the Department of Human Services.
Any further discussion?
Mr. Speaker.
Representative Dean.
Thank you, Mr. Speaker and members. I would just like to respond to Representative Thiessen. Actually, we're not doing Section 35 as other states have done, where you hire an independent contractor to come out and look for what we're doing that we shouldn't be doing. And for some folks, that means that you're on a program for which you're ineligible. And the legislative auditor's report showed that we have a backlog of unchecked cases in the state of Minnesota, where we have people that we haven't checked for not just months, but actually over a year in queue to check to see if they're eligible. And we don't have any way of knowing whether they're eligible or not. So that if you have a life-changing event, let's say you have a part-time job and you make $12,000 a year, then you get a full-time job and you're making $57,000 a year, and you don't let them know that might not be enacted. That's one form of eligibility. Another form of eligibility might be on a program for which you no longer qualify because your status has changed, because your family's changed, or your health conditions changed, something else. But that's not the end of it. We had a PCA audit that showed that we have rampant problems within that, where we have people being billed for more than 24 hours of service in a day. That's a problem. That's a problem when you deliver a generic drug and you bill for a frontline drug. That's a problem. It's a problem if you receive hospice services after you are dead. You probably don't need them anymore. That's a problem. We need to start looking for these, and this is what the audits have found in other states, and that's where we collection. And it's not just about the money. It's also about people who are waiting in line to receive these services. Every single dollar that we have, whether it be in Medicaid, Medicare, Minnesota Care, all of our programs are scarce dollars that could be used for someone else. The needy should never be in line behind the greedy, and that's what happens too often in the state of Minnesota and in every other state. This seeks to go after those dollars and collect them. This has outside vendors that come in and do that for a fee, so there's no upfront cost to the state. That's a win-win, and it's something that we should do. If it didn't cost a dime, or it didn't save a dime, we should be doing it anyway, because we could be providing more services with those scarce dollars. With that, Mr. Speaker and members, we've asked the department to do this for years, and they are not doing it. They are saying they're already doing everything they can when the facts show that we're 50th out of 50 states. So that's not an area where I want to be, Mr. Speaker and members, and it's not one that we should be. And I think we would all agree that we need to collect those scarce dollars, whether you want to spend them on programming or on K-12 or another budget item. We should be collecting them, and we should be saving these scarce dollars.
The gentleman from Hennepin, Leader Thiessen.
Thank you, Mr. Speaker. Just a few last things here. First of all, I have read Section 35, Representative Dean, and what it requires is the Department of Human Service to go out for a request for proposal for a contract to use technically advanced software and services to provide identification of these items. They'll have to actually bid that contract. I don't know when you think that contract's actually going to come into place and we're going to get that technology into place, but it certainly doesn't sound like it's going to be immediate. And I think that that's one of the reasons under this fiscal note that we're in this situation. To go back to PCAs, you know, that came out several years ago, and we actually took Representative Larry Hosh took some very serious action to crack down on the fraud from that audit report. And importantly, we didn't book the savings from that until we actually knew what was going on and we were able to understand how we could change the program. So it wasn't like you're wishing on a prayer that you're going to get some savings. We actually figured out what was wrong with the program, and then we could book some of the savings. And Representative Dean, you're right. It's not just about the money in terms of the overall policy here. We should be looking for fraud and abuse wherever we can. We should be doing that. But for purposes of this motion, members and Representative Dean, it is all about the money, because what we're talking about is a fiscal note that doesn't match up. So we can wax eloquently about the need to do this work. I think we all agree with the need to do this work. But today, you're booking $300 million in savings in your bill, and you have a fiscal note that shows $16 million in savings for this biennium. There are significantly more savings in the next biennium as perhaps Section 35 ramps up and some of this other work ramps up. But right now, you have a $285 million hole in your budget. I don't ever remember us passing a bill off the House floor, members, with a $285 million hole in the budget. If you're a fiscal conservative, do you really want to pass a budget that has a $285 million hole in your budget? Is that what a family would do when you're doing a family budget? You know, of course, most families aren't going to have $285 million hole in their budget. Hopefully not. But when you're budgeting, would you do a hole in your, if you're estimating that you're going to get a $3,000 check in the mail, for instance, and it turns out that you're only going to get a $160 check in the mail. That's what we're talking about right here. You wouldn't say, well, I'm going to spend that $3,000 because for some reason I think that that's what I can get. You're going to spend, that family is going to spend the $160 that you know you're going to get. That's what we're talking about right here. If you want to talk about family budgets, that is the exact analogy. So members, there's no way that we should, and I think every other legislature probably in the history of Minnesota would send this bill back to Ways and Means to understand this fiscal note, to understand the difference between the $300 million in your spreadsheet and the $16 million in this fiscal note. Go back to Ways and Means, understand that. Maybe you'll come back and understand the fiscal note was in error, maybe by double, maybe by 4 times. You can adjust your spreadsheet, and we can proceed with a real bill. So members, I again urge you to vote yes on the motion. Let's do the right thing. Let's do what every other legislature in the history of Minnesota has done and do the right thing here.
Mr. Speaker.
Discussion on the re-referral. The gentleman from Washington, Chair Dean.
Thank you, Mr. Speaker and members. Just to correct one thing from Representative Loeffler, Pennsylvania actually has about 385 backlog cases, and we have 600,000. So just to give you an idea of the sample difference between Pennsylvania and Minnesota, they were able to save $300 million, and they have actually fewer unchecked cases. We're not saying that we would be able to do this every year forever. We understand that the savings would be the most in the first couple of years, and then they would trail off. But members, I think these savings are realistic. They're aggressive, but we need to be aggressive, and we need to be able to get these savings, members. I would ask that you reject the Thiessen amendment, or excuse me, motion to send this back to Ways and Means. I know we have several other amendments that kind of get at this, so we'll probably be continuing this discussion, but I look forward to that discussion, and I would ask that you vote against the Thiessen amendment.
The gentleman from Hennepin, Leader Thiessen.
First, Mr. Speaker, I'd like to call the House.
Call the House. Seeing 10 hands, there will be call the House. Clerk will take the roll. The clerk will close the roll. The gentleman from Hennepin, Leader Thiessen.
Thank you, Mr. Speaker. Just a couple more things here. To kind of look at some of the other states that have been thrown out and talked about, you know, Illinois again. I was actually wrong. They've actually paid $35 million to the contractor to get savings. And the other thing that is not accounted for, I think in the number Representative Dean said about Pennsylvania, which actually comes from an organization called the Heartland.org, which is a conservative, political conservative organization. If you actually go to the state of Pennsylvania website, the savings on the actual state of Pennsylvania website are significantly less than the Heartland report actually reports. But and it doesn't account, and this is important, for the 200 additional caseworkers they had to hire in Illinois to actually process these eligibility determinations. And I imagine there's going to be an equal number in Pennsylvania of people they had to hire, incurring tens of millions of dollars of more cost, because you actually have to have those eligibility workers to process these. That's at least what happened in Pennsylvania and in Illinois. Costs that aren't accounted for either in this bill or in the numbers that have been thrown around tonight. We can have a long debate on the merits of this issue, members, and go back and forth. I could ask Representative Dean to explain the actual rationale he had for coming up with $300 million, that specific number. When he was asked in committee repeatedly, he couldn't come up with any explanation for that. So I'm not going to ask him to yield on that. What really matters, members, tonight is we have a fiscal note that says $16 million. We have a spreadsheet that says $300 million. That should answer this question for every single person in this room. This bill has to go back to Ways and Means. Perhaps it's unfortunate, but that's how we do business here. So members, let's do the right thing, vote yes, and send this bill back to Ways and Means.
Discussion. The gentleman from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Would Chair Knobloch yield?
He will yield. The gentleman from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. And Chair Knobloch, you describe fiscal notes as advisory, and as you know, I'm new here, so can you explain to whom are they advisory? I gather, rather than binding, I gather your committee Ways and Means?
The gentleman from Sherburne, Chair Knobloch.
Mr. Speaker, Representative Pinto, yes, or advisory to the body.
The gentleman from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. And I gather from your answer, I guess both the body and, but the Ways and Means Committee is included in that in terms of providing advice to the Ways and Means Committee, if the gentleman will yield again, Mr. Speaker.
He will yield. The gentleman from Ramsey, Representative Pinto.
Mr. Speaker,
gentleman from Sherburne, Representative Knobloch.
Mr. Speaker, Representative Pinto, yes. I mean, it is, I think, out of the ordinary that we wouldn't use the fiscal note number, and I freely admit that. But in a case like this, where we've got another agency that has consistently criticized the Department of Human Services, for the reasons I talked about earlier, I felt it is justified in this case. And if you could just indulge me, and if people have their computers, they can look at this themselves. If you go to the Office of the Legislative Auditor and you look at their most recent report that came out March 24th, 2015, you can look at page 15. And here's an interesting quote. It says, because the file matches identify many discrepancies, about 346,000 during fiscal year 2014, we have been skeptical about the diligence of county workers' resolution efforts. And members, I'm not saying this to beat up on the Department of Human Services so much as to simply say we've got another agency that is saying that the department has not been making the efforts that they should be in this area for a long time. We did have Representative Loeffler, a very extensive hearing on this in Ways and Means. Members, I guess, I don't know, I want to you know, Representative Hillstrom, I don't think that we're really planning on getting a lot of money out of going back and trying to get money from fraud so much as just taking people that are no longer eligible and not paying out the benefits if they're not eligible anymore. But anyway, Representative Pinto, to your point, yes, it's unusual that we wouldn't take the fiscal note, but in this case, I think there's good cause to use a different number.
Gentleman from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. And I guess my point, Chair Knobloch, and to the body is not so much whether the fiscal note's advisory or binding. And in fact, let's just assume it's advisory. What I understand you to be saying is that it's advisory to the Ways and Means Committee, among other bodies. And here, members, is the point. The Ways and Means Committee cannot consider the fiscal note, cannot consider the advice, cannot review the advice, cannot reject the advice or accept the advice unless it meets. It's before the Ways and Means Committee. So regardless of the individual views of the chair of the Ways and Means Committee, it seems to me that you can't receive advice if you don't meet and review the advice and then decide what to do with the advice. So I guess I consider from the remarks of the chair that if these fiscal notes are advisory to the Ways and Means Committee, in order to receive that advice, Ways and Means needs to meet, and I would expect that Chair Knobloch and the other members of the body would be voting green on this to allow Ways and Means to consider and perhaps reject for very, very good reasons or accept the fiscal note. And so thank you. I hope we all vote green.
Further discussion. Representative Gruenhagen.
Oh, thank you, Mr. Chair. Thank you, members. You know, I have some concerns about the $300 million, okay? But, and I think some of the criticism is probably, you know, appropriate. But members, I just point you back to the MNsure projections on the fiscal note, okay? If we look at MNsure, as far as the cost of the website, the number of enrollees, and the missed and completely fraudulent estimates that we had, you know, we were supposed to have, I think, over 30% private enrollees on the MNsure site. Well, based on the latest numbers at the end of April, it's at 12%. And there's a tax on those private health insurance plans that are supposed to pay for the MNsure site. And now MNsure, after spending $140 million, has come back and say, we need another $111 million. Not only federal money, but another $11 million from the Minnesota taxpayers. You know, members, there was an article in the Minneapolis Tribune that said, what's the definition of madness? We spent $140 million on the MNsure website. We're about to spend another 89, and now that request, according to the HHS committee, was actually $111 million. And it says, you know, it's good money after bad. And what do we have to show for it? We have a mediocre MNsure website and an IT mess and a Department of Human Services pouring millions more down the same path. Now, members, you think, well, that's just your opinion. Well, according to the Minneapolis Tribune, that's a MNsure board member who said that. The MNsure website and the MNsure system is a disaster by any way you measure it. It's no longer sustainable and affordable. And as far as the fiscal note, if we look back at Obamacare, we see the same type of fraudulent claims being made. Premiums would go down by $2,500 for the average family. The next 10-year cost is $969 million. No, it's over $2 trillion, members. So,
Mr. Speaker, what order of business are we on?
Representative Dean, for what purpose did you rise?
Point of parliamentary inquiry.
State your point.
What point of business are we on?
We are on the re-referral, and I think Representative Gruenhagen is about to finish building his base.
Thank you, Mr. Speaker. Just in conclusion, I have a lot more faith in the $300 million than I do in the estimates that were put into MNsure or Obamacare. And I'd vote green members on this, or vote red members on this recommendation. Thank you, Mr. Speaker. Members.
Discussion. The gentleman from Washington, Representative Schoen.
Thank you, Mr. Speaker. Would Representative Gruenhagen yield to a question?
He will yield. Representative Schoen.
Representative Gruenhagen, you seem to express some discomfort with the difference in numbers. You spent 16 years on the school board. If a superintendent came to you with that big of a discrepancy, then what would you do? Now, I understand that you're kind of a fan of the Affordable Care Act, and you don't like the numbers there, but does that make these numbers right?
Representative Gruenhagen.
Well, thank you for that question, Representative Schoen. You know, I just figured out the $300 million versus the total state expenditure, and I think it's 2.7%. Now, I know a large part of that goes to nursing homes, but 2.7% of according to the spreadsheet I have here, of over a biennium budget of $11,285 million, if I'm reading that right, HHS budget for 14-15. So as a percentage of the total we spend, I'm also hoping that the audit will expose areas that we can reform and save additional money. So yes, Representative Schoen, I am comfortable voting no on this motion.
Gentleman from Washington, Representative Schoen.
Mr. Speaker, and if Representative Gruenhagen would yield one more time.
He will yield. The gentleman from Washington.
Representative Gruenhagen, just to clarify, so you're okay with the discrepancy of $285 million, roughly?
Representative Gruenhagen.
Oh, thank you, Mr. Speaker. Representative Schoen, I am comfortable as a percentage of the total, and again, I believe that this audit will expose other areas that we could save money on, and I urge members to vote red on this motion. Thank you, Mr. Speaker.
Gentleman from Hennepin, Leader Thiessen.
Thank you, Mr. Speaker. Well, I was disappointed to hear Representative Gruenhagen rise because he was nodding along earlier as I was talking, so I thought we were going to get him. But I would note that the people that actually provided those numbers for MNsure, if I recall correctly, was Maximus, which is exactly the contractor that you want to bring in to do this auditing. So the people that you're criticizing for their numbers are the ones that are actually going to be called in to do this audit. So if you're not comfortable with those numbers, you ought not be comfortable with these numbers. Do I have you now? Here's the deal, members. We're back to the very beginning of this session, where, if I recall, Representative Knobloch said that fiscal notes should be based on his feelings. Right now, we're having a fiscal note. There is no fiscal note. There's no analysis that's been done for this. No one on that side has stood up and said, we've done an analysis. You point to an OLA report that does not do an analysis. That's about it. Again, we're going on Representative Knobloch's feelings. So if that's going to be the case, Mr. Speaker, and when Speaker Doubt comes back, I hope that when we offer our amendments on this bill, if you vote no on this, no one on that side rises to a point of order that those amendments are out of order. Because you have totally lost, if you vote yes, or no, and I hope you'll vote yes, you will have totally, in fact, I hope that you don't rise to a point of order on any amendment we bring to the House of Representatives for the rest of this session. Because what you're saying right now is that $285 million is the margin of error we can have on our fiscal notes. That's what you're going to be voting for right now if you do not send this back to Ways and Means to take a look at this. So I hope to God we don't, because that is the argument we're going to be making with the Speaker every time you rise under 4.03. So members, please, let's do the right thing. Let's preserve your ability to govern. And let's vote yes on this motion. We can easily send it back to Ways and Means. They can hear it. We can get this done and still get out of session in plenty of time. Members, in fact, I think we'll get out of session more quickly if we actually have numbers, a bill that's based on real numbers. Because if you recall 2011, the reason we went to shutdown is because there was incredible amounts of fake money built in the Republican budgets. We're seeing it again. Now is your chance to fix that and avoid a shutdown, avoid a special session and a shutdown.
The lady from Dakota, Chair Mack.
Thank you, Mr. Speaker and members. Just a point of clarification on the numbers that Representative Gruenhagen was referencing when we were looking at the MNsure estimations that we got 2 years ago. Members, that was not a product of Maximus. That was a product of a $600,000 contract to Gruber and Gorman for grossly underestimated numbers, and someone who since then has publicly said that the Affordable Care Act had to be written in a way to confuse the public and what he called a dumb electorate. And so I think it's important that we don't skew the facts and throw a contractor into a situation that they had nothing to do with. It was Gruber and Gorman that those numbers came from, and I think that's an important clarification for people to know.
Gentleman from Cottonwood, Chair Hamilton.
Well, thank you, Mr. Speaker. And the fiscal note in question, it only responds to a portion of the entire bill. It doesn't respond to the whole bill, and it appears that we're trying to create a phony argument around this. And typically, when we ask for fiscal notes, they don't take 2 hours in order to get them back to us. They take about an average of 8 days. So I don't understand where the concern is coming from as far as it pertains to this fiscal note. Thank you, Mr. Speaker.
Representative Lilly.
Mr. Speaker and members, Representative Hamilton, I can tell you why this matters, because a lot of that money goes to helping our nursing home program around the state of Minnesota. So are these numbers real or not? I just wonder if I could ask Mr. Baker, Representative Baker, to yield.
The gentleman will yield. Representative Lilly.
You know, earlier in the session, we had an opportunity to, you know, I grew up in a media family, and I was following what was going on in the news, and you had a pretty good quote about, you know, how we should go back home or whatever, and just, you know, if we don't fund nursing homes, if we don't take care of the people, I think you had pretty strong words that said, you know, we all should be ashamed of ourselves. So that's why Representative Hamilton, that's why these numbers matter, because it's going to go to people. Most of it's going to go out state Minnesota. In your districts, I got the runs right here, and they clearly say where the money's going, and a lot of it's not going into my district, but so it matters. I think I'll pass it this time on Mr. Baker, but I think it's pretty clear what he said, and I actually think it's something, I actually agree with him. We all can do better. These numbers matter. I think we should send it back, and we can bring it back real quick. We got a lot of time, not a lot of time, but we have enough time.
Discussion on the re-referral. The clerk will take the roll. Members, the House is under call. Clerk will close the roll. There being 62 ayes and 72 ayes, the motion for the re-referral is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Keel moves to amend Senate File 1458, the second engrossment, and the amendment is coded A18.
Representative Keel to the amendment.
Thank you, Mr. Speaker and members. Amendment A18 is intended to achieve a safety standard for abortion facilities that we expect in our outpatient surgical centers. Women seeking to help for an abortion expect to find safe and a comforting place, looking for advice to confirm a pregnancy, and then looking to terminate a pregnancy. They seek out help from the abortion facility. Already stressed and emotional, these women and young girls assume that this facility has been licensed by the state. Abortion is an invasive surgical procedure that inherently poses significant medical risks. In 2013, abortion providers reported 65 abortion-related complications to the Minnesota Department of Health. They included cervical laceration, uterine perforation, hemorrhaging, infection that required inpatient treatment, and an incomplete abortion that also required re-evacuation. Over the last 5 years, for which data is available from 2009 to 2013, a total of 540 complications for abortions were reported in Minnesota. Minnesota ought to ensure its safety of its citizens. That's why the state regulates facilities ranging from hotels and nursing homes to cosmetology salons and tattoo parlors. Women entering abortion centers, where the vast majority of abortions occur, should not be excluded from such protections. Yet abortion facilities in Minnesota are neither licensed nor inspected in any state agency. Women deserve better. Members, I would ask you to consider making sure that we provide safe and secure places for them to seek help. Mr. Speaker, with that, I would ask for a roll call on this vote.
Roll call. Having been requested are the 15 hands, seeing 15 hands, there will be a roll call. There is an amendment to the amendment. The clerk will report the amendment to the amendment.
Loeffler moves to amend the Keel Amendment to Senate File 1458, the second engrossment. The amendment to the amendment is coded A61.
The lady from Hennepin, Representative Loeffler.
Thank you, members, and Mr. Speaker. The A61 amendment deals with the heart of this amendment that Representative Keel has brought to us, which is to require these facilities, if they do 10 or more abortions, to invest hundreds of thousands of dollars into physical upgrades that would not address the concerns and the complications that she just outlined for you. And we can all be respectful of the fact that people have different views on the topic of abortion. But we should look to have accurate information when we're making choices about the requirements that are involved. And we heard testimony in committee that the requirements for a surgical center would require currently operating services to spend up to $800,000 for one facility just to meet requirements that would not address any of the things that were just addressed. They would have to add men's and women's restrooms in their waiting room area, even if there is men's and women's restrooms down the hall. They would have to widen their hallways. They would have to make a change to their janitor's closet. They went through with a contractor what would be required. None of those would prevent the kind of complications that were just described that can happen in any medical procedure. The complication rate for abortions is less than 1%. If we were sincere about protecting all women and we felt like this was really going to protect them, we wouldn't allow abortions to take place in any location other than this, but it makes an exception for someone who performs less than 10 a year. And Mr. Speaker, I think we need to show respect to the people who offer this legal service, to people whose faith, whose own medical circumstances leads them to seek this, but not put up obstacles that are unnecessary and won't truly result in improved health to the women who seek this legal service in a variety of different circumstances. This amendment is paid for with a revenue source that is perhaps not the best match, and with that I'm going to withdraw it, but I did want people to understand that this proposal is in Minnesota proven to be safe, and in the current facilities, and that none of the complications that have outlined would have been changed by having wider hallways, a better janitor's closet, or men's and women's restrooms immediately in the waiting room. Thank you.
Representative Loeffler, did you withdraw the amendment? The amendment has been withdrawn. To the Keel Amendment, Representative Lane.
Thank you, Mr. Speaker and members. Well, there's a shared goal underlying this amendment, a shared goal for the reduction in the number of abortions. On that note, I want to remind members that across the board, across all ages, all races, marital status, education, The number of abortions has gradually and continually decreased in Minnesota since the mid-'80s. But back then there were about 16,000 a year, and in 2013 there were 9,000. That's impressive. That's nearly a 50% drop, gradually and continually fewer across the board. I would suggest that this decrease has to do with access to contraception, education and access to contraception. Yet there remains a need for safe, legal, and accessible abortion. We have the safe down pat. The complication rate for abortions in 2013 in Minnesota was 0.006%. It's safer than a shot of penicillin or a dental extraction. This bill does nothing for the safety or the health of women. We already have that covered. It seeks to regulate abortion providers like surgical centers. Surgical centers do hip replacements, total knee replacements, removal of gallbladders, eye surgery, carpal tunnel, shoulder surgery, usually with general anesthesia. So these centers have fancy operating rooms, regulated prep rooms, regulations around the widths of hallways, janitor closets, bathrooms, etc. And so these are costly infrastructure requirements that have nothing to do with the safety for an abortion procedure. As I said, it's safer than a dental procedure and has a 0.006% complication rate. No, this bill isn't about women's health. This bill seeks to restrict access to abortions by seeking to close down the providers. But restricting access does not affect demand. It just forces women to travel further and denies those with the fewest resources access to safe services. We didn't have safe services back in the days that most of you here can't remember. I do remember the stories that were back then in pre-1973, and we do not want to return to that. Yet across the nation, as bills like this seek to eliminate providers of abortion, we are experiencing an uptick in the emergency ward doctors dealing with the complications of illegal abortions. Wrong direction, members. I want us to return to our shared goal, a reduction in the number of abortions by reducing the need, not a reduction in safe abortions, as this bill is a red herring pretending to be about safety and the health of women by requiring abortion providers to meet unnecessary and overburdening costs and using the restrictions of major medical centers, surgical centers, but in fact it is actually a cut in the access to safe and legal abortions. Members, we have gotten it right in Minnesota. We have provided very well for the health of women, and we have reduced the number of abortions steadily over the years. This bill would take us backwards. I'm well aware that most members already know how they're going to vote. I just ask you to consider our real goal, our shared goal, the continued reduction in the number and the demand for abortion. This is not the path to that.
Discussion. The clerk will take the roll. The House is under call. Members, please vote. The House is under call. The clerk will close the roll. There being 76 ayes and 57 nays, The amendment is adopted. There is an amendment at the desk. Clerk will report the amendment. I'll keep those.
Tice moves to amend Senate File 1458, the second engrossment, as amended, and the amendment is coded A19.
The lady from Stearns, Representative Tice.
Mr. Speaker, I'd like to request a roll call, please.
Roll call having been requested are the 15 hands. Seeing 15 hands, there will be a roll call. The lady from Stearns, Representative Tice.
Thank you, Mr. Speaker and members. I stand this evening to bring forward this amendment, the A19, that would limit using taxpayer dollars to fund abortions. Minnesotans are not happy spending their hard-earned money on elective procedures because of the Minnesota Supreme Court's 1995 Doe versus Gomez ruling. Tax-funded abortions have swelled to 34.8% of all abortions performed in the state, according to the Minnesota Department of Health. While the number of abortions is decreasing, taxpayer-funded are not. This bill does not prohibit any woman from getting an abortion, only who will pay for it. It has been 20 years since the courts have looked at this issue. Sometimes when courts have a chance to take a new look at an issue, they come to a different decision. Federal courts have ruled differently than Minnesota's Supreme Court did. As of 2007, only 17 of the 50 states provide funding, and 13 of those are required by a court order to do so. In 1980, under the federal law, the Hyde Amendment made clear that federal Medicaid reimbursement for abortions is limited to situations where the woman's life is at risk or if the pregnancy was a result of incest or rape. Minnesota in 1995 decided otherwise. The legislator's job is to pass legislation that people support and to do what is right. Banning taxpayer funding of abortion is the right thing to do, and Minnesotans support this common sense legislation. This legislation would work to reinstate the ban like the legislature passed in 1978 and put Minnesota in conformity with the federal government's policy on funding abortions through Medicaid only in limited cases. I believe abortion funding is a policy decision that ought to be made through the legislature, not the court. I am asking for your support.
There's an amendment at the desk. The clerk will report the amendment. To the amendment.
Tice moves to amend her amendment to Senate File 1458, the second engrossment as amended, and the amendment is coded A45.
The lady from Stearns, Representative Tice.
Thank you, Mr. Speaker. This amendment clarifies some language. There were some questions in committee and on the House floor about what this amendment would apply to, and this just clarifies that it applies only to state-sponsored health programs that are administered by the Commissioner of Health, Human Services.
Discussion to the amendment. The lady from Hennepin.
Thank you, Mr. Speaker. I'm not on the Health and Human Services Committee, but I know an amendment that this amendment enacts a significant barrier to women accessing safe, legal reproductive health care. In effect, it creates a two-tiered system, one for low-income women and one for middle-class to wealthy women. Shouldn't women be treated equally? A woman shouldn't have to base her decision on abortion or continuing her pregnancy based on whether she has money. This very personal decision should be based on what is best for her, her family, after consulting with her healthcare provider, and yes, with her God. I resent playing politics with women's health care by bringing forward this unconstitutional bill. Remember Doe versus Gomez? Which has no chance of becoming law. This bill has no chance. It's unconstitutional. I understand this bill has no fiscal note because the fiscal staff said this is unconstitutional. Have you taken into account the costs of litigation should this bill actually pass? It could cost the state quite a bit of money. Rather than spend money on litigation for an unconstitutional bill, I'd much rather put that money toward the K-12 bill to educate our kids and grandkids? Or a freeze in tuition for our college kids? Why in the world would politicians want to interfere with women's, people's health care and their personal health care decisions? Vote no.
Any further discussion on the Tice Amendment? Seeing no further discussion, all those in favor of adoption of the A45 amendment to the Tice Amendment signify by saying aye. Aye. Those opposed, no. No. The motion prevails and the amendment is adopted. There is another amendment at the desk. The clerk will report the amendment.
Schoen moves to amend the Tice Amendment to Senate File 1458, the second engrossment as amended. The amendment is coded A63.
The member from Washington, Representative Schoen, to explain your amendment.
Thank you, Mr. Speaker. I've long been a proponent of health care equality, and whether it's between men and women, and so this bill is this amendment, call it the It Takes Two to Tango amendment. And so if state funds can't be used related to women's reproductive rights, then maybe we shouldn't be using state funds to purchase Viagra or other erectile dysfunction medication. And so that's my amendment.
The member from Stearns, Representative Tice.
Thank you, Mr. Speaker and Representative Schoen. It doesn't quite fit with the amendment that I'm bringing forward. And I think if you feel that passionately about that, then I think next session that would be a good bill for you to bring forward.
Mr. Speaker, I'd ask for a roll call.
Roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Dean. Representative Dean.
Thank you, Mr. Speaker and members. Those of us who consider ourselves pro-life and believe this involves the life of a human being. This amendment is disrespectful to that belief and it's silly. Vote no.
Representative Kahn.
Mr. Speaker, I don't quite understand that statement. You really believe that erections have nothing to do with the process that will end up necessitating an abortion? Who is that, Dean? I guess I'd ask him to yield to the question. Representative Dean, will he yield to the question?
He will yield. Representative Kahn.
Okay, the question is, the question I'll repeat is, do you really think that erections have nothing to do with the process that might end up necessitating an abortion?
Representative Dean.
Mr. Speaker and Representative Kahn, again, we believe that the lives of the unborn are something that is important to us. We believe that's human life. That's what we believe. It's disrespectful to that belief, not just folks on our side of the aisle, but folks on your side of the aisle. It's a silly amendment. Please vote no.
Representative Schoen. Representative Mack.
Thank you, Mr. Speaker and members. Just on a point of that, and Representative Kahn, I understand that on the other side of the aisle, and to a great extent on both sides of the aisle, a big part of this is women's health. And as we've talked about many times, it's not an issue of trying to take away choice or tell women what they can do with their bodies. For speaking for myself, this is understanding, and to Representative Lane, who gave a list of why abortions are safe and just how safe they are. I would just argue that from somebody who is taking into account that when someone goes in for an abortion, 2 lives are walking into that room and only one gets to walk out. And so for me, this is what that's about. It's about the life that doesn't have a voice in that decision. And so obviously we go round and round on this issue, members. It's very controversial, but Representative Schoen, this is about the life of that baby. And so with that, thank you, Mr. Speaker.
Any further discussion? Representative Kahn.
Well, Mr. Speaker, will Representative Mack yield to a question?
She will yield. Representative Kahn.
Since I didn't get a satisfactory answer from Representative Dean, do you truly believe that erections have nothing to do with the process that might necessitate an abortion at some point?
Representative Mack.
Thank you, Mr. Speaker, and Representative Khan. Representative Khan, I guess I would argue that in my opinion, linking that to necessitating an abortion, no, I don't agree with that statement.
Representative Schoen.
Well, thank you, Mr. Speaker. And you know, let's be honest, it is a little bit of a silly amendment. That's fair. But what's not silly is telling people of a lesser income that they don't have the right to the choice that the United States Supreme Court says they have. This is, as far as you all know and we all know, one of the most devastating choices any woman is going to have to make. Whether they do or don't is life-changing. My daughter's 9 years old. And God forbid, if she was faced with the situation where she thought she would need this choice and didn't have it, and went somewhere or took some avenue that was that unsafe, I would be devastated. The fact is, the reason I rise here to do this today is so that her dad, me, has a full understanding that no matter what happens in your life, that I will love you and I'll be there to support you. But this is not my choice. This is going to be hers if she needs it. The same with any of your daughters, sisters, whatever it may be. But just because someone's poor doesn't mean they shouldn't have this constitutional right. And I'm glad we had this discussion. I appreciate it. We know the amendment's going to go down. So I'll withdraw the amendment, Mr. Speaker. But the reality is, this bill, it has an escape clause written into it, which means, hey, we did this legislation. Don't worry, it's going to be unconstitutional. But at least we made a statement. We do that around here all the time. But let's make no mistake about it. This is about people's choices. Young girls' choices in the future or now. Vote no on this amendment as a whole.
Representative Schoen withdraws the A63 amendment to the A19 amendment. That leaves us members with the A19 amendment. Further discussion on that amendment? Seeing no further discussion, the clerk will take the roll on the amendment. House is under call, members. Please vote. Clerk will close the roll. There being 76 ayes and 57 nays, the motion prevails and the amendment as amended is adopted. There is another amendment at the desk. The clerk will report the amendment.
Schumacher moves to amend Senate File 1458, the second engrossment as amended. The amendment is coded A33.
The member from Rock, Representative Schumacher, to explain your amendment.
Thank you, Mr. Speaker and members. The A33 amendment is a fix to some of the nursing home revisions that we have here. After we got the runs a couple of weeks ago, I was looking at the facilities and trying to figure out the zeros that are there and why we have zeros there. And in going through that, we found that a couple of the facilities in particular had zeros because they were not providing health insurance to their employees at the moment. So what this amendment says is that if you do start providing health insurance for your employees again, that those pass-through funds, which every other facility is receiving, those funds would be available for that facility to provide health insurance coverage for their employees as well. And so that goes to remedy that. And Mr. Speaker, I have an amendment to that as well.
There is an amendment to the amendment at the desk. The clerk will report the amendment.
Schumacher moves to amend his amendment to Senate File 1458, second engrossment as amended. The amendment to the amendment is coded A51.
Representative Schumacher, to your amendment to your amendment.
Thank you, Mr. Speaker. And this amendment just makes sure that the increase that would come under for those facilities that were at zero don't exceed the current fiscal note that we have for the 316, House File 316.
Any discussion to the Schumacher amendment, the A51 amendment? Seeing no discussion, all those in favor of adoption of the A51 Schumacher amendment signify by saying aye. Aye. Those opposed, no. The motion prevails and the amendment is adopted. Representative Thiessen.
Thank you, Mr. Speaker. Can I get a roll call on the amendment?
Roll call has been requested. Leave the hands up, folks. Seeing 15 hands, there will be a roll call. Discussion on the Schumacher amendment as amended. Representative Thiessen.
Thank you, Mr. Speaker, and I would encourage people to vote yes.
Representative Schumacher.
Thank you, Mr. Speaker. I would also encourage people to vote yes.
All of a sudden, I don't want to vote yes. No. Too much agreement. Any further discussion? Hearing none, all those, the clerk will take the roll. We are under call, members. Please vote. The clerk will close the roll. There being 133 ayes and 0 nays, the motion prevails and the amendment as amended is adopted. There is another amendment at the desk. The clerk will report the amendment.
Daniels moves to amend Senate File 1458, the second engrossment as amended, and the amendment is coded A35.
The member from Rice, Representative Daniels.
Thank you, Mr. Speaker. This amendment has bipartisan support. What we're looking for is to have closed captioning on the TVs that are in hospital waiting rooms. Currently, they are requested to put them on by the person who's waiting their request. This just simply makes it the TVs would have the closed caption on all the time if the TV has that function on it. There is no penalty if they don't have the closed caption on. I'm not trying to get anybody in trouble. This actually stems from a deaf couple that was in a hospital watching TV when the Boston bombing came on. And they saw people running frantic all over the place. They had no idea what was going on. They couldn't communicate with anybody in the building. So this is just to help to protect the people that are hard of hearing or deaf, that anything like that comes on in a waiting room, they'll have the closed caption to let them know what's going on. And I appreciate your support on this one.
Discussion to the Daniels Amendment. Representative Dean.
Thank you, Mr. Speaker and members. This is a good amendment. It is not opposed by anyone that I know of, including the Hospitals Association. I encourage member support.
Representative Liebling.
Thank you, Mr. Speaker, and I also would encourage members to support the amendment.
Any further discussion? Seeing no further discussion, all those in favor of adoption of the Daniels A35 amendment signify by saying aye. Those opposed, no. The motion prevails and the amendment is adopted. There is an amendment at the desk. The clerk will report the amendment.
Quam moves to amend Senate File 1458 as amended, and the amendment is coded A28.
The member from Olmsted, Representative Quam.
Thank you, Mr. Speaker and members. And we all might remember last year when we weren't after session, we weren't in session, they had a little bit of a situation nationally and quarantines came up. I had some discussions with the department and ended up generating some language, met with some of the business groups and tried to get some alleviation for some possible hardships during that time. And it's been boiled down to just a few, but it's a work in progress to show our citizens that we do think the possibility of quarantine is important, that we are looking at it and trying to make it work better in Minnesota. So I hope for your support. Thank you.
Discussion to the Quam amendment. Representative Mullery.
Thank you, Mr. Speaker and members. Would Representative Quam yield?
He will yield. Representative Mullery.
You mentioned talking to employers. Did you talk to any of the labor union representatives about this?
The member from Olmsted, Representative Quam.
Thank you, Mr. Speaker. And I'm not sure if any of the labor union reps were in some of the meetings. I don't specifically have a separate meeting that I had with them, no.
Thank you, Mr. Speaker.
Representative Mullery.
And that's what I figured, because I talked to some labor people and they're very concerned about certain parts of this. The biggest problem is, I believe, why would Representative Quam yield again?
He will yield. Representative Mullery.
Representative Quam, in here you are allowing the employer to decide whether or not the employee is going to use their sick pay, their vacation, whether they should have to use up their health benefits, several other things that the employee has the right to decide, and you're giving that right suddenly to the employer. Don't you think that labor and working people would be pretty unhappy with taking away workers' rights because the employee is quarantined?
Representative Quam.
Thank you, Mr. Speaker. And in here we do have the language of the qualified employee may elect to have, paid leave benefits, and et cetera, vacation, time off, sick leave. They may use that to cover the pay during that time period.
Representative
so that
Mullery.
The employee does have a voice of choosing.
Mr. Speaker, would Representative Quam yield again?
He will yield. Representative Mullery.
Representative Quam, it says that the employer can decide for the employee. That isn't exactly saying the employee can decide. If I can decide but the employer can override my decision, that doesn't seem to be much of a decision for me. I'm also concerned about the provision up further solely that the employee can't be fired solely because of the quarantine. Representative Quam, that is another problem, because how do you prove that it was solely because of that? And also, why should that be a part of any I'm sorry, Mr. Speaker, would Representative Quam yield again?
Yep, he will yield.
Representative Quam, why should the fact that they're quarantined be allowed to be part of a decision for firing them or laying them off or whatever? By the language you have there, you are saying that it can be part of the decision to lay them off. That doesn't seem to make any sense to me. It's not their fault, especially if they got it at work.
Representative Quam.
Thank you, Mr. Speaker. And when you have an employer shall not discharge or discipline a qualified employee. So it's talking about not. In other words, if the only thing you have that you're disciplining or discharging is they're in quarantine, you shall not do that. So I don't understand the interpretation of what I see as clear language.
I'm sorry,
Representative
Mr.
Mullery.
Speaker, would Representative Quam yield again?
He will yield. Representative Mullery.
Quam, it specifically says in here solely. So by doing that, you are saying that that can be part of the decision. That makes absolutely no sense. The person is quarantined for something, and as Representative Nelson pointed out, you might even be taking away their work comp rights here. But by making it solely on that, that means that that can be part of it, and then they can fire them as long as it's part of the decision. So, Representative Quam, you are, in essence, and I don't know if you understand that, but you are saying they can be fired if that is part of the decision. To me, it should not be allowed to be at all part of a decision for firing somebody. And maybe you don't have a response to that. I guess not. Well, anyhow, Mr. Speaker, there's a lot of problems with this. It looks like you're taking away quite a few employee rights here, and I just hope people will vote no on this. I don't believe it went through any committee. Representative Quam, I'm sorry, would Representative Quam yield again?
He will yield. Representative Mullery.
Representative Quam, did this go through committees, and is there a bill on the floor like this?
Representative Quam.
Thank you, Mr. Speaker. And it was dropped the very first day. And I started requesting a hearing the first week. And it was not heard by committee.
Well,
Representative Mullery.
Welcome to this year for many of us, too. I had quite a few bills like that were dropped on the first day, and I requested hearings and never got hearings. So again, members, I hope you'll vote no. We don't know all of the problems with this, but it looks like there are at least a few problems for employee rights here.
Representative Moline.
Thank you, Mr. Speaker. Will Representative Quam yield for a question?
He will yield. Representative Moline.
Representative Quam, if an employee is discharged based solely on the fact that they were in isolation or quarantined, or if the employee isn't allowed to work from home and the other conditions in your language are met, what sort of recourse do they have in enforcing this law?
Representative Quam.
Thank you. And first to clear up, I had some verification that we're not aware of any labor union that's come forward with an issue on this or has one. But again, there is other statute that covers to where you can bring legal recourse and sue. And also, if you win the suit, you get your lawyer fees, attorney fees covered.
Representative Moline.
Thank you, Mr. Speaker. Will Representative Quam yield to another question?
He will yield. Representative Moline.
Representative Quam, are employees allowed to file a complaint with the Department of Labor and Industry if their employers violate this statute?
Representative Quam.
Thank you. And during the work on the language, yes, my understanding, and that was part of the peripheral language, and we did not try to tweak the lawyer fees, the process. We left that outside of the bill.
Representative Moline.
Thank you, Mr. Speaker. Will Representative Quam yield for another question?
He will yield. Representative Moline.
Representative Quam, is there language in Representative Dean's bill that pays for the costs that are going to be incurred by the Department of Labor for filing the complaints? Is there money in Representative Dean's bill to pay for the costs that the Commissioner of Commerce will incur from lines 2.11 to 2.15 of your amendment? It says the Commissioner of Commerce shall negotiate with credit reporting bureaus to waive any negative reports to the person's credit rating during the person's period of quarantine. And the Commissioner of Commerce shall negotiate a federal waiver for federally guaranteed student loan obligations for persons under isolation or quarantine. And then finally, Representative Quam, is there money in Representative Dean's bill to pay for line 2.33 to 2.35, in which the Commissioner of Health and Commerce are asked to provide documentation setting forth the person's conditions for isolation or quarantine?
Representative Quam.
Thank you. And in the discussions with the department, they already are generating documentation, contacting different parties in regards to trying to alleviate, but there's no statute that stands behind and assists with that. And we're talking, not too long ago, there were measles situations of where we had people that were isolated or quarantined. And that was handled with letters without having additional activity behind. We're not talking hundreds or thousands of people. This is very isolated, small quantity. And in the discussions, they're already doing activities. This would alleviate some of those activities, so there wasn't any additional FTE that ever came up in the discussions for these items.
Representative Moline.
Thank you, Mr. Speaker. And Mr. Speaker, I rise to a point of order under 4.03, paragraph H.
And I assume you have advice?
Advice, Mr. Speaker. We have an amendment here that requires the Department of Commerce to incur costs through language that is not even permissive, but says shall negotiate in two different paragraphs. We also have an amendment that will result in likely the Department of Labor and Industry incurring costs by employees filing complaints for violations of this language. And we also have an amendment that will require the Department of Health to incur costs as well. Mr. Speaker, this amendment certainly has to be found out of order under 4.03.
Representative Quam, do you have advice?
Thank you, Mr. Speaker. And if the member would, I guess basically I was planning to have a comment on this and then withdraw the amendment. Yeah, I'm not sure, can you give me, I guess I'd be seeking advice. My advice would be to not rule on this, and this would be resolved in a few minutes.
Representative Quam, why don't you offer me some more advice, make your comment, make your withdrawal, and let's move on. State your advice, Representative Quam.
Thank you, Mr. Speaker. My advice is that there is not any additional costs, but I grant that it is fuzzy as into fiscal notes because we didn't have a committee meeting. But frankly, this is not a trivial issue. It's something that we should show our citizens that we think and plan ahead and are not caught unawares in an emergency. So I will withdraw the amendment and we can move on.
Representative Quam withdraws the 828 amendment. There is another amendment to the desk. The clerk will report the amendment.
Purcell moves to amend Senate File 1458, second Grossman as amended. The amendment is coded A20.
The member from Beltrami, Representative Purcell, to explain your amendment.
Thank you, Mr. Speaker. The A20 amendment is to put the TANF money for the Red Lake Nations program to fund that in the bill, and the temporary assistance to needy families is a very important program at Red Lake Tribe, and this total of $284,000 is what we're putting in here. So then that's what they had been receiving, and my understanding is that Representative Dean, Chair Dean, was going to speak to this too, so I'll let him do that, Mr. Speaker. Appreciate a green vote.
Representative Dean.
Thank you, Mr. Speaker and members. Representative Purcell brought this forward to the committee a little bit late. There was a technical error in the bill, so it didn't quite work out within deadlines. We do think this is a good bill, and I would support its adoption.
Any further discussion on the Purcell amendment? Seeing no further discussion, all those in favor of adoption of the A20 Purcell amendment signify by saying aye. Those opposed, no. The motion prevails and the amendment is adopted. There's another amendment at the desk. The clerk will report the amendment.
Mullery moves to amend Senate File 1458, the second of Grossman as amended. The amendment is coded A30.
The member from Hennepin, Representative Mullery, to explain your amendment.
Thank you, Mr. Speaker, and I'd ask for a roll call on the main amendment, A30.
Roll call has been requested.
Come on.
Seeing 15 hands, there will be a roll call. Representative Mullery.
Thank you, Mr. Speaker, and Mr. Speaker, I would ask that you take the A50 amendment to the amendment to make a slight correction.
There is an amendment to the amendment at the desk. The clerk will report the amendment.
Mullery moves to amend his amendment to Senate File 1458, second of Grossman as amended. The amendment to the amendment is coded A50.
Representative Mullery, to your amendment.
Thank you, Mr. Speaker and members. This just corrects a mistake that the drafters made in the House research, and just the 28 it's got the wrong section number.
Any discussion to the amendment? Seeing no discussion, all those in favor of adopting the A50 Mullery amendment to the A30 Mullery amendment signify by saying aye. Those opposed, no. The motion prevails and the amendment is adopted. There is another amendment at the desk. The clerk will report the amendment.
Mullery moves to amend his amendment to Senate File 1458, the second engrossment as follows, and the amendment is coded A42.
Representative Mullery.
Thank you, Mr. Speaker. And this again gets at the issue that I was really looking forward to this session because I kept hearing from both sides that they were running on closing the achievement gap, and that was a major issue in the Republican campaigns, closing the achievement gap. And now it seems that once in office, they're running away from everything that would close the achievement gap. To close the achievement gap, I talked about it on the education bill, that we needed actually to put money in to close the achievement gap. It's just one of those things around the country. You have to fund the programs. And in that bill, the governor offered 8 times what the Republican bill in. But it's not just the matters that were in the education bill. For one thing, to close the achievement gap, you have to start at birth and go on. And it's very important that kids receive high-quality child care from providers who know how to foster brain development. And for the scholarships that I thankfully the chair put in of education, money for that, but to really expand that program, we need more money in the Parent Aware program, both for people to go out and rate providers so that they can get scholarships and to provide the training. And in a great amount of Minnesota, there's almost no rated child care providers and no training. So the kids can't get the scholarships, they can't get the needed help on brain development that should be out there. And so the Republican bill here, instead of increasing money for raters and trainers, actually cuts back on the money that has been going into this for the last couple years. And so this amendment would add $5 million per year for expansion of the quality child care, which is not only great for kids, but is necessary for expansion of the whole scholarship program for advancing the youth in our state and closing the achievement gap. And with that, members, I'm aware of that it's not going to happen, so I'll withdraw that amendment.
Mullery withdraws the A42 amendment to the A30 amendment. We're now back on the A30 amendment as amended with the A50 amendment. So
thank you, Mr. Speaker.
Representative Mullery.
Oh, I'm sorry. Okay. Members, this is an important amendment. What this is doing is changing the allocation factor back to the language that was agreed on by everybody. All of the people involved came together, the department, the child care providers, or not the child care providers, the people and workers who work on child abuse, the counties, and other interested parties all came together and sat down and worked out over, I think it was about a month, they worked out a formula for allocation of the funds in the child protection grants. And so there's just no reason not to accept what they all have agreed on. And in fact, they said that the House language in here makes no sense because it counts cases which were screened out, so there's maybe an hour or two involved in the work. it gives the same rating to those on allocation of funds as cases that are screened in, which may take 50 or 100 hours of work. And so there just doesn't seem to be any sense in the formula that's in the bill here. The other one is something that everybody agreed to. Nobody's happy with it exactly. They all agreed that it's the way to go. And so, members, I would ask that you support the A30 amendment on the redoing the formula for allocation. Thank you.
To the A30 amendment, any discussion? Representative Dean.
Thank you, Mr. Speaker, and members. Please vote no.
Representative Loeffler.
Thank you, Mr. Speaker and members. I would encourage people to have a yes vote. As was recently described, this represents the coming together of people throughout the state of Minnesota, from our counties, the child advocates, people from both sides of the aisle served on that task force. They had long, long meetings dealing with difficult issues. I think we always should recognize and honor the tough work that people come together on consensus. The Association of Minnesota Counties and MAXA, is my understanding, both support this as thinking it's a fair allocation and it's the one that should go forward. I'd urge a yes vote.
Any further discussion on the A30 amendment? Seeing no further discussion, the clerk will take the roll on the amendment. The House is under call, members. Please vote. The clerk will close the roll. There being 61 ayes and 72 nays, the motion does not prevail and the amendment is not adopted. There is another amendment at the desk. The clerk will report the amendment.
Thiessen moves to amend Senate File 1458, the second engrossment as amended. And the amendment is coded A31.
The member from Hennepin, Representative Thiessen, to explain your amendment.
Thank you, Mr. Speaker. Well, members, you know, we have here in Minnesota the best health care in the entire country. No question about it. We have the best providers. We have the best doctors and nurses, the best hospitals. We know how to do health care in Minnesota and know how to do it well. What this amendment does, members, is it says that it instructs our commissioners at our state agencies and boards basically to seek a waiver from the federal government to allow us to design our healthcare system here in Minnesota the way we want that healthcare system to be designed. To waive kind of the rules and requirements that the federal government puts on it, whether it's related to the Affordable Care Act, whether it's related to what we have to do under the exchange, whatever those requirements may be, and allow Minnesota to design essentially our own healthcare system, getting the money from the federal government, but designing it and delivering it the way we would like. I think if we're going to put everything on the table, we're going to put all the best ideas on the table. This is the kind of proposal that we should try to move forward with. And I would imagine it's something that we could get some bipartisan support on. Mr. Speaker, I would ask for a roll call.
Roll call has been requested. Seeing 15 hands, there will be a roll call.
Thank you,
Representative Thiessen.
Thank you, Mr. Speaker.
Further discussion. The member from Washington, Representative Dean.
Thank you, Mr. Speaker and members. And I would wonder where this was a couple years ago. This might have been a very good amendment for Representative Thiessen or others who were proposing that we go down this road a few years ago. However, at this juncture, this will represent a cut to Medicare, and it is one that we should not go down. Members, vote no on this amendment.
Any further discussion to the amendment? Seeing no further discussion, the clerk will take the roll on the amendment. The House is under call, members. Please vote. Clerk will close the roll. There being 0 ayes and 133 nays, the motion does not prevail and the amendment is not adopted. There is another amendment at the desk. The clerk will report the amendment.
Murphy E. moves to amend Senate File 1458, the second engrossment as amended, and the amendment is coded A3.
The member from Ramsey, Representative Murphy, to explain your amendment.
Thank you, Mr. Speaker and members. I first want to say hi to Jim Abler's mom, because she's probably still watching Health and Human Services like she always did, and since Representative Abler's up in the gallery, I thought we could give a shout out. And I also want to say, let's remember there's a $1.9 billion surplus in the Minnesota budget right now. The A3 amendment strips out some of the phony savings and budget shifts in this bill, and I'm going to ask for your support. I'm actually kind of surprised that this got past Representative Knobloch. Now he's just slipped out of the chamber, but hopefully he'll come back. I can't believe this bill really did get past Representative Knobloch in Ways and Means. He's got so much experience, and I didn't think this would get past his desk, but I know that he's been involved in setting the targets, and the Health and Human Services budget did get a really significant budget cut target. And in 2011, when we had a really significant budget deficit, we saw this same execution of the budget where we saw phony savings with waivers with no justification for the hundreds of millions of dollars of savings. And we also saw a really significant school shift, one that we paid back in the last budget last year. Minnesotans were so happy about that. Anyhow, we saw a significant shift to our schools in order to balance the budget. And so with the $1.9 billion surplus, I was surprised, one, to see such a significant cut target for Health and Human Services, but then to meet that target, the same tactics being used. In 2011, it didn't get us to a very good place. We ended up in a government shutdown because there was such opposition to that. And I'm a little worried about the fact that we're less than 3 weeks away from now our adjournment, and we are debating this bill with now, as we've discussed, savings in this bill that we don't agree with. You've seen the fiscal note now, and also with payment shifts that don't serve our providers well, etc. So this amendment does the following things. First of all, in the bill, the legislation is ordering, it's not even suggesting, it's ordering the Department of Human Services to find $100 million in savings as they negotiate with managed care organizations. There's no fiscal note attached to this, there's no justification, it's just a straight up order to the administrative branch, you must find these savings. When the Commissioner of Human Services came and talked about this provision, she said the savings are without foundation, and she did not believe that savings to this extent could be realized under their current contracting model. So that's one. The next is, again, another order from the legislature to the administrative branch, and you think about separation of government, et cetera, but anyhow, we're ordering the Department of Human Services to reprice their competitive bidding process and save $50 million. Again, no justification, no fiscal note to that, no analysis. The Council of Health Plans, with whom we contract to provide health care services through Minnesota Care and medical assistance, they believe that this requirement will impact their actuarial soundness, which will then break federal law. So we're a little concerned about that. Behind these two orderings of savings is a fairly significant provider rate cut. Now, nursing homes are excluded, but nobody else. And I think, if we're just being honest with Minnesotans and to the providers who are watching, I think they can count on a rate cut. And I know you don't want, Minnesotans to think when we've got a $1.9 billion surplus that we should cut rates to hospitals and doctors and nurses and dentists. But that's what the bill does. So let's be honest about that part. We should, adios those two segments, and then I don't know what we're going to do with that rate cut, but at least it's a cut. Might be more honest when we think about a $1.1 billion cut. We've already talked about the public program verification audits, the $300 million savings. Representative Thiessen covered that. One of the things that happened after we saw the Pearson bill and the Drazkowski bill was that extension of that notion of auditing and analytics to all of our public programs. And I want to just say one more time that I think it is important for us to root out fraud. I think everybody in this body agrees. But I think to book the savings ahead of that is just, a kind of budgeting that Minnesotans wouldn't understand. That's not what they do with their family budgets. And it's really living on a credit card in a really big way and putting not only this budget at risk, but everything else that's covered in this budget, the care for seniors, the care for the disabled, et cetera. Because if we count on all these savings and they're not real, we are heading right back into deficit budgeting. And when we do deficit budgeting, we end up cutting in health and human services, we cut the aging, we cut the disabled, et cetera. So that's where we're headed. And that's why I think we should take that out. There's just a couple other provisions, and these are in the shifts category and payment shifts. So the two that I talk about in this amendment that we should take out is one, the refinancing of TANF. That's the temporary assistance for needy families, and we've all been guilty of this, especially during the deficit that we refinance TANF. The part that really bothers me about this is we are refinancing TANF, taking money away from the work that is done by home visiting nurses for families that are at risk. So, we all talk about looking out for little kids and families and vulnerable children, and this cut, this refinancing of the TANF money into the general fund puts an arrow right in vulnerable families all across the state of Minnesota, including greater Minnesota. And then last but not least, the shift of the Healthcare Access Fund into the general fund, a cardinal sin for the providers who pay that provider tax. I know that they're opposed to that. It's been a fight that we've had forever. We've tried very hard to stay true to the commitment we made in 1992 that provider tax be used for the provision of care through Minnesota Care. I know Representative Dean has been opposed to that as well. So I know he's got that great big target, and he has to make some cuts, and he has to, find the money. And so this shift, even he said, what does get, in a quote, the Representative Dean said, what does really get a lot of providers, everybody in the healthcare community angry is when we use those healthcare access fund dollars, the 2% 6 tax, the provider tax, for other things. And that's what we're doing in this bill. So, members, I think it's really important to set this right, to set it square. I really believe a lot in what we do in this body, and I think Minnesotans should have faith in us. And when we use phony numbers and budget gimmicks like these shifts in a time of surplus, I don't understand how Minnesotans would have faith in us. When we disregard a fiscal note, and it is, the document that we use, like it or not, whether you like it or not, we rely on fiscal notes in this body to set our budget. We have for years. I know that there are some who would like to change that, and we should have that debate, but right now we've got fiscal notes. When we completely disregard them, I don't know how Minnesotans can't look at us and say the arrogance that you are demonstrating by being above the rules. And that is what we're doing tonight, at least you are, running above the rules and thinking that you can get away with misleading Minnesotans by saying this is a square budget when it's not, is wrong. I don't think we can say this is honest. I think we should take these provisions out, and that's why I'd ask your support for my amendment. Thank you.
The member
and
from...
I'd like a roll call, please.
A roll call has been requested.
Mr.
Seeing
Speaker.
15 hands. There will be a roll call. Representative Dean.
Mr. Speaker, I just want to respond to a few of the things that Representative Murphy said in her speech. And several of the amendments are out of order that have been proposed by the minority caucus. This is one of those. But I certainly appreciate Representative Murphy's comments and her perspective on this, and wanted her to give her the opportunity to make that case. And just a couple of things to kind of respond. First of all, the $135 million payment delay, which has been brought up, was a continuation of your budget, Representative Thiessen, from the last session. We understand that, and we are continuing that. We continue the budget that you had proposed and brought forward last time. The issue that we have with the Health Care Access Fund, which, as folks know, is where the 2% sick tax goes in, how that money gets used is a big deal. And there was a significant shift in the policy of the state of Minnesota to move that towards the general fund when we expanded Medicaid. And that hadn't been done before. That was done in the last session. We understand that was a policy decision that we opposed, but that happened when we expanded Medicaid. And we've seen that what the costs have done to the state of Minnesota and what that has actually wrought. Representative Murphy talked a little bit about the Health Care Access Fund. The very first committee hearing that we had in Health and Human Services Finance was on the solvency of the Health Care Access Fund, which, as you remember, had a great big balance in it, that if we had left it there, had we not pushed that into the general fund to bail out Obamacare in the state of Minnesota, it actually would have accrued to a level where we would have reduced it from 2.0% to 1.5% in the reduction of the Health Care Access Fund. That didn't happen because that money was plowed over into the general fund and sucked up into Medicaid to bail it out in an unsustainable fashion. Our first committee hearing was on the solvency of the Health Care Access Fund, and we found an $850 million hole that matched up almost perfectly with the basic health plan that you can't pay for. We understand that's not sustainable. You understand it's not sustainable. It's one-time money and a shift that you did in the last biennium that we called you out on. We're offering a solution that's paid for and works long-term. You understand that we have to do that. Governor Dayton understands that there's no way to pay for the current trajectory. He understands that too. So I'd like to point that out, that in fact, those were things that were begun in the last session and we now have to deal with moving forward. So to say that this is somehow new is, of course, not the case. Now, as we look moving forward, we're going to have to pay for this stuff moving forward, not just to the next year, but what if we actually climbed up on a ladder and looked out 6 years? What if we actually did that? And how are we going to pay for the health care for low-income Minnesotans? How are we going to help low-income Minnesotans be able to afford private health insurance? We throw a plan out there that says this might work. Can you come together around us? Can you help us make this work? That's what we're doing moving forward. Representative Murphy, I would rise under 4.03. Your amendment, unfortunately, is unbalanced. It leaves a big hole in the general fund, and quite frankly, it makes the argument that I just made that there's no way to balance this thing moving forward. The ship we're on is heading for a waterfall. I think you know it, we know it, Governor Dayton knows it. We need to face that fact pretty soon.
Representative Dean rises to a point of order under 4.03. Any advice, Representative Murphy?
Thank you, Mr. Speaker and members. Advice. I find it, in the current moment, rich that we are invoking Rule 4.03 for this budget that has a fiscal note that shows it has a nearly $300 million hole. And after the chair of Ways and Means said that we take fiscal notes as advice, under advisement, but we don't have to follow them, I don't know anymore what guides us other than the majority's point of view, perspective, or arrogance on Rule 4.03. If we can't count on a fiscal note, I'm sorry, Representative Davids, but seriously, I mean, the budget's so important and people are relying on this. But if we can't count on the fiscal notes, why wouldn't we just come up with our own numbers every single day here? You know, we're going to take up the tax bill tomorrow. Why wouldn't we just come up with our own numbers and say we can't count on fiscal notes? It really does subvert Rule 4.03, what we've done tonight. It completely undermines it. It guts it. So I know you're going to, I know where we're going to go with this. I would just say that you should, stick with me on this one. Let's clean up this bill. Let's make it balanced for real. Let's get rid of some of these provisions. I could enter into some more debate with Representative Dean, but we're going to have different perspectives on that. I will just say that what we're talking about here tonight, is so important to Minnesotans. We have found our way in the past to doing the work that we want to do together to do some reform to make sure that we are heading in the right direction for the people of Minnesota. This bill doesn't cut it. It's going to hurt people. And I think at the very least we should take out these provisions, these false savings and gimmicks, these shifts, so we get the bill into the right order so we can actually do the work of the people of Minnesota. That's my advice.
Thank you, members. After reviewing the amendment and the rule, and upon the advice of Representatives Dean and Murphy, I find the point of order well taken. There is another.
Mr. Speaker?
Yes, Representative Murphy.
I'd like to appeal the rule of the Speaker, please.
Representative Murphy moves to appeal the ruling of the Speaker. No hands are required for that. Any discussion to that motion?
I request a roll call, please.
Representative Murphy requests a roll call. Seeing 15 hands, there will be a roll call. As a reminder, the question before the body member is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker. A no or red vote goes against the ruling of the Speaker. Discussion of the motion. Representative Thiessen.
Thank you, Mr. Speaker. Well, members, I would encourage you not to follow the ruling of the Speaker on this. Everything Representative Dean says forgets the fact that we have a nearly $2 billion budget surplus in this state. When we have done the shifts in the past, it's because we're dealing with a deficit. There's only one reason you're doing it and putting the health care of tens of thousands, if not more, Minnesotans in jeopardy is because of Representative David's bill. You want to give huge corporate tax cuts to your friends in order to fund this bill. And because you're so afraid of your unwillingness not to cut things, your willingness to spend, apparently, Representative Drazkowski, on numerous things, means that you have to create money in order to do that. And that is what you're doing here. So that $135 million shift, yes, that happened under Representative Abler, that happened under Representative Huntley. We were in deficits in both times. We were not in a surplus. As to the Healthcare Access Fund, there's a couple reasons why there's an issue. First of all, because Representative Dean got rid of the money that supported the Healthcare Access Fund. That was his bill. He created the problem. That's on you, Representative Dean. Secondly, you're taking $500 million that we're spending on health care and turning it into $50 million in Representative David's bill. The other $450 million is going to cover your other spending priorities. We have never done that, Representative Dean, in the state of Minnesota. What Representative Huntley did last year was actually take Healthcare Access Fund money and use it for basic health care, because we moved Medicaid, folks out of the Minnesota Care and into Medicaid. What you're doing is taking money, the tax money of the folks that pay that, the providers, the hospitals, and spending it on things that don't, on folks that don't pay that tax, nursing homes, PCAs, other things like that. We've never done that before in the state of Minnesota, Representative Dean, and you know that's right. And you know that the Minnesota Medical Association is extremely upset with the position you're taking. You know that the doctors are upset, the hospitals are upset, because they know that you're doing something that's been unprecedented in the state of Minnesota. And we're not even starting to talk about the $285 million hole that you've already blown in your budget. That is more money than you're even putting into nursing homes, which is actually significantly less than we put into long-term care when we were in charge with a $625 billion deficit. But that's an aside. The biggest, I was reading an article just now about a woman who worked for Best Buy and was convicted of stealing $33 million from Best Buy. And the way the paper described it was one of the largest corporate frauds in the history of the state of Minnesota, $33 million. What you're doing in this bill is perpetrating a massive fraud on the people of Minnesota. You're perpetrating a massive fraud on the seniors of this state who are relying on this money to actually, to believe that they're actually going to get their nursing homes funded, that they actually believe that they're going to get some relief for their PCAs. You should be ashamed of yourself. It's criminal what you're doing. Members, you should overrule the ruling of the Speaker so that we can actually have an honest budget discussion here tonight.
Any further discussion on the appeal of the ruling? Members, as a reminder, the question before the body is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker. A no or red vote goes against the ruling of the Speaker. The clerk will take the roll on the question. The House is under call, members. Please vote. The clerk will close the roll. There being 72 ayes and 61 nays, it is the judgment of the House that the decision of the Speaker shall stand. There is an amendment at the desk. The clerk will report the amendment.
Johnson C. moves to amend Senate File 1458, the second engrossment as amended, and the amendment is coded A16.
Thank you, Mr. Speaker. And members, I ask you to support this amendment. It's about improving care for our mentally ill patients in Minnesota and providing safety for those patients and for our state employees who serve and care for those patients in our state facilities. This provides for the governor's recommendation for state-operated services, which would be an increase of $66.5 million, as well as to fund the operations to fulfill the terms of the conditional license at the Minnesota Security Hospital. Last year, there was a record number of assaults at the Minnesota State Security Hospital. When workers drive over to the south side of St. Peter and drive up to their workplace, they know that they're vulnerable to being attacked on the job. It's part of their daily work routine. It's hard for me to fathom, even after talking to hundreds of state employees who are facing that possibility. It takes a toll on them personally, it takes a toll on their families, and yet they come to work, they do their job, and remarkably, and I think really impressively, remain committed to caring for those patients that they care for. Today is Workers' Memorial Day. It's a day that we recognize those who have lost their lives on the job and have been injured on the job. And indeed, in multiple parts of Minnesota, we saw state employees who work in state-operated services who gathered together to say, we've got a problem in Minnesota. They've been sharing their challenges on a Facebook site called Safe Staffing Minnesota. And if you go to that site, you'll see that this is really broad and really thorough and faces a lot of our valued state employees. There are open positions at the security hospital that are not being filled because the Department of Human Services cannot count on the funding they need in order to fill those positions. What that's resulting in is fewer people to serve the patients, which results in a lot of scheduling difficulties and simply not enough people on the job at times. The Department of Human Services has announced that there will be no additional admissions at Anoka, at the Anoka Regional Treatment Center. Now that certainly has an impact on the Anoka Center, but members, that has an impact on every one of our districts. Because when there's a court ordered, when there should be a referral to the Anoka Regional Treatment Center and they're not taking admissions, those individuals have to be dealt with in the local community. And if you talk to your sheriff, you'll find out that a lot of that time, many times, that means pressure on the jail, dealing with people in a jail where they should not be dealt with. It's not the best way to do it. This amendment is about safety of our patients, it's about safety of our staff, it's also about care for our patients. We need these funds in order to meet the needs of our mentally ill people, but also importantly, to protect the safety and the security of the people who work day in and day out at state-operated services to work with a very difficult and challenging population. I ask for your support of the amendment.
Discussion of the amendment. Representative Albright.
Mr. Speaker, I rise to a point of order.
State your point of order.
Mr. Speaker, I rise to a point of order under 4.03, and I am ready to provide you with advice.
State your advice.
Thank you, Mr. Speaker. While I laud the efforts of Representative Johnson, and I certainly commiserate with his, and as we also would share his concerns for the security hospital in St. Peter, it does come with a fiscal cost, which is not appropriated in the target for the agency for which it would be encumbered. So I would hope that you would find this amendment not in good order.
Members, upon reviewing the amendment and on the advice of Representative Albright, I find the point of order well taken.
Mr. Speaker?
There is another Representative Johnson.
I would like to appeal that, your decision, and I'd also like a roll call on this.
Representative Johnson moves to appeal a ruling of the Speaker and requests a roll call. Seeing 15 hands, there will be a roll call. Representative Johnson, to your motion.
Thank you, Mr. Speaker, and Representative Albright. Yes, clearly this is an additional amount of money. That's obvious. But you know, I was sitting in the House Ways and Means Committee this morning, and to learn about the budget. I go there occasionally when one of the bills in my committees is before the committee, and this morning was the Agriculture Finance bill, so I went there to observe that. But I learned something else this morning, and I learned that on the bottom line there's still $39 million. And I'll tell you, the folks in St. Peter that work at the Security State Hospital, is that the bottom line is that money should be used for their safety and for their security. This is the place to put it, folks. And this is a great place to put it. I also learned this morning about there may be a disaster bill. My neighbors who live in St. Peter and who work at the Security Hospital would argue with every one of you with a straight face and make a compelling argument that there is a disaster at the State Hospital. It started about 1.5 years ago when somebody was murdered. A patient was murdered at the hospital, which led to the conditional admission, which led to a whole lot of activity this summer. There was a lot of activity and a lot of progress was made, a lot of hard work. Again, one of those cases where there's a lot of tension. People who worked hard and people with management and staff caring about those patients, taking steps to improve the safety, the security, and the care for those patients. And yet in this bill, there's not enough money to take care, to make sure we can fully staff the security hospital, to make sure that we can provide for the safety of the patients and the people who work there. A basic responsibility of state government, it seems to me. And so yes, this is that sort of a disaster. There's money on the bottom line, and again, members, the people who work in state-operated services would make a compelling case for you that the bottom line is we need to spend this money here, and therefore I ask that you vote against the ruling of the Speaker.
Mr. Speaker.
Representative Dean.
Mr. Speaker and members, Representative Johnson, there is a great concern at the St. Peter facility, also the Anoka facility, I would point out, that we have heard from all session. There is a safety issue. We believe that. That is true. With the recent court rulings that have changed the way that we can deal with patients, with the unique characteristics of that facility, with a lot of the management issues that we have come across, I have great concern about the long-term management of that particular facility as well as Anoka, and we have to really think about the safety of the state employees that we ask to go to work every day in these facilities. It is hard work. It is dangerous work. There is a great deal of overtime, and in fact, I think an unacceptable amount of overtime, particularly at the St. Peter facility from what I've seen. I've heard directly from people who work there before and after the $10 million was appropriated earlier this year, that I think we've got some great concerns. I have concerns, I know other members do too, about that facility, the Anoka facility, and others in developing a really good policy for Minnesota to move forward where we can provide adequate protection for our employees. That right now I think we need a lot more information, and you have my commitment that we will look at this within my committee, Representative Mack's committee, moving forward. We also have had the $10 million that was put forth in the earlier this year as well as in the bonding bill. But I want to hear personally more from the people who work on the front lines, not from DHS particularly. I want to hear directly from the people who work there, because I agree with you. I think there is a safety concern, Representative Johnson. Thanks for bringing the issue forward. But at this time, I think we do need to look at that more in committee, and you have my commitment that we are going to look at this, take it seriously as well as Anoka, and I want to hear directly from the folks who work there.
Members, as a reminder, the question before the body is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker. A no or red vote goes against the ruling of the Speaker. It is in relationship to the A16 amendment and whether that amendment is a violation of Rule 4.03. Those are the items that are before the body right now. That's the question. Representative Considine, to that point.
Thank you, Mr. Speaker. Thank you, Representative Dean. I was on the front line there, so I can tell you how dangerous it is. Again, I think I pointed out the other day, I had my ribs broken, knee operation, half a dozen pairs of glasses broken off my face. I was walking over with Representative Mack today, and I quickly turned around to see who it was coming up behind me, because people that work at the security hospital do not like people coming up behind them. If you see these people coming up to a corner, they will step out and look around it to make sure there's not somebody waiting in ambush to hit them. You really cannot begin to imagine what it's like to be there. It is beyond your worst nightmares. When I was there, we had a psychiatrist come down. She had to pull over 7 times between the Twin Cities and St. Peter because she started hyperventilating. She quit after a week. The other thing that I would like to point out about this is that Yes, it's very important that staff are getting hurt there and that there's been a record number, but somewhere between 70 and 80% of the assaults happen to other patients, vulnerable adults. And they have got to be at least as important as the turkeys in southwest Minnesota. So I would really urge you to overrule the speaker's decision and get some help to people that are in a combat situation. Thank you.
Representative Johnson, to the question before the body. Representative Johnson.
Thank you, Mr. Speaker. And again, thank you, Representative Dean, for acknowledging that there's a problem. And I think everybody involved will acknowledge that it's a long-term problem. But it's also very much a short-term problem. And to the question, we've got money on the bottom line to address the short-term problem. That problem is there right now tonight. Remember, this is a 24/7 facility. That problem exists right this moment while we're talking here. We're comfortable in this room. It's not so comfortable at the security hospital. It'll be there tomorrow and the next day, and certainly come July 1st when this bill would become law, and when there's no new money for state-operated services, and there's not a nickel to meet the terms of the conditional license. The conditional license needs to be addressed for multiple reasons, again, primarily because it offers an opportunity, if we address that conditional license in a good way, to alter the paradigm, to alter the way that the security hospital works to improve the safety and the care for patients. So I strongly recommend that you vote against this decision, and remembering there is money on the bottom line and it can be applied towards these people right now. This is where it belongs, members. Thank you very much.
Any further discussion on the question? As a reminder, members, the question before the body is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker. A no or red vote goes against the ruling of the Speaker. The clerk will take the roll on that question. The House is under call. Members, please vote. The clerk will close the roll. There being 72 ayes and 61 nays, it is the judgment of the House that the decision of the Speaker shall stand. There is another amendment at the desk. The clerk will report the amendment.
Liebling moves to amend Senate File 1458, the second engrossment as amended, and the amendment is coded A9-1.
The member from Olmsted, Representative Liebling, to explain your amendment.
Thank you, Mr. Speaker and members. First of all, I'd like a roll call on the amendment.
Roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Liebling.
Thank you, Mr. Speaker. Well, members, here it is 9 o'clock, after 9 o'clock, and we're finally going to start to talk about one of the most important things in this bill, which is the repeal of the Minnesota Care program. I suspect it's not an accident that this has kind of gotten pushed off to one of the later hours, but I believe this is one of the things that Minnesotans are watching. They're watching this because so many Minnesotans have benefited from the Minnesota Care program over the years. They know it works well. And in fact, Representative Dean has said in committee that this program works well. There's really nothing wrong with the program itself, but what we've heard from Representative Dean as one of the rationales for repealing the program in this bill is that it's unsustainable. Well, members, if you really believe that it's unsustainable, then you should have no problem voting for this amendment. Because all this amendment does is it says that Minnesota Care would not be repealed as long as there is not a budget deficit in the Healthcare Access Fund. So, as long as there's money there to pay for it, Minnesota Care should stay and continue serving Minnesotans, low-income Minnesotans, Minnesotans who are temporarily out of a job, Minnesotans who are struggling to start a business and don't have other health care and who can't afford a private plan, even with a subsidy for their premium. So, members, I've asked the desk to send out, I think the pages are bringing around, a copy of the Healthcare Access Fund fiscal sheet that will show you there is no deficit in the Healthcare Access Fund in this coming biennium, and there is no deficit in the next biennium. And while it is true that the Healthcare Access Fund, that the taxes that feed it are scheduled to sunset, that's not going to happen we could certainly keep this program going in this budget and in the next budget while we figure out an alternative or a way to refill that fund. So members, saying it's unsustainable is not a real serious reason to get rid of Minnesota Care. And we do know what the reason is. We know the reason is so that the Healthcare Access Fund money can be taken, put in the general fund, and the real reason is so that you all can pass a great big fat tax cut that mainly goes to the wealthy at the expense of these approximately 100,000 Minnesotans who depend on this very good, very effective healthcare program, a program that is supported by providers all over the state, a program that is heavily depended upon in rural Minnesota. And this is a program that you all are getting rid of in your bill for the simple reason that you want to take the money that is used for this program. So members, take a look at what I've passed out. It's true the fund goes to zero. That is not a deficit. And that is after the spending has been done for the Minnesota Care program. So there is money in the fund for the next 2 biennia to support this program. So members, that being the case, if you believe, Representative Dean, that this is unsustainable, that there's not enough money in the fund to keep it going, then you shouldn't have any problem voting for the amendment because you'll be able to keep the bill intact and there won't be any problem. So members, please vote green.
The member from Washington, Representative Dean.
Thank you, Mr. Speaker, and members. Well, thank you, Representative Liebling, for passing out the health care fund balance. I do appreciate that. What it doesn't show you is that actually the top line revenue source for this is going to be going away. That will be going to zero. That is what feeds this fund. The 2% sick tax is scheduled to sunset in 2019. Now, I understand that. Governor Dayton agreed with that. He signed that bill. And you might disagree with that policy decision. And in the last biennium, you could have extended that. You could have repealed that. But in fact, we decided that as a policy decision. And why did we decide that? Well, what we were told was, if you expand Medicaid, Minnesota, you've done a great job. This is the federal government talking. You've done a great job. You have provided for your Minnesotans with conditions that make them uninsurable through MSHA. Good job. You're not going to have to do that anymore. You've done a great job in providing for your low-income Minnesotans who can't afford health insurance, who live on their own. You don't have to do that anymore. Step aside, Minnesota. You've done a great job in caring for Minnesotans in families of low incomes and middle income through Minnesota Care. But Minnesota, stop doing that. You can just step aside, let us step in. We got this. We got this. So what do we do? We said, well, all right, this is Governor Dayton said this sounds like a great thing. Minnesota, best health care in the country, one of the lowest uninsured rates in the country. We're going to jump in this pool before we take a check of how deep the water is. We're going to be the first state in. And not only that, remember that public option thing that President Obama pitched? He said, hey, how about if the government could compete with healthcare companies and people could choose a private plan or a public plan? Remember that public option? 49 other states said, no, we don't want that because we can't afford that. That doesn't sound like a very good idea. Not only did we take that basic health plan, how many other states in the country have a basic health plan? Zero. Thank you, Dog Pound. Zero. 49 other states knew that they couldn't afford that. And not only did we do that, we took the public option and we made it mandatory. That's not an option. We said if you're 133% of federal poverty guideline to 200, if you're that family, you can't choose your health care. 49 other states said you can choose that if you want to. We took away choice from that group of people. That's what we did. And then we said, well, the federal government is going to reimburse us for the Minnesota care through the BHP, so we got that covered. Once again, government, Minnesota, step aside, we got this, until the cost came in. So the cost of the BHP is a Lexus. The reimbursement from the federal government is a Yugo. And the difference is the Healthcare Access Fund. And that's what you drained to pay for the Lexus. Now we're going to have to figure out how to renew the lease. And that's what's coming up here. Representative Liebling, you didn't bring up the point that in the Senate, they understand that. They're moving this fund into the general fund. They understand that they can't pay for this long term. Senator Laurie, good for you. You understand that we have to figure this out long term, and I will look forward to working with Senator Laurie on that. So that's just a basic primer on the basic health plan, why Minnesota chose to adopt it, and why it's costing us so much money, and why we're having this conversation tonight. So once again, Representative Liebling, thanks for actually sending out the Healthcare Access Fund balance sheet. It shows members actually how much money we are spending on this program. And just think, members, if we took part of that money and gave it to Minnesotans and gave them another $100 million in savings in tax incentives immediately that they could buy up, they could actually purchase a private health insurance policy that actually fit their family, that they actually could go out and choose and buy and afford, that would be a good policy for them. That's what we're trying to do here. And if you look at those numbers, those are real numbers, over $1.4 billion for 2 years for 60,000 policies. That's not sustainable. We can actually use those resources to help people buy their own insurance that they choose. That's what we're talking about tonight. We do appreciate that, that you're bringing that forward, Representative Liebling, but I would rise under Rule 4.03. As you know that this is not in balance, Representative Liebling, I ask that you rule this out of order.
Representative Dean rises to a point of order under Rule 4.03. Representative Liebling, do you have advice?
I do, Mr. Speaker. I have advice.
State your advice.
I've never seen a bill in my now 11 years here in the body that made up money and played as fast and loose with the facts as the bill that is before us. And Mr. Speaker, if it's really true, again, if what Representative Dean is saying is true, if in fact this is not sustainable, I mean, Representative Dean said that, oh, thank you for handing this out, it shows it's not sustainable. It does not. Yes, it's true that the Healthcare Access Fund goes away, but that's not until fiscal year 20. It's off the sheet, Representative Dean. It's 2 biennia away. But if what he's saying is true, then there's no fiscal problem in adopting my amendment. None at all. Because Minnesota Care would go away just the way he's got it in the bill. If there's a deficit, if we can't afford it, if the money that's being paid, collected by providers for this very purpose, is not enough, along with the money that we are getting from the federal government, which is somewhere around half, You know, we'd like it to be more, but it's still a significant amount, and some of it is paid by premiums that are paid by the people on this program. But if that's really not sustainable, then there's no problem with my amendment. It's perfectly in balance. So I guess, members, Mr. Speaker, I guess if you rule that this is out of order, I guess you're saying that Representative Dean is not telling the truth.
I find the point of order well taken. There is another amendment at the desk. The clerk will report the amendment.
Mullery moves to amend Senate File 1458, the second engrossment as amended, and the amendment is coded A34.
The member from Hennepin, Representative Mullery, to explain your motion.
Thank you, Mr. Speaker and members. Well, here's another instance where Republicans are going back on their commitment to reducing the achievement gap. You know, when I was out in Washington, D.C. in November, at the White House meeting with the top two advisors for President Obama, they told me their biggest change was going to be based on all of the recent research showing how important the home visitors were to early brain development and to success in life, and that they were moving money from other areas of early childhood towards that. And just this morning I was talking to Art Rolnick. I met with him and a former Federal Reserve economist, and he said the same thing. He talked about how important the visitor program. So now when all of the experts are talking about the importance of the home visitor program and brain development, where are the Republicans doing? They're raiding the money, the $15 million that's in the budget for that, and putting it back into another fund and into the general fund. And at the same time, they're turning down the request from the governor for an additional $2.5 million for the home visitor program, which is so important. And members, this just is, there just is not anything backing up the claims that you are going to help on the achievement gap. There was a little effort in the education bill, but it was 1/8 of the governor. And in this bill, there was a great opportunity to do the things that many of the experts around the country and also local experts and even the people from counties that work with these kids that are not growing up right. And that's the fact that the child care money for people on welfare and for the low-income people who are working hard but just make a little over the welfare cutoff limits, there was huge need for money in that to help those kids, because they are the ones that are not turning out as a success and they're not contributing. Many of them are unfortunately falling by the wayside, and we could help them with that extra money through this. But members, I was going to take the money in this for this amendment from the durable medical equipment increase and Merck, but unfortunately the staff added some other things, the Gillette Hospital and other things that I didn't intend to take money away from. And so, Mr. Speaker, because the staff caught their mistake too late for the correction, so I have to withdraw the amendment.
Representative Mullery withdraws the A34 amendment.
Mr. Speaker?
Mr. Speaker?
Representative Zerwas, for what purpose do you rise?
Will Representative Mullery yield to a question?
We're on.
As it relates to, yeah, there's no question before the body right now.
Mr. Speaker, I'd move that we lift the call of the House.
Representative Thiessen moves to lift the call of the House. All those in favor signify by saying aye. Aye. Those opposed, no. The motion prevails. There is an amendment at the desk. The clerk will report the amendment.
Liebling moves to amend Senate File 1458, the second engrossment as amended, and the amendment is coded A37-1.
The member from Olmsted, Representative Liebling, to explain your amendment.
Mr. Speaker and members, earlier in the evening, when Representative Dean was speaking about his bill, he talked about Ronald Reagan, and he's mentioned this a few times about how Ronald Reagan said that you just put on your coat and hat and go out and look for fraud, and then you find it. Well, Mr. Speaker, this bill, I want to go back to the beginning when this bill was introduced, and something that Representative Mack said about the bill really caught my attention. She said it's an incredible bill. An incredible bill. Well, Mr. Speaker, truer words were never spoken. This bill really is incredible. And we heard a little bit about that in our earlier discussion about the fiscal note, about the $300 million that's supposed to appear from somebody putting on their coat and hat and going out to look for fraud. And that's what this amendment relates to, members. So this amendment says that if the Commissioner of Human Services determines that the implementation of those sections will not achieve the projected savings, the Commissioner shall, within existing resources, purchase a metal detector, and I'm sorry, there is a little error here. It says a metal director. It means a metal detector. Put on her coat and hat and sweep the Capitol lawn to find the coins with which to backfill the shortfall. And members, I submit to you that this amendment that may seem ridiculous to you is really no less ridiculous than what's in the underlying bill, because it comes back to the point. You can't make up the numbers. And making up the numbers in this bill, it isn't just fanciful. I mean, my amendment here is a little bit lighthearted, but the effect of your bill is not lighthearted at all. The effect of your bill is to break promises to lots of people to whom promises are made in the bill. You've got over $300 million of new spending in this bill, and they're checks that are written on an account with nothing in it. So you are handing to every group and every person that you want to make promises to in this bill, you are handing them a bad check, a check that's going to bounce. You are undermining our entire healthcare system with the way this bill is put together, members. And that is a key to this bill. It is so unfair to Minnesotans to do that. It is so unfair to make promises based on savings that can't be achieved, that maybe we should all get out our metal detectors and go outside and see if we can find some coins, because that would make just as much sense as the phony savings that you've got in the verification procedure in hiring the vendors. And let's not, make no mistake about it. I and the members in the DFL, we support the idea of rooting out fraud and waste and making sure that every person who's on our programs is actually eligible for those programs. And in fact, we spent quite a bit of time in Representative Mack's committee talking about some language based on the OLA's report to try to get at the bottom in another way of whether we are getting what we are paying for. And I hope we'll have more discussion about that later on. So we certainly believe that there's money being wasted. However, there's no evidence to suggest that we can get the savings that are in this bill and that this bill relies on. And so with that, Mr. Speaker, I'll withdraw the amendment.
Representative Liebling withdraws the A37-1 amendment. There is another amendment at the desk. The clerk will report the amendment.
Halverson moves to amend Senate File 1458, the second engrossment as amended. And the amendment is coded A5.
The member from Dakota, Representative Halverson, to explain your amendment.
Thank you, Mr. Speaker. And the A5 amendment goes to the portion of the bill that we've been talking about just now regarding the alleged savings from the eligibility audits in Medicaid. What I'm asking is that we amend that section of the bill to protect our counties. When we first heard this bill in the Finance Committee, the original fiscal note that we got on it, and obviously those fiscal notes have been changing quite a bit, but there was a statement in the narrative that I found chilling, and it said, this bill will have considerable impact on counties. In fact, the savings from this bill are directly dependent on robust staffing at DHS and counties. And in fact, we often have been hearing about the Illinois experience and what happened in Illinois, and that this is kind of a panacea for all of our needs in funding healthcare in Minnesota. If we can just root out this $300 million in fraud that our most recent fiscal note says doesn't actually exist. In order to do this in Illinois, they had to hire 200 caseworkers, in addition to hiring their private contractor that they hired at $70 million. The notion that we are going to be able to responsibly use this money is really concerning. And the fact is that we know for sure, based on the Illinois experience, that this is going to cost our counties money. And I don't know about your counties, but I can tell you Dakota County Human Services does not have a few $1,000,000 lying around. So they absolutely need to be reimbursed. And so this amendment says that if the vendor does not root out the alleged $300 million that this budget is being balanced on, that at the very least our counties are going to be held harmless for the work that they do. And I ask for your support on the amendment. Mr. Speaker, I'd like a roll call.
A roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Halverson.
Thank you, Mr. Speaker, and I ask for your support on the amendment.
Further discussion. The member from Wabasha, Representative Drazkowski.
Thank you, Mr. Speaker. Mr. Speaker, members, I'm intrigued by the discussion from the minority. While the Democrats are telling us that, well, they don't have a problem with Republicans going after what could be hundreds of millions of dollars of the people's money being used fraudulently and wastefully, and we are coming up with an approach that will exercise some fiduciary responsibility over the people's money. They puff up these ideas and they puff up these excuses for not supporting the bill, supporting what I understand to be a very good bill. A bill that strengthens our nursing homes throughout Minnesota. A bill that contributes to the 5% campaign. A bill that protects vulnerable people in our state. And all they can do is puff up and say, well, we're not sure that'll work. Well, representatives, I would ask you, what did they do in Pennsylvania? What did they do in Illinois? Do you think they looked at their fiscal note and made sure the I's were dotted and T's were crossed? Yep, it's going to be exactly $300 million. No, as a matter of fact, members, I have talked to some of these firms that do this. The question I pose is, well, how can we estimate, can you tell us what it is that we're going to save? Or how do we know how much we're going to save? And that has been the straw man argument that you're placing in front of us tonight for what appears to me to be your answer to not wanting to vote for this bill, what is a very, very good bill put together by Representative Dean, Representative Schumacher, and the committee. And they had to start somewhere there. As Representative Dean pointed out with President Reagan, you got to go out and do it. You got to go do the work. They did in Pennsylvania. They did in Illinois. They came back with hundreds of millions of dollars of the taxpayers' money that was lost to fraud, waste, and abuse. And we're not just talking about fraud here, although some of the studies show us that fraud is a very large component. Waste. In Illinois, 8,000 dead people were kicked off the welfare rolls by doing this, by exercising some fiduciary responsibility over the people's money, exactly what Representative Dean and our HHS committee came forward with in this bill. 8,000 people. Now we hear from the minority leader that, oh, well, the Department of Human Services doesn't think that this will work. They don't really think these numbers add up. They don't think these are accurate. Well, Representative Thiessen, you know what? Myself and some other members over the last couple of years have been exchanging letters with our commissioner, the Department of Human Services. And we began asking her this question way back then, after realizing there was a series of audits. A series of audits from our legislative auditor spanning 10 years. Over and over again, the auditor would go in a variety of ways and come back and show that they weren't doing the job that they are required by federal and state law to do. That is to show that the people signed up for our programs are eligible for them, that they are who they say they are, they have the familial status they say they have, that they're citizens of our country, that they have the income that they say they do. Well, I sat down with the legislative auditor after his audit of October of last year, and you know what? He told me that they weren't, that MNsure, which is now the function that is out there that is supposed to take care of the eligibility screening for these billion-dollar programs, $10 billion in state money per biennium. I think it's another $10 billion of federal money per biennium on top of that. And he said we weren't even, our MNsure system was not even communicating with the Department of Revenue in their databases to look at the income that they were supposed to look at to ensure income eligibility. They weren't even trying. And that's what we found out through our inquiry with the commissioner. She would come back a couple of times and say, yeah, we're doing that, we're doing that. And then we'd follow up further and say, well, no, you aren't. We shared that letter with the legislative auditor. And he sent the letter back, and suddenly, oh, I guess we aren't doing that properly, but we'll abide by the past audits, as they've said over and over and over again. Now, Representative Dean pointed out we're 50th in the country, dead last. The Medicaid fraud control units have listed the units that are the association of units that are charged with chasing down Medicaid fraud, have listed Minnesota as the worst in the country. And other states are lining up to do this. So I ask you in the minority, why aren't you helping us? You say you're okay with this. It's okay to make sure that people are eligible for their programs. But when the majority steps forward to lead, to do the work, you put up a straw man argument because you don't want to vote for the very good bill that's in front of you and report back to the people of Minnesota. You're going to put up this empty straw man argument that, oh, we didn't know exactly what the numbers were. This number might be too low, $300 million. As a matter of fact, I had a fiscal note for the bill I brought forward, $150 million. That's only a fraction of what's in the bill. Section 34 of the bill relates to the fiscal note that I had for $150 million, and then Representative Pearson's bill. Our two components are in Section 35 of the bill, 34 of the bill. Well, Section 35 actually goes forward in inventories and checks the eligibility, the improper payments of Medicaid payments to the providers, the improper provision of benefits to ineligible individuals by healthcare providers, something not even contemplated in what we had in our proposal, which is in Section 34. So members, easily, it could be twice as much as that $150 fiscal note. Matter of fact, you don't have to look too far to those providers and the money that is leaving, the people's money that is leaving the state of Minnesota in fraudulent ways. The article from September 5th of 2011, $900,000 from one fraudulent provider. Members, that's one provider. Again, Section 35 that would cover that is not even contemplated in the fiscal note information we have. So, members, Democrats, don't give us a straw man argument. You really don't want to vote for this bill. You're creating an excuse. Pennsylvania and Illinois did it, and they prove they can do it. Join Republicans in having the courage that we can show Minnesota that we can do the same. Thank you, Mr. Speaker.
The member from Ramsey, Representative Isaacson.
Thank you, Mr. Speaker. Well, I've been listening for a while now, and I'm trying to figure out where have I heard this before. And Mr. Speaker, I wonder if you could set a page outside to see if the sky's falling, because I've heard this argument before. I have. I heard this argument on taxes just 2 years ago. The sky is falling and the economy is going to implode and we're going to ruin everything. Oh, but wait. Every meaningful fact economically tells me that you guys were wrong about that. But wait, there's more. There was a second time I heard that. When did I hear this again? Oh, that's right, voter ID, rampant with fraud. Oh, but the facts didn't back you up again. So I'm hoping here maybe third time's a charm. Or let me offer an alternative narrative of what's occurring right now. We have a great economy, and there isn't much of a message to run on. And there seems to be a pattern of manufacturing crises about our government. And what I think I enjoy when I listen to these arguments, and what I think is relevant, is this idea that you seem to want to find things wrong. It's amazing to me when I watch this. And unfortunate. It's a pattern. It's almost like a dysfunction. Your guys' desire to find things that you believe are wrong and run it up the flagpole. And here's my question. How many times do you have to run into the brick wall before you realize this pattern doesn't work? You should try governing. That'd be a really good move, rather than cutting in these gimmicks.
The member from Dakota, Representative Halverson.
It's late. Thank you, Mr. Speaker. Well, you know, the one thing I would say is that we're not talking about a straw man argument. The straw man that exists in this discussion is the savings that are being booked under this provision that never materialized in the other states that attempted this. And we can talk a little bit about the Illinois situation. I passed out the re-eligibility determination from the state of Illinois. This was mailed to individuals in plain white envelopes. And what ended up happening was 79% of the people that were disenrolled because they didn't send this form back. Turn around 3 months later, a third of them were already re-enrolled because they were inaccurately removed from the rolls. That took a lot of time and a lot of money from our county and state DHS workers, and that is certainly what's going to happen again. And the savings that were supposed to be materializing in Illinois did not happen. They booked $350 million worth of savings into their budget. They had to turn around the following year and edit that down by 46% because the savings weren't materializing. Again, this is as they were hiring 200 caseworkers. This is as they were hiring a private contractor, Maximus, at $70 million. To do this particular work. And Maximus made some promises to them. They said they were going to build some databases to do some checking and double checking and rechecking. That never happened. They never delivered on their promise to create those databases. Do you know whose databases they have to count on? The counties and the states. So they're counting on our labor, our employees, our money, our resources as taxpayers in order to deliver something that they can't deliver. The fact is that about 6%, once these caseworkers analyzed all of the disenrollments, about 6% were deemed to be worth investigation. Of those 6% that were deemed to be worth investigation, about 40% of those were actually eligible, and they were able to verify their eligibility. That we're shrinking and shrinking and shrinking the alleged abuses that are taking place. Now, we have to be very, very clear. No one is saying that we should not be as careful as possible with our eligibility reviews. But the fact is for the state of Minnesota to go out for bid to a private contractor and book mystery savings that we clearly can't back up, either through fact or through experience of other states, is dangerous to Minnesota. And it's dangerous to our budget right now, but let's really talk about who we're going to put at risk. We're going to put at risk the people who depend on this budget for their health. We're going to put at risk workers in St. Peter at the security hospital, because we're booking phony savings into our budget. We're going to put at risk seniors in nursing homes in greater Minnesota because we're booking phony savings into our budget. And if we have even as good an experience as Illinois had, and we have to come back next year and say, whoops, we're going to have to downgrade our assessments by about 46%, where does that 46% come from? We're talking about hundreds of millions of dollars in a budget that can't even do the basic things that we need it to do. We can only give our long-term care workers a 5% increase for 1 year. We're not living up to our promises, and we're doing it on a budget that is essentially being pulled out of thin air. So I implore you to be responsible. I implore you to be honest about what our budget in Health and Human Services looks like, and be honest about what we're going to do to the state of Minnesota if we move forward by booking these kind of phony savings. And at the very least, I'm asking us to hold our counties harmless and to make sure that we are not burdening our taxpayers anymore by shifting our costs to the counties. Thank you.
The member from Washington, Representative Dean.
Well, thank you, Mr. Speaker and members. And to Representative Halverson, I would just direct you back to the states that you identified. Both of those states indeed did experience savings of more than $300 million. And in case of Pennsylvania, in Pennsylvania, they launched their program in 2011, and in the first 10 months of operation, they identified 160,000 ineligible folks. That resulted in $300 million in taxpayer savings in the first 10 months. That earned them the Council of State Government's 2012 State Innovation Award. Representative Halverson, I think that you have to understand, you talk about, the desperate look at this thing. We had folks on your side trying to find a fiscal note this afternoon in the matter of a couple of hours to go out and try to find a fiscal note on a portion of this bill to allow you some rationale for voting against a 5% increase to our folks who deliver direct care in the homes, to vote against a generation in the waiting nursing home payment reform bill, to vote against some of the best reforms and money delivered to people with disabilities and the Minnesotans who care for them. That's the desperation. How are you going to vote against this? We need to find something. So you ran out and you got a phony fiscal note cooked up in the afternoon to do that. And I find it interesting that that's what we're going to do. Representative Marquardt yesterday, or whenever we voted on the K-12 bill, was gesticulating wildly about how we own this, the K-12 bill, and we own every cent of this. Look at Minsure. Look at the folks in your district, Representative Marquardt, that you're going to vote no on this bill. You're going to bring back to the small business owners, the folks in your district. You're going to vote no. You're going to vote against the nursing homes, Representative Marquardt, in your district. And I don't want you to say, well, the Republicans own that. I would like you to maybe think about the people with 140,000 hardworking Minnesotans who promise if you like your doctor, you can keep your doctor, Representative Marquardt. If you like your plan, you can keep your plan, Representative Marquardt. Remember those folks? 140,000 Minnesotans lost their plan. They don't get to jump on another public program. They got insurance that costs more with higher deductibles and higher premiums because our private insurance market got hurt by what you did. Okay, and we could talk about this is on you or this is on us, but Representative Marquardt, you're going to have to go back and talk to those folks, and you're going to need more than a fiscal note that you say is cooked up. Representative Halverson, do you really want to go back to your district and say, we can't afford to find the dead people that we're continuing to pay for services for? We don't have the money, we just don't have the resources to do that. We can't be like Illinois, we can't be like Pennsylvania that go through and find dead people that we're paying services for. We can't find people who are ineligible, who are receiving services. We just can't do that. We can't do that because the fiscal note doesn't say we can do it. Do you really believe that the people in your district, Representative Halverson, are gonna believe that, the fiscal note excuse, when they look at the nursing homes, when they look at the real good that is being done across the state of Minnesota? I don't want to have to make that argument. I suggest that you don't and you vote for the bill.
Representative Thiessen.
Well, thanks. Thank you, Mr. Speaker. You know, again, I like the fact that Representative Drazkowski brought up strawman arguments because that's what we keep hearing from the other side. No one is saying that we shouldn't do this. No one is saying that there can't be savings. The fact is, there's not going to be savings as quickly as you think and not as big as you think. That's all. Representative Drazkowski, the number, the $150 million number you're talking about, in your fiscal note, I hope you actually read your fiscal note or understand it, because it's for the next biennium. The problem here is that the numbers don't add up on the spreadsheets, and that is important. Whether you think it's not important or not, I can't believe I hear Republicans saying spreadsheets don't matter. I mean, so you basically tried to mislead the body, Representative Drazkowski, by pointing to a second biennium number when we're talking about the first biennium. Of course we want this fraud. But as to the good in this bill, there are some good things. But what else is in this bill? Well, there's significant cuts to providers in this bill. If the cuts in this bill were spread across every provider, it's a 3.2% cut. That's for your hospitals, your home and community-based service workers, your mental health workers, your pharmacists, 3.2% cut of their rates right off the top in Representative Dean's bill. If you take out long-term care, health and community-based services, you just focus on hospitals, doctors, mental health providers, you got a nearly 6% cut to their rates in this bill. That's what you're doing to Minnesota in this bill, Republicans. If you just focus on the home and community-based service providers, so the people that provide long-term care services but not nursing homes, and you do the cuts that you're proposing in this bill to them, which is an option under this bill, 7.2% cut to those providers. That's what you're going to be voting for in this bill. If you do it, if it's just the hospitals, which is another option under this bill, you're cutting their rates 22.5% cut to your hospitals under this bill. That's what you're voting for when you vote for this bill. And if you're just talking about pharmacists, it's a 40% cut. So that's one of the great things in this bill, that you're going to be cutting the provider rates for all your providers, your rural hospitals, your small clinics, your pharmacists, your home and community-based service providers, your PCAs, your assisted living folks. Those are the kind of cuts you're voting for in this bill. Don't make any mistake about it. You have nothing. Representative Franzen has made a huge deal this year about making sure that we take care of people that have kids that need caring for. She's got nothing in the bill. You're not doing nothing to support those families that have kids and need help with their child care expenses. You're doing nothing despite the huge promises you made. And on Minnesota Care, even the fiscal note that you're talking about says at least over 10,000 people are just not even going to try. They're going to lose their health care right away. And what you're probably talking about is tens of thousands of people losing access to Minnesota Care under your bill. So you can talk up your bill all you want, but that is the kind of thing that you're going to be voting for in this bill. You're getting rid of nurse visiting. You're cutting them drastically, something that could actually fundamentally help our families and save us lots of money down the road. But those are the kind of things that you're doing in this bill, members. So you can puff yourself up, as Representative Dean said all he wants, about the great stuff that you're going to be voting for. But remember, what you're voting for is these kind of cuts. That's what you're doing, and not to mention the fact that it's built on fake money. So, of course, Representative Drazkowski, you can go ahead and do all this stuff. I think you'd get support from us to go ahead and do all these things. The fact is, the numbers don't add up on the spreadsheet. So the promises you're making to those nursing homes and those to those workers, the money's just not going to be there. It's a false promise, and that's what's so offensive about this bill.
The member from Clay, Representative Marquardt.
Thank you very much, Mr. Speaker and members. And Representative Dean kind of brought me into this discussion. By the way, little Johnny is still looking for that skyscraper owner to see if he can get $1 out of those 29 he got. But maybe we'll figure that out tomorrow in the tax bill. I don't know a lot about the Health and Human Service bill, but I do know when rural Minnesota is getting a raw deal, and it's in this bill. With a $2 billion surplus and a record high spending budget target, you're cutting over $500 million, cutting Minnesota Care. 40,000 folks from rural Minnesota are on Minnesota Care, including a lot of farm families, because they can't get the discounts to be in part of groups. So a lot of our farmers out there rely on Minnesota Care for that program. And also, according to the Department of Health and Human Services, the top 25 counties in the state, with the percent of enrollees per population, the top 25, every single one is from rural Minnesota. By eliminating Minnesota Care, you are hurting rural Minnesota. And one of the good parts about this, which is the nursing home funding, is built on a house of cards. Our senior citizens that you're talking about, this nursing home funding, that funding is built on a house of cards. And I think the total funding for the nursing homes and the home care health-based is about $238 million. And yet, the hole in your budget, the house of cards, as Leader Thiessen has said time and time again tonight, is about $285 million. You are promising seniors something that you really may not have the money for. You are being very disingenuous with seniors out in rural Minnesota when you put funding in this bill that is $285 million short of a fiscal note. I mean, I'm not on Health and Human Services, but I know that doesn't add up. Not even close. And one last point I'll make. Talked about the big 5% to our personal care attendants. After years of cuts under the Republicans, we finally increased that 6% the last year. But you give 5% increase this year, and then it drops down to 0. 5%, and then it drops to 0. Nothing permanent, but guess what? That skyscraper owner, the tax cuts he gets, not only are they permanent, they go up further than the eye can see on the budget charts. So if you're holding up this Health and Human Service bill as some great shakes for rural Minnesota, forget it. This is a raw deal for Minnesota, and I'm not even on the committee, but I can see that by looking at the numbers.
Representative Davids.
Well, thank you, Mr. Speaker, and to Representative Marquardt. I'm not sure what you're talking about skyscrapers, but I just want to make sure that you understand that Johnny's going to do much better than what you're saying. I don't know what bill you're reading, but if you read the tax bill, you'll find that 75% of the money goes to individuals. Now, the other day in some press conference, I said middle class, which was figured out that that was correct too, but it goes to individuals. So I think Johnny's an individual, and so of that $30, he gets $22.50. And that doesn't include the ones in the CI where those buildings are owned privately and not by a corporation, a subchapter S or an LLC. So members, you'll sleep good tonight. Johnny gets at least $22.50 out of that $30, not $1.
Representative Moline.
Well, thank you, Mr. Speaker, and hopefully Johnny is the heir to a $5 million estate. Otherwise, those middle-class tax breaks in your bill are capped at 2 years. Will Representative Heitzman yield for a question? Mr. Speaker, I'm sorry, will Representative Heitzman yield for a question?
He's not on the floor, Representative Moline.
Will Representative Lueck yield for a question?
He will yield, Representative Moline.
Thank you, Mr. Speaker. Representative Lueck, how many people in Aiken County receive Minnesota Care?
Representative Lueck.
In Aiken County, approximately 400, a little over that.
Representative Moline.
Thank you, Mr. Speaker. Will Representative Lueck yield for another question?
He will yield, Representative Moline.
Well, thank you, Mr. Speaker. So, Representative Lueck, you must know that out of the 87 counties, Aiken County is the second highest in enrollees in Minnesota Care in relation to the population. Over 5% of people aged 20 to 64 are enrolled in Minnesota Care in Aiken County. The number one county is Cook County, and the mayor of Grand Marais said that if Minnesota Care is ended, people would not be able to live in that community. That's what the mayor of Grand Marais and Cook County said. Do you believe that same would be true for Aiken County?
Representative Lueck.
Thank you, Mr. Speaker and Representative Moline. The real issue here in Aiken County and throughout Minnesota is really a lack of choice. We've also got some folks that are dealing with MNsure in Aiken County and Crow Wing County. So the end game here is to provide all of them with something that works and something that's not going to bankrupt the state.
Representative Moline.
Well, Mr. Speaker, will Representative Lueck yield for another question?
He will yield, Representative Moline.
Representative Lueck, the people who you're eliminating Minnesota Care for in this bill, where are they going to go for their health insurance?
Representative Lueck.
Thank you, Mr. Speaker and Representative Moline. Well, I think if we get on with the business here tonight, we're going to come up with a product that they will be able to go to that will help them out and ensure everybody's that in that lower income bracket is going to be able to get affordable insurance. And we can solve some big problems here tonight if we're just willing to move on and get it done.
Representative Moline.
Well, thank you, Mr. Speaker. This bill doesn't solve any problems. This bill creates a lot of problems for people on Minnesota Care, including the people in Aiken County who count on Minnesota Care. Will Representative Hancock yield for a question?
He will yield, Representative Moline.
Representative Hancock, how many people in Hubbard County are enrolled in Minnesota Care?
Representative Hancock.
Thank you, Mr. Speaker. I didn't hear what county you asked, Representative Moline. Was it Beltrami County?
Representative Moline.
Mr. Speaker, Representative Hancock, Hubbard County.
He will yield, Representative Hancock.
Thank you, Mr. Speaker. Representative, Minnesota Care enrollees in Hubbard County are 458.
Representative Moline.
Thank you, Mr. Speaker. Will Representative Hancock yield for another question?
He will yield. Representative Moline.
Do you agree with the mayor of Grand Marais that if Minnesota Care is eliminated, people won't be able to live in rural communities throughout Minnesota?
Representative Hancock.
Thank you, Mr. Speaker. Representative Moline. Better plans, more choices, better care.
Representative Moline.
Thank you, Mr. Speaker. Will Representative Hancock yield for another question?
He will yield. Representative Moline.
What plan is in this bill for the 100,000 Minnesotans that are going to be kicked off of Minnesota Care?
Representative Hancock.
That is what the plan will do. Minnesota Care is not sustainable in the long run. That has been proven. What we're trying to do here is to allow people to have affordable care in Minnesota, and that's going to provide better choices and better plans.
Representative Moline.
Okay, thank you, Mr. Speaker. So the answer is there's nothing in this bill that's going to address the 100,000 Minnesotans that are going to be kicked off of Minnesota Care, many of them in greater Minnesota. Members, I mean, if you look at the numbers in greater Minnesota, in Aiken County, Hubbard County, Chippewa County. Is Representative Miller on the floor? Will Representative Miller yield for a question?
We're going to see if we can locate him, Representative Moline. In the meantime, I will remind the entire body that we are actually on the amendment that is coded SF1458A5, the A5 amendment. It's short. I could read it to you if you'd like. But I'd like really for everybody to keep their comments to this
Mr. Speaker,
amendment.
parliamentary inquiry.
State your point of parliamentary inquiry, Representative Thiessen.
My question, I guess, is it appropriate for the Speaker to be engaging in the debate on the floor? Representative Drazkowski opened the door by talking about all the good stuff in this bill. So it's your people that opened the door. This is really legitimate.
Representative Thiessen, the Speaker is not engaging in debate. I'm trying to remind the body that to keep the comments to the amendment that is before the body. And in case people lost it, maybe it slipped under the desk or something, I thought that I would just point out what it looked like. So that if we could keep our comments to that amendment, I think this evening might go a lot smoother and a lot quicker. Representative Miller is on the floor and he will yield for a question. Representative Moline, as long as that question relates to this amendment.
Well, thank you, Mr. Speaker. And I had heard the author of the bill, Representative Dean, mention Obamacare more than once while we were discussing this amendment. Representative Drazkowski discussed about every provision in the bill. And so since Representative Miller is here and is wanting to yield for a question, I would ask Representative Miller how many enrollees there are in Minnesota Care in Chippewa County.
Representative Moline, that question doesn't have anything to do with this amendment. Do you have another question for him that does?
Point of parliamentary inquiry.
State your point of parliamentary inquiry.
So, Mr. Speaker, under what basis are you instructing Representative Miller to dodge the question?
I'm not instructing anybody to dodge the question. I've asked for a question that relates to this amendment, and we are far afield of that, Representative Thiessen. This conversation for the last 30 minutes has had nothing to do with this amendment, and my patience is growing short with that. And so is the patience of the other 133 members in this chamber.
Mr. Speaker, is the Speaker permitted to come down to the floor and engage in debate if he'd like to participate in the debate? Or
if I'd like to. The Speaker's not participating in debate, so
to conduct orderly debate.
Take your seat. Representative Moline.
Thank you, Mr. Speaker. Members, I've passed out a letter from the Farmers Union regarding the elimination of Minnesota Care. And what we know, who's on Minnesota Care? Entrepreneurs, small business owners, farmers, people on unemployment that have recently lost a job. If you want to open a business on Main Street in small town Minnesota, it's unlikely that you're going to make a ton of money. If you're in a tourist town in the Brainerd Lakes area, like Representative Heitzman represents, your income fluctuates with the seasons, and it can be very unpredictable depending on the economy. Those are the people that utilize Minnesota Care. Many of the entrepreneurs in greater Minnesota, owners of small business, utilize Minnesota Care. And one other issue I want to bring up is recently laid off people. As many of you have heard from us recently about the 1,200 workers on the Iron Range that are going to be sent home next month due to plants idling. About 300 of those workers have been there for less than 2 years. Pursuant to their collectively bargained contract, if they've been there for less than 2 years, they will not have health insurance when those plants idle. We've had numerous meetings with the steelworkers. Those workers, there's 300 of them, are counting on Minnesota Care. There is a ton of uncertainty in their future. They don't know when they're going to be going back to work. They don't know how they're going to be taking care of their kids. They don't know how they're going to be paying their mortgage. And Representative Dean's bill adds just more uncertainty into their lives. How do they go to the doctor when they're sick? Members, eliminating Minnesota Care causes real harm to real Minnesotans all over the state. There is no solution in this bill for the 100,000 Minnesotans, low-income Minnesotans, farmers and entrepreneurs who are going to be losing Minnesota Care in our districts. The members who I asked could not answer where those people would turn. Members, I would ask that you support the Halverson Amendment and oppose the bill. Thank you.
The member from Dakota, Representative Mack.
Thank you, Mr. Speaker and members. Members, just a point of clarification. Understand we're trying to stick to the point of the amendment, but I do think it's important for members to realize we keep hearing the phrase that we're eliminating Minnesota Care, that we're kicking people off of Minnesota Care. Members, the language is right there in the bill. We are transitioning Minnesota Care. Now, I understand we can go round and round on semantics, but people are not getting kicked off of Minnesota Care. We're providing subsidies to help them offset the costs based on their income, very similar to what Minnesota Care does now. But members, the fact of the matter is we're in this situation for one reason and one reason only, and that is because a couple years ago we decided to accept the option of taking on a basic health plan. Now, I don't know if anyone on the other side of the aisle or the governor, if he were given that chance again, if he would make the same choice given where it's heading us to. But the fact is, members, that the ACA made many promises to us as legislators. And when it originally rolled out, part of that was that the people on Minnesota Care could get swept up into what was supposed to be covered under the Affordable Care Act. And so as a reaction, the provider tax was done away with. Well, when that did not pan out and that did not work out, and we decided to take on the basic health plan, we took on a whole new population of people at a very expensive rate, and it wasn't sustainable. And so now we are forced with the fact and the truth that we are heading down a path to nowhere very quickly, and something needs to be done. This is an option, members, that we can still help these people. I don't think it's fair to tell the public or let people think that we're kicking people off out in the cold with no way to pay for their health care. This transition comes with subsidies. This transition comes with choice. This transition comes with the ability for these people to still shop for their health care with government subsidies if they qualify and if they need it. So I think that members just need to be honest about that. You can disagree with the policy and the way we're going about it, but the idea that these people are going to be left out in the cold with no choices, with no help from the people in St. Paul and the people representing them is a mischaracterization of the facts, and it's really not very fair. And the fact is, members, someone needs to lead on this issue. When the BHP was accepted in the last couple of years, I think most people, as they saw the numbers getting crunched, they knew it was a false promise. They knew it was an undeliverable. They knew that we could not follow through on that unless we somehow found a gross amount of new revenue to pay for it. And so, members, this is a way that we are trying to address problems that were created with that. And we can argue about whether or not it's the right move, but do not mislead the public and make people think that we're leaving people out in the cold without options for subsidized insurance coverage if they need it. Thank you, Mr. Speaker.
The member from Washington, Representative Dean. The member from St. Louis, Representative Schultz.
Thank you, Mr. Speaker. Will Representative Dean yield for a question?
He will yield. Representative Schultz.
Besides the reason of the provider fee sunsetting, because we could extend that fee, why in your bill are you eliminating Minnesota Care?
Representative Dean.
Mr. Speaker and Representative, Minnesota is one state in the country with a BHP. The reason that we decided to do that is unclear to me. But at the time, I must imagine that Governor Dayton thought that the federal government was going to reimburse us for that. Now, you can argue that that might be a good thing or might be a bad thing. That's a policy decision that was made. However, what you can't argue with is that this Minnesota Care that we have with BHP is not what we had 10 years ago or 15 years ago. That the population that we had within Minnesota Care, by and large, has migrated to medical assistance. So that we are looking at now 133% of federal poverty guideline to 200. So, for example, my family would qualify for Minnesota Care as it is today under the BHP at just under $57,000 per year of income. That means that I would have absolutely no choice to go out and purchase on the exchange a private plan that might work better for my family, one that might relate more to the deductibles that I needed or the specific health care needs that I had. But what was decided was I don't get any choice if I'm in that group. It's a one-size-fits-all, take it or leave it, government-issued, top-down health plan that Minnesota decided to do. So Minnesota decided that people in that group don't get any choice at all, but people in Wisconsin do, people in North Dakota do, people in South Dakota do, people in Iowa do, but not Minnesota, because we decided that the government can decide for them what they want. And in committee, strikingly, surprisingly, the argument was made, actually, Matt, you know what? People don't like choice. They don't want choice. Don't want to give them choices. And I was actually kind of unprepared for that argument, to tell you the truth, Representative. Because in my life, people like choices. People on my block generally like to choose one thing over another. But we decided that for folks in Minnesota, Representative, and that was a decision that was made. I think people would like choices more. We not only give them the federal subsidies that they get at the point of purchase, they also get the tax incentives at the point of purchase. We're also supplying $100 million of Minnesota dollars to help them buy up a plan so that they can get a higher metal level, so they can get a higher actuarial value. We think that's a pretty good deal for the citizens of the state of Minnesota and save money, and we can do it 6 years from now, and that insurance can be depended on by those families. So we don't want to promise them, like we did before, that if you like your doctor, you can keep your doctor. If you like your plan, you can keep your plan, because that's what they were told. 140,000 Minnesotans lost their doctor. They lost their plan. They're tired of getting the rug pulled out from under them. So we want insurance for lower-income Minnesotans and middle-income Minnesotans that they can depend on, not just until the next election, not just until the next fiscal note evaporates into a political poof, but something that they can depend on for their families, because actually it's a big deal, Representative, and that's why we did it.
Representative Schultz.
Thank you, Mr. Speaker. I thought you might say that, and I've heard many others on the floor say that you're moving people to MNsure to give more choices. I'm just wondering if Representative Dean will yield for one more question.
He will yield. Representative Schultz.
Thank you. Representative Dean, do you know how many plans firms or employers typically offer?
Representative Dean.
Mr. Speaker, Representative, I don't know the question you're asking. You might want to rephrase it.
Representative Schultz.
Thank you, Mr. Speaker. How many health plans does an employer, if they offer health insurance, typically offer?
Representative Dean.
Mr. Speaker and Representative, I would imagine that depends on the employer, and it might depend on the employee. but that's something that employers like to attract employees with, particularly here in the good state of Minnesota, where we have such great hospitals, physicians, and providers.
Representative Schultz.
Thank you, Mr. Speaker. 85% of firms offering health benefits in 2014 offered only one type of health plan. Even in our provider markets, private employers are not offering a choice. And in fact, Minnesota Care does offer choice. In many areas, 4 plan choices are available. In other areas, 3 or 2. So there is choice. And what your bill is doing is giving people the choice between having no coverage or having more expensive coverage on MNsure with lower subsidies and less coverage. I, for one, would rather have fewer choices and more coverage at a lower cost than having more choices with less coverage, and I'm sure others would agree with me. MNsure only has 4 companies offering plans. Even there we don't have enough choice, and hopefully next session we can work on that. And before, Representative Dean mentioned that we need to reduce spending in HHS to pay for education. If children are not healthy, then spending money on their education is going to be less effective. Funding health care is essential. Children need to be fed, housed, and healthy to learn, and they need healthy parents to care for them. And that's why keeping Minnesota Care is important. And in your bill and in committee, you said protecting children is important. Then why are you putting them at risk by not supporting the health of their parents? I'm going to vote no on this bill. I think the reasons that you've given for repealing Minnesota Care or moving it to MNsure are not sufficient. Thank you.
Representative Atkins. Representative Loeffler.
Well, thank you, Mr. Chair and Mr. Speaker and members. I think it's important for people to remember who we're talking about. We're talking about people who make $8 to $10 an hour, maybe $11, in order to qualify. Yes, a family could qualify if they had 2 workers at $10 an hour and a couple of kids. This is really low income. An average $50 a month subsidy from the state is not going to equal the kind of insurance and the kind of affordable co-pays that we've had. And I think that it's disingenuous for us to even pretend that we are offering an adequate plan when we have a plan that has been proven for decades. This is nothing new. This is a program that people have been enrolled in for decades. I would like to let you know that 47%, almost half of the people in Minnesota Care, are age 41 and over. This is the mom whose kids have left the nest and she's working retail. It's the guy who sells you gas. It's the person who stocks the shelves at the store. It's those low-wage workers who are scrapping by paycheck to paycheck. Some of them, you know, after you get age 40, you're more likely to have chronic health conditions. That means prescriptions. Minnesota Care has affordable prescriptions and no first dollar deductible, unlike some of the plans on MNsure that they would be asked to join, which would have hundreds of dollars, sometimes thousands of dollars of deductibles before they'd even get the first dollar of coverage. That's not affordable when you're living on $8 to $11 an hour. These are people who could say, hey, why work? I'm going to go on disability and see if I can get on medical assistance. Some of them have that serious of health issues. But no, they want the dignity of working. And they don't mind that they're just pushing the carts out in the mega mall's parking lot of some big box store. They don't mind that they are on their hands and knees with the boxes, loading the stuff on the shelves. They don't care that they're on their feet all day long, pushing the buttons on the cash register, because they believe in the dignity of work and taking care of themselves. And Minnesota Care allows them to pay premiums, to select a local provider, to get good quality care without going into medical bankruptcy. That was always the goal of Minnesota Care when it was formed over 2 decades ago. It has been successful in doing that, and we need to make sure it does. And to say you are not kicking people off of Minnesota Care, when you discontinue the program, it's gone. And what you're replacing, a $500 million healthcare industry subsidy with $50 million, just doesn't cut it. It's not affordable. It will not work for our people.
The member from Ramsey, Representative Murphy.
Thank you, Mr. Speaker, to the A5. So we've been hearing a lot
Thank you,
about,
Representative Murphy.
Thank you, pardon me, Mr. Speaker?
I said thank you, Representative Murphy.
You're welcome, Mr. Speaker. So we've been hearing a lot about the transition of Minnesota Care, modernization using the basic health plan, and just generally speaking, what that means is that the people enrolled in Minnesota Care are paying slightly lower premiums and getting a better benefit set. And oh my goodness, that's a terrible thing? I don't think so. I think the people enrolled in Minnesota Care, who pay their premiums, they pay insurance premiums for that coverage, are probably fairly happy with that. And I've been getting a lot of texts and tweets from people who are happy with Minnesota Care, and they have a choice. They pay their premium and they can get their coverage through Health Partners or Medica or Blue Cross Blue Shield. So, they get a choice like the rest of us. But it is affordable and reliable. And the BHP, and here you were thinking we stuck our toe in the water in a bad way. I think Minnesota was leading to make sure that Minnesotans who are paying a premium are getting a decent, affordable benefit set. And who's enrolled? People all across the state of Minnesota, but especially farmers. We made special provisions for that. Firefighters, the volunteers, special provisions for that. Small business owners, and yes, largely in greater Minnesota. So I think you're tinkering with something that's really important to the people of Minnesota. I know I'm hearing from them. Some of them are up in the gallery right now because they're so worried about this. The reason why we are in this jam, you should say hey to them, Representative Erickson. They're here. The reason why we're in this jam is because in 2011, during the government shutdown, when the budget was balanced behind a locked Capitol door, there was a decision made to cut the provider tax in 2019. I voted against that, but I know the Republicans who were in charge then voted for that. We're going to eliminate the provider tax, which funds Minnesota Care. So here we are now, marching forward to 2019, and lo and behold, out in the future, this isn't sustainable anymore, because guess what? We already cut the provider tax, the thing that funds it. This is a self-fulfilling prophecy. This is how we got here. So we can go down your path and say, well, we'll move you guys into MNsure, and hopefully you can afford it, because of course we're talking about people who don't make a lot of money now going into MNsure, right, with a subsidy. The value is not going to be the same. People are going to drop off. That's why I believe, as so many of my colleagues are saying, that most of the people enrolled in Minnesota Care aren't going to have insurance anymore. Now, we made a lot of headway toward reducing the number of uninsured in Minnesota. You're going to tick that right back up again if you take this step. That's why I think I and others are not very happy with the policy that you put together. But most important here, and I want to say that, we've been having some dueling rhetoric about who's fighting for the middle class. And I think this is important because the middle class is important to a strong economy, to economic opportunity, to the ability to work your way up the economic ladder. And every day that I'm here, I'm going to make sure that opportunity and that ladder is there for people. And if it means taking a little bit from the people at the top to make sure that those at the bottom have a sturdy ladder to work their way up through hard work, I'm going to do that because that reflects my value system. But this bill is doing something else. And it's saying, you know what? The middle class is having a hard time, so we're going to cut from the people below you, from the working people who can barely afford insurance, who don't get it through their employer. We're going to take it from them. so you can keep your commitment to the middle class. I don't know how that works, but that's what you're doing. That's what you'll be voting for tonight when you vote for this bill. I'm not going to vote for it.
Seeing no further discussion on the Halverson amendment, the clerk will take the roll on the amendment. The clerk will close the roll. There being 60 ayes and 72 nays, the motion does not prevail and the amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Murphy E. moves to amend Senate File 1458, the second engrossment as amended. The amendment is coded A17.
The member from Ramsey, Representative Murphy, to your amendment.
Thank you, Mr. Speaker and members. And I got to take a deep breath. Can catch myself here. I have an amendment, and it is the CHEER Act, which is about contraception equity for employees. And this is coming as a result of a decision made by the Supreme Court last summer, the Hobby Lobby decision. But first of all, I think I have a bridge amendment. I think I'm talking to the bridge amendment right now, aren't I, Mr. Speaker? And I've got an amendment to the amendment.
There is an amendment to the amendment at the desk. The clerk will report the amendment.
Murphy E. moves to amend her amendment to Senate File 1458, the second engrossment as amended. The amendment to the amendment is coded A62.
The member from Ramsey, Representative Murphy, to explain your amendment.
Thank you, Mr. Speaker and members, and it gave me just a moment to catch my breath. So the A62 is the CHEER Act. You know, when we were talking about Representative Tice's amendment or bill dealing with taxpayer-funded abortion and Representative Keel's bill dealing with licensing, I may have those transposed. One of the things that struck me is the strong feelings that we have in this chamber and division around the issue of abortion, something that Representative Mack and I talk about frequently. And the place where I think we can find more agreement is around contraception. Because if we really do want to see a decline in abortions, the best way to do that is to make sure that we have a decline in unwanted pregnancies. And in Minnesota, actually, since we've been taking or keeping track of the number of abortions happening in Minnesota, we started that in the early 1980s. We've seen a steady decline in the percentage of abortions being performed in Minnesota. The drop from the time we started recording until now is about 46%, which is, you know, I think, you know, on all measures, people would think that's a good thing, right? And the reason for that is because people have good information and they have access to contraception. I think we need to maintain that. I think the Hobby Lobby decision impairs that a little bit, and that's why I have this amendment before us. The CHEER Act is just a couple of things. It requires that employers who offer prescription drug coverage in employee health plans should also cover all FDA-approved contraceptions as a part of that coverage. It also requires that those FDA-approved contraceptives be available at no cost to employees and their dependents, that is mirroring the Affordable Care Act. This amendment also recognizes the fact that there are strongly held religious views, and it makes an exemption for that, so that those who are really working for a religious organization can exercise that point of view. But it makes that differentiation between a religious organization and an organization whose beliefs are being embedded in their policies that they're offering to their employees. I don't think it is right for a corporation's boss to make decisions about a woman's health care. And so this amendment makes sure that an employer who has religiously held beliefs and is privately held would be required to provide contraception coverage to their employees if they're already providing prescription drug coverage. and it would make it possible for those employers to make sure that their employees have access through their insurance company. And I would ask for your support. And I'd like a roll call, please.
Roll call has been requested. Seeing 15 hands, there will be a roll call. The member from Dakota, Representative Mack.
Thank you, Mr. Speaker and members, and thank you, Representative Murphy. I rise under Rule 3.21. And Representative Murphy, while I appreciate your concern on the issue, and like you said, many of the shared concerns that we have on how we can get at some of the issues around women's health care and trying to prevent abortions, the underlying amendment, according to nonpartisan research, codifies an existing federal practice into state law. And so not only would your amendment to the amendment create a new section of law, but it creates a new coverage requirement that's not in the underlying bill or in the underlying amendment. So with that, Mr. Speaker, I would rule it out of order.
Representative Mack raises to a point of order under 3.21. I find the point of order well taken.
Well, I appeal the ruling of the Speaker, Mr. Speaker.
Representative Thiessen moves an appeal of the ruling of the Speaker. Discussion to that motion. Representative
And I'd like
Thiessen.
a roll call.
Roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Thiessen, to your motion.
Thank you, Mr. Speaker. Well, I wish you would have listened to a little more advice, because I think Representative Mack has it a little bit wrong, and you might have made a different decision had you actually heard the full decision. What the underlying regulation that is referenced in Representative Murphy's underlying amendment deals with contraceptive coverage and which organizations can and cannot provide that type of contraceptive coverage. What her amendment to the amendment does is do exactly that. Representative Mack, you're totally wrong on this. This is it's completely within the scope of this underlying amendment. The underlying amendment deals with what types of organizations and what organizations have to do with regard to providing contraceptive coverage. Representative Murphy's amendment covers exactly the same territory. If we accept this point of order that Representative Mack makes, we basically can't do amendments to amendments in this body, and the rulings of the Speaker are moving pretty close in that direction, that any amendment to amendment you want to offer, if it makes any substantive difference, which is what an amendment actually is, are out of order. That's unfortunate, because I remember so well over the last 2 years prior to this session when Representative Doubt would stand up on the House floor where Representative Pepin is sitting now and say over and over again, this body should be about debate. This body should be about transparency. This is where we do the work of the people, where we have interchanges and exchanges and debates that really move this discussion forward. Over and over and over again, I heard Speaker Doubt say that from this House floor. And yet over and over and over again, we're getting rulings from this majority that cuts off debate, that undermines transparency, just because you're afraid to take a vote. That's what this is all about. You're afraid. That's not what you're elected to come here down here to do. Your constituents expect you to actually stand up and vote for stuff, say yes or no. They don't expect you to cower. But that's exactly what you're doing. So let's override the ruling of the Speaker. Let's follow what Speaker Doubt actually said time after time after time in the last 2 years, which is let's have a full debate on the House floor. Let's have some transparency of discussion. And on this particular one, there's no question about it, because the underlying amendment and the amendment to the amendment are intricately connected to each other. There's no way that this ruling can stand. Members, you should vote to overrule the ruling of the Speaker.
Members, as a reminder, the question before the body is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker. A no or red vote goes against the ruling of the Speaker. Seeing no further discussion, the clerk will take the roll on the question. The clerk will close the roll. There being 72 ayes and 58 nays, it is the judgment of the House that the decision of the Speaker shall stand. We're now on the A17 amendment, the Murphy amendment. Further discussion on that amendment? Seeing no further discussion, all those in favor of adoption of the A17 amendment signify by saying aye. Those opposed, no. The motion does not prevail and the amendment is not adopted. There is another amendment at the desk. The clerk will report the amendment.
Norton moves to amend Senate File 1458, the second engrossment as amended. The amendment is coded A27.
The member from Olmsted, Representative Norton, to explain your amendment.
Thank you, Mr. Speaker and members. Those of you on the Health and Human Service Committee have seen me there just about every year, bringing a non-emergency medical transportation issue before you. As one of the two legislators in the House, there's also two in the Senate, that serve on this governor's task force, we have struggled with reforming and remediating some of the issues that were found in the OLA report a number of years ago. What's happened, members, is that we come to the committee and we have a bill and every year it doesn't get funded. And up until now, what we've done is move some policy language. This year, I came again with a full committee-supported report, but it is not included in the final omnibus bill. And as I told Representative Dean during the committee, I know it's not a very sexy issue, but it is something vital to the state and something that should have been included. Given the budget target, it wasn't, and so what I'm bringing before you today is a tiny piece of it. And so the amendment that I'm bringing before you is funding two things. One is it's funding the client reimbursement. If you're an MA patient and you're going to the doctor, by federal law, you're entitled to a trip there, and this would increase the reimbursement rate. And the second piece of it is if in rural Minnesota, many of our MA patients get to the doctor because volunteers drive them there. And in case you're not aware, the business reimbursement rate for those volunteers is 19 cents a mile. 19 cents a mile. So we hope to change that. And in fact, the task force had a number of recommendations we asked to be funded, but the volunteer mileage was their top priority. And so what I'm bringing to you is a request to fund the volunteer mileage reimbursement and the self-reimbursement if you drive yourself to help address the issue of the growing number of people utilizing non-emergency medical transportation services in the state. And I have funded this myself. I found a funding source, and what I've asked is that the department transfer people out of rides and reassign them into the, as they're supposed to in federal law, you get a ride to the closest provider, medical doctor, but you have to do it in the least expensive way, which is public transportation. And I had a handout, which for some reason has not been handed out that I have seen, and perhaps someone at the desk could find that. Did some of you get it? Good, it just came around. Great, thank you. It's being handed out now. On that, you will see that in a study that we looked at in the task force, around the country, Washington State, 40% of their rides are on public transportation. Pennsylvania, Pittsburgh, 80%. Philadelphia, 90% of MA patients are on use public transit, public transportation, or volunteers to get to their doctor appointments. Members, do you know what percent we have in the state of Minnesota? 3%. 3%. So how I'm funding this in my bill is asking the department to raise the number from 3% to 5%. And in fact, I have an estimate from the department, MnDOT, actually, one of the employees there who looked at this, who said they thought 10% would be an attainable goal, but I didn't even go that far. I just said 5%. So members, I'm asking for your support on something that isn't going to cost anything except some effort by the department to shift people onto public transportation, but will provide Greater Minnesota some relief so that their volunteer drivers can get a reasonable subsidy, 80% of the IRS for the client and 200% of the IRS amount for volunteer transportation. So members, I think this is common sense, and I very much hope you'll give it a green vote.
The member from Washington, Representative Dean.
Thank you, Mr. Speaker and Representative Norton. First of all, thank you for engaging on this very difficult issue. Folks that have been around for a while know that this is a very contentious issue, and it's one with many stakeholders that find it hard to agree, like many of the issues in the committee. Representative Norton, I think that you're taking some steps in the right direction. However, I don't think it's quite ripe yet, particularly with the different groups involved. I think we need a little bit more time, and also it's not very clear how this is paid for. I understand what you're trying to do, but the money part obviously is not quite figured out yet as well. So I think for that reason, rather than rising to a point of order, I would just ask members to vote no at this time, but encourage you to please keep slugging it out and keep working and come back. I know you hear that again and again, but we do really appreciate the tough issue. But as Representative Saitow used to say, don't come back until it's done.
The member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. First of all, I'd like a roll call on this, please.
Roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Liebling.
All right. Thank you, Mr. Speaker. And members, I know it's getting late. Of course, we started this very large bill at 6 o'clock. But this is very important. I've heard that this bill is full of reform. Well, members, this is real reform. This is reform that actually will save money. And to hear that it's not ripe, I can just see Representative Norton rolling her eyes. Yes, it's very contentious. Yes, it's hard to get the stakeholders to agree. The stakeholders agreed. They agreed after tons of work by all the parties. This will save money. Do you understand what we're talking about here, why this will save money? Because part of what we pay for in medical assistance, the program that you all like to complain about how it's growing, part of what we pay for is getting people to their appointments. That is covered under medical assistance. And how do they get there? Do we make sure that they take the least expensive means of getting to their appointments, the least expensive means that the people can handle? Because obviously some of them are in wheelchairs and have illnesses and so on. But people that are able, do they take public transportation? No. Well, doesn't that bother you? Don't you think that if a person could take public transportation, that we should pay for them to do that instead of going and getting a more expensive ride with some kind of private provider? We need to make sure that our people on medical assistance take the most inexpensive, appropriate kind of transportation. That's what Representative Norton and the whole group is trying to do. And she's bringing that as an amendment to this bill. It will save money. It is one of the few things in this bill that actually would save money. And so, members, if you honestly want to save money in medical assistance and want to actually cut the growth a little bit, pass Representative Norton's amendment. And let's move forward with this. If any of you have worked on something where you've had this experience that she's had, where you've gone year after year working with a group to try to reach an agreement, you know, don't send members out to do that if we're not going to honor their work. This is an agreed upon solution. Everyone should get behind this. There's absolutely no reason to say no. So please, members, vote yes for the amendment. Vote green.
Mr. Speaker.
Representative Dean.
Mr. Speaker, would Representative Norton yield to a question?
She will yield. Representative Dean.
Thank you, Mr. Speaker. Representative Norton, I think I've finally figured out how the money works in your amendment. And from the way I read the amendment, the way that you're getting the rate increase is by having people take the bus, and then the savings by making people take the bus you're giving as a rate increase. That's the way I read the amendment. Is that correct, Representative Norton?
The member from Olmsted, Representative Norton.
Representative Dean, Mr. Speaker, that is what we're doing. One of the frustrations in the fiscal note that you got in the committee was that it didn't show savings, it only showed the expense portion. And for the last 2 years, one of the things that we've talked about is moving people on from the MA patients, not just simply people who need special transportation, but MA patients who are ambulatory but may not have a car that we want to get to the appointment. Those folks, according to federal law, are supposed to take as I said earlier, go to the closest doctor and take the least expensive means. When we went to the broker a number of years ago, the amount of MA use patients skyrocketed, and we suddenly had many more people taking access transportation in the state of Minnesota. What we're suggesting here is that the department start moving people back to public transportation with bus passes or using volunteers or their own car and get reimbursed. And in doing so, we would be able to pay for just a tiny portion, Representative Dean, and the top priority of the task force, which was increasing the mileage reimbursement so that becomes a more viable means for folks and actually they don't lose money. And I really hope you'll take this.
Representative Dean.
Well, Mr. Speaker, Representative Norton, that's what I was afraid of. I really don't think it's a good idea to make disabled people or people that can't get to the doctor. The reason that they're not taking the bus is probably because they're disabled. If we're going to make them take the bus, I think that's probably a bad idea. I don't think it's quite worked out yet. I'm going to recommend a big red no on that one.
Representative Gunther.
Thank you, Mr. Speaker. I wholeheartedly agree with you, Representative Norton. And I just had a constituent call me, and this person's a volunteer driver. They get paid one way, loaded miles only. So if a lady drives 15 miles to get from one town to another, pick someone up, take them back to the hospital, before she's done, she's not being reimbursed for 30 miles. And she says, I'm quitting unless I can get some relief. Now, if we don't have these people, volunteers, driving for the same mileage we get at the most, they aren't going to do it anymore. And if they don't do it anymore, we're going to have to pay STS or ambulance service. They all qualify for both. All they have to do is call Gold Cross and they get $900 to go 25 miles. So the best way we can do it is to help these people out that only get paid for loaded miles and let the county reimburse them. And the county's crying they're losing all their volunteer drivers, so we're going to be there calling Gold Cross pretty soon if we don't do something. I wholeheartedly agree with your amendment.
Representative Norton.
Thank you, Mr. Speaker. And Representative Gunther, you get it. And Representative Dean, I hope you're starting to catch on here. The folks that take non-emergency medical transportation are not all disabled. Yes, there are many disabled people that use non-emergency medical transportation, and those folks will continue to use the non-emergency medical transportation drivers we have, and people who don't have access to other modes of transportation will still continue to get the rides that they've been getting. But too many people have been transferred from what was once a volunteer system using the least expensive means to a more expensive means, and there's all sorts of reasons pointed out in the OLA report how that happened. I don't want to take business, none of us do, from the non-emergency medical transportation providers. What we're trying to do is help the people in rural Minnesota be able to get rides, and if Senator Sharon gets her way over in the Senate and the whole bill passes, we will actually be able to increase the amount that we reimburse the drivers that we have. We haven't done it in your bill, but we can do this little part. You can take it with Senator Sharon and have a really nice debate and perhaps even prevail on this component. I'd urge agreeing.
Representative McDonald.
Thank you, Mr. Chair, Speaker. Rather, question for Representative Norton.
She will yield. Representative McDonald.
Representative Norton, I certainly appreciate the amendment, and certainly 4 or 5 years ago when I first got elected, this was one of the first pieces of legislation that I was involved in, thanks to my predecessor, Congressman Emmer. And the main point was to take these group of folks who had transportation, it was access transportation, a special transportation, but those who had the wherewithal to take public transportation. It was a lot less expensive than taking other forms of transportation. So I like that particular part of the bill. However, in looking at sections 2.6, I certainly appreciate the intent that the Commission will take the savings to pay for the mileage reimbursement, but do you know what that particular savings is?
Representative Norton.
Thank you, Mr. Speaker. I don't have a dollar amount on that. What I do have is a suggestion from MnDOT that we could increase that to 10% rather than 5%. So if MnDOT thinks that they can go higher than 5% and could go to, and this is from the research that they did on this, to 10%. I'm not saying they can't go to 10%. I'm just saying they have to at least go to 5%, and if they need more money, by all means go to 10%, or let's see if we can't get all the way to Pittsburgh and Philadelphia at 80% and 90%.
Representative McDonald.
Thank you, Mr. Speaker. Well, certainly, Representative Norton, I like that idea. Let's go to 10%, let's go to 15%, heck, not even 20%. Think of the savings that we would have in this. You know, I read an article just recently with an audit. California did an audit of their non-emergency medical transportation, and they found fraud of $49 million just in this one issue. So there is evidence that there's a lot of money here that's wasted, but Representative Norton, I would have to concur with Representative Dean. This isn't quite ready for prime time. There's too many ifs and buts and buttercups, or what did the tax chairman said last week? Anyway, too many variables that are not nailed down, and the cost of it almost would be out of order for the particular bill. So let's continue to work on this and bring this up again, that we can really offer some reforms and some savings, because we do want to bring these folks who are capable to use public transportation. It's a lot cheaper, it saves the taxpayers a lot of money, and it's very good for Minnesota and the non-emergency medical transportation issue. Thank you, Mr. Speaker.
Representative Norton.
Thank you, Mr. Speaker. Well, Representative McDonald, I've been going to meetings now for 3 years, all summer long, every other week, half a day. I won't ask him to yield because I know how many meetings he's attended in the last few years. I thank you very much for having started us on this path with the OLA report. You were the one that started us on this path. But the fact is, we've come a long way in 3 years. We all agree what needs to be done. This is one way to start us doing it. It's not the end. It's not the be-all, end-all, but it'll allow Representative Dean to have something to take to committee to work with Senator Sharon on. I think it's a great idea. It's a reform that will save money, and I hope he'll take it.
The member from Nicollet, Representative Johnson.
Thank you, Mr. Speaker, and I just want to thank Representative Gunther. He does get it. And those of us out in the countryside, we get it. This works in rural Nicollet County. This is a solution. This is a partial solution for a large problem that we face with transporting folks that need transportation. Let's give this a chance. We've talked all year about Greater Minnesota and helping Greater Minnesota. This is an amendment where we can vote yes and help Greater Minnesota.
Seeing no further discussion, the clerk will take the roll on the amendment. The clerk will close the roll. There being 65 ayes and 67 nays, the motion does not prevail and the amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Gruenhagen moves to amend Senate File 1458, the second Grossman as amended. The amendment is coded A21.
The member from Sibley, Representative Gruenhagen, to explain your amendment.
Oh, thank you, Mr. Speaker and members. Members, this is a real simple amendment. It simply says that child protection workers and social workers that work with our most vulnerable children should have a background check. And it's paid for in Subdivision 2. The department's able to charge $20 per study. It applies to newly hired. It's effective July 1st. And existing county employees, August 31st. I will not ask for a roll call, as I believe this should be a bipartisan support on this amendment. Thank you, Mr. Speaker.
Representative Loeffler.
Thank you, Mr. Speaker. And members, I believe that all of our counties already do this. I don't see any problem with the amendment.
Any further discussion on the amendment? Seeing no further discussion, all those in favor of adopting the A21 amendment signify by saying aye. Those opposed, no. The motion prevails and the amendment is adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File number 1458 as amended.
Third reading. Discussion to the bill as amended. Representative Loeffler.
Mr. Speaker, I was standing to offer my amendment to an amendment that wasn't offered, but my understanding is that you can offer an amendment at any time. This is the one that quite honestly was submitted as a primary amendment and ran into trouble with the reviser's website and email system running into problems. And I shared with you the email from House Research that indicated that. It's the A55-1 amendment, Mr. Speaker.
Representative Loeffler, we did move to third reading. You would have to move to reconsider third reading.
Mr. Speaker, I'd move to reconsider third reading. I did pop up, but I know you were busy at the desk. So I would move to reconsider third reading and ask for a roll call.
Representative Loeffler moves that the action whereby Senate File number 1458 was given its third reading be now reconsidered. Discussion to that motion. Representative Pepin.
Thank you, Mr. Speaker and members. Well, Mr. Speaker, I would vote against reconsidering the third reading if it's for the Loeffler motion, because the House rules under 3.33 don't allow for a situation that Representative Loeffler is describing. It didn't meet the rule requirement, which is very clearly laid out. And we had a similar incident that happened, I think, in either last session or the session before, in which we had the same exact thing happen with, I believe it was a Representative Fabian amendment, and the precedent that the current speaker, or the speaker at the time, said was that we would not take it up, and I do not see anywhere in 3.33 where this would be allowed. So I would suggest we do not move to reconsider third reading if it's only to take this up.
Further discussion. Representative Thiessen.
Thank you, Mr. Speaker. As Representative Loeffler pointed out, and that as I talked to the speaker about yesterday, and I think said that this would not be a problem, the reviser system went down yesterday before noon, and so Representative Loeffler's amendment couldn't get in. And there's an amendment, she has an email that she's given to the speaker. We can give it to you, Representative Pepin, if you'd like. And I know that in the last biennium, when your members were unable to get amendments in because the system went down, we allowed those amendments to go forward. If you want to change the rules on that, you certainly can and vote no against this. But I think we should just reconsider third reading, let Representative Loeffler offer amendment, and then move forward.
Representative Loeffler, just for my own purposes, which amendment are you intending to offer?
Thank you, Mr. Speaker. The A55-1 amendment.
That is an amendment to another amendment which was withdrawn.
Mr. Speaker, this was submitted on its own, and that was the situation was, and yesterday when I first consulted with your staff, they said it would be a primary, but that they wouldn't allow secondaries if they posted it. And then there was another later one member of your staff who said, well, no, we're not sure you should do that, and so we offered it as a secondary.
Representative Loeffler, it's drafted as an amendment to an amendment. It's not drafted as a standalone amendment. Further discussion on the motion to reconsider third reading.
Mr. Speaker?
Representative Loeffler.
It was submitted to the desk as a standalone amendment, and then I followed the direction of your staff that I would have to offer it as a secondary because they would not accept it at that point as a primary, even though the first ruling to me indication was that they would accept it as a primary.
Mr. Speaker, point of parliamentary inquiry.
State your point of parliamentary inquiry.
Would we be able to do a verbal amendment to make it an amendment?
Mr. Speaker? Mr. Speaker, point of order.
I believe that Representative Metz, to answer your question, I believe the amendment has been distributed to all of the members. The amendment to the amendment, it's coded SF1458 A55-1. I guess I'll leave it to you if you think it can be changed. Representative Pepin.
Thank you, Mr. Speaker. I will make a point of order that this is out of order under Rule 3.33. Amendments must be pre-filed. There is no exception for this rule. We actually, when these rules were created in 2013, the minority asked several questions about this very thing happening, and the majority leader at the time made it very clear, and we could go look back at the speech, saying that, I'm making a point of order, saying that that the member could walk it over or they could email it. In the case that the revisor system went down, the member had the opportunity to walk it here. We had concerns with that because many members are rural, they leave if it were to be a Friday. Representative Loeffler actually is a Minneapolis legislator and would not have that same trip. Frankly, the amendment could have been handed in by hand, and there frankly is no exception under Rule 3.33.
Point of parliamentary inquiry, Mr. Speaker.
Representative Pepin, on your point of order, we are right now on the motion to reconsider third reading. So we're not actually on a motion to bring up an amendment, so I will, unfortunately, it's just not, it's not appropriate right now. If this motion to reconsider third reading did pass and then a motion was brought forward to bring an amendment that didn't meet the deadline, then that point of order would be in order. Representative Freiberg, to your point of parliamentary procedure.
Thank you, Mr. Speaker. You just answered my inquiry very succinctly.
Even a blind squirrel finds an acorn once in a while. Representative Murphy, on the motion to reconsider third reading.
Yeah, thanks, Mr. Speaker, and I don't want to go too far into the rules, members, but if you look at Rule 3.33, The last sentence talks about an amendment is not out of order under this rule if it is technical or a reviser's change. There are sometimes technological failures, and that's why this was drafted this way, members. So I do think that it is fair for this body to reconsider third reading, to give Representative Loeffler a chance to get her amendment before the body, and also, Mr. Speaker, to give you the choice and the opportunity to use your discretion and leadership in recognizing the rule and recognizing that sometimes there are technological failures, and we need to account for that in this body.
Further discussion on the motion to reconsider third reading. Seeing no further discussion, the clerk will take the roll on the motion to reconsider third reading. The clerk will close the roll. There being 59 ayes and 73 nays, the motion does not prevail. Further discussion on the bill as amended.
Mr. Speaker?
Representative Pepin.
Mr. Speaker, I request a call of the House.
Representative Pepin moves for a call of the House. Seeing 10 hands, the clerk will take the roll.
Mr. Speaker,
Representative Pepin.
I move that further proceedings under the roll call be dispensed with and the Sergeant at Arms be instructed to bring in the absent members.
Representative Pepin moves that further proceedings under the roll call be dispensed with and the Sergeant at Arms be instructed to bring in the absent members. All those in favor signify by saying aye. Those opposed, no. The motion prevails. The clerk will close the roll and the Sergeant at Arms will bring in the absent members. Discussion on the bill as amended.
Mr. Speaker,
Representative Pepin.
I move that the House be allowed to meet past midnight.
Representative Pepin moves that the House be allowed to meet past midnight. All those in favor signify by saying aye. Those opposed, no. The motion prevails. Representative Knobloch.
Thank you, Mr. Speaker, members. Members, I know the night is long. I don't want to take a lot of additional time, but I've passed out a couple of handouts that I think are important for members to look at when they consider the big picture of the budget and the whole area of health and human services. And I guess I direct your attention first, members, to this chart that's got the lines on it, because it shows what some people have considered some real alarming trends in our budget over many years. If you look at this, you will see that over the last 40-some years, spending on health and human services has risen from 12.5% of our budget to 29% of our budget. And during that same time, property tax relief, higher education, and just about everything except for education itself, K-12 education, and public safety has fallen as a percentage of the budget. And members, I bring this to your attention because I think it's important to understand that we have had this steady, large increase in spending in health and human services. And while there are many needs here, there are needs in other areas too. And members, I know that we all care about health and human services, but we also care about things like property tax relief and higher education and the other areas of the budget. And so, members, I bring that to your attention just so that you understand what has been going on and continues to go on in our overall budget with the growth of health and human services and the ever larger portion year after year of the budget that it seems to take over. Now, members, if you look at the second one, this is a list or a total of all the spending in the health and human services area, not just the $12 billion roughly that we're projecting to spend in general fund spending in 2016 and 17 in this bill, but all spending. I know there were some people that thought we were really being unreasonable in projecting to reduce the growth of the health and human services budget as much as we were, even though if you look at the budget, after we've added back some additional money to the target, we're going up about $635 million in spending in this biennium from the last biennium. Yes, members, spending is going up $635 million in general fund spending. And I don't have a number as to what it is with all fund spending, but members, if you look at what the budget forecast is on the other page, if you look at those little boxes in the middle, you will see that the projection from MMB in the budget forecast was that for 2014 to 15 that we were spending $29.3 billion in all funds, federal, state, special funds, and we were projecting to go up to $34.8 billion in this coming biennium, a $5.5 billion increase, almost 19% one biennium to another. Members, when we talk about things being unsustainable, this is it. We just cannot, as a state, sustain these kinds of increases. And so, members, I know that there are very important needs in the health and human services area. We on the majority side are adding significant funding to some areas like nursing homes. But members, at the same time, we are trying to bend down the growth rate of this area because you can see what it is doing to the rest of the budget. You can see the huge increases that are there, and this remains a big problem overall for our state that I want you to all be aware of. And I thank Representative Dean and his committee for working on this and try to bend down the growth rate in this area in this bill.
The representative from Ramsey, Representative Fisher.
Thank you, Mr. Speaker. Members, as I take a look at the bill that we have in front of us today, I see some problems with it. I see some of the unintended consequences that are occurring. And I think probably the best way to take a look at it is I see it in the areas of racial disparities. The things that we're going to be funding or not funding, we're looking at the statewide health improvement program, SHIP, which helps a lot of communities of diversity. That's being zeroed out. When I take a look at what is being happening under the American Indian Family Intervention Program, a program that the governor was asking for, we've got zero there. At a time when we've got a state surplus going forward, we take a look at the Homeless Youth Act, and I think this is really where we start telling the story. We see a one-time spending increase coming up for the biennium of $2 million, one time, and then it goes away in the out years. This is spending that helps communities that are high racially diverse. But where's the money going? And I think that's the real question. And I think that's what it comes back down to, is where the money is really going here. We're cutting $1 billion. And where is it going? For tax cuts. Property tax cuts over the next 2 to 4 years. We're talking about billions of dollars of tax cuts to companies and businesses that look racially like we are in this room, not diverse at all. And what we're doing is we're taking money that would help people that are racially diverse, and we're taking it away from them. That is an unintended consequence of racial disparities and racial impacts that are not good. We've got a situation in this country where people are saying it's time we start doing things differently. We've got to start taking action, but yet, when we take a look at our budget here, our budget does not reflect those kind of priorities, particularly in health and human services. I think it's time we take a stop and take a look what's going to happen, and have also some serious discussion when we hit the tax cut bill tomorrow, is where's the money really going? Is it going to the people who look like we do in this room, or is it going to the people who really need the help who don't look like the people in this room? So I think we have to stop what we're doing and take a serious look, and that's why I'm voting against this bill.
The representative from Ramsey, Representative Uruso.
Thank you, Mr. Speaker. I'm also going to be voting against this. I sat on the Aging and Long-Term Care Committee, and I am happy that we have some reworking of the formulas for nursing homes. That's a good step. We've got some measures to try to get some workers in places through scholarships and whatnot coming up. However, we have failed to address a lot of the other needs for taking care of our elderly and our disabled, because not everyone is in a nursing home. In fact, one of the things that we learned on the Aging Committee was that the mix of residents in nursing homes has changed quite a bit, that the acuity of care has gone up quite a bit, and that is principally because many people are being served in other sorts of facilities. We have in-home care and we have assisted living facilities. And those two types of care are served very poorly in this bill. We have temporary fixes. We do not have a sustainable fix to the reimbursement rate that is going to supply living wages for the people that take care of our most vulnerable Minnesotans. Both my parents had spent time at assisted living facilities. I have a number of assisted living facilities in my district and many group homes in my district. You find out about those when you go door knocking. The people that take care of people in those facilities don't make enough money to live on. So, ironically, this is a bill to grow government, Representative Drazkowski. This bill will grow government because those people need to be on public assistance in order to survive. They work hard. Now, we heard not too long ago from Representative Runbeck that people in low-wage jobs should go out and get training and get a better job. And that market forces, determine how much we value workers. Well, we need these jobs to be done. We need them to be done, but somehow we don't value them. Who's going to do these jobs? It's not enough to say, oh, the people in them should get training and move up and out and go do something else. Then who's going to take their place? Somebody has to do these jobs. And we heard on this committee how turnover and the inability to hire people is one of the biggest problems that we have in this industry. And turnover and empty slots on shifts cause a lower quality of life and safety issues for the residents of these facilities. The market does not govern these wages. There is no market fix to these wages. We, members, we govern these wages through the reimbursement rates that we allow. It's not possible to pay the people more than the money that's coming in. Now, the nursing homes get subsidized by some of their other facilities, but the in-home care can't get subsidized by anybody. We govern what those wages are, and we are forcing people to work at something that's not a living wage, and so they got to be on assistance. And then we're going to turn around and we're going to take away Minnesota Care. Well, some of the people that are on Minnesota Care, the consequence is going to be that if they lose their health care, they may end up losing their job. Because if you depend on your health care to stay, able to work, you lose it, you lose the job. Some other people that are marginally able to work may find that the best thing is to not work so that they'll qualify for other programs. One of the reasons our costs are going up and up and up in health care is because such a large fraction of it is in administrative costs. And then last week, Representative Gruenhagen blessed us through email with a graph about the growth in administrative costs up to the year 2009. This started happening a long time ago, and these precious market forces are what drove that. We haven't fixed it. We've addressed some of the issues of getting more people enrolled in insurance. Well, of course, now we're going to take it away. But we've gotten a much larger fraction of our population has insurance right now than before. But we have not addressed the administrative costs because we still have a patchwork of programs. Every employer has a different program. You go to your clinic, you can find this out. You can find out what kind of costs you've got from this, because there'll be people that are employed at your clinic whose only job is to sort out who gets covered for what by whom. So I'm going to take the opportunity here to mention that I am a supporter of single-payer health care, which would eliminate that patchwork of programs and cut a lot of our administrative costs. But I'm going to vote against this bill because we are not taking care of the people we need to take care of. Thank you.
The member for Meeker, Representative Erdahl.
Thank you, Mr. Speaker and members. And a couple of things in this bill that I think are very important, and I've worked on over the years. Anything that we can do to shrink the rate disparity between rural Minnesota and the metro area is a very good thing. And I've become closely associated with long-term care workers. Over the years, the 5% for them is a very important thing, because I don't know of any workers that deserve a raise more than them. And I don't usually get up and talk about health and human services issues, but I feel compelled to tonight to emphasize a little bit some of what Representative Knobloch was talking about. State and federal spending on Medicaid in Minnesota has climbed to $10 billion per year. Now that's huge, and without dramatic cuts or large tax increases cannot be sustained. The projected rate of increase is literally eating away our state budget. Now, there's only so much money to go around. We have to realize that, if we haven't. And in the future, at the rate of growth, where will additional spending for K-12 be going? Will it be going to increase Medicaid costs? What about pre-K? I'm sure that Representative Nornis would like to have more money for our colleges and universities. We all would. But there's only so much money. And how much money that could have been going to colleges and universities will be going to Medicaid. Tuition freezes, transportation, police departments, public safety, our nursing homes. Once again, will money that could be going to them be eaten up by increasing costs in health and human services? We have to get a handle on this, and Representative Dean is trying to do that in this bill. As we remember that all these that I've mentioned in other areas will suffer in spending if we don't do something to get a handle on health and human services and our Medicaid expenses.
The member from Sibley, Representative Gruenhagen.
Oh, thank you, Mr. Speaker, members. I know the hour is late, so I'll make this quick. You know, I think Representative Knobloch and Representative Dean have both hit on a key point. And if you don't choose to believe them, you might want to believe the state demographer Tom Gillespie, our former state demographer. He issued a report, I believe back in 2010, that said if we don't get health care costs under control in this state, there will be no additional money for higher ed, roads or bridges, or K-12 education. That's not nonpartisan Tom Gillespie. Obamacare and MNsure are the wrong solution at the wrong time in our state's history. We're facing a demographic change, the likes of which none of us have faced in our lifetime. Unfortunately, you know, we talk about phony numbers and phony savings. Well, two words come to mind: Obamacare and MNsure. They've been filled with it, okay? We talk about increasing administration costs. It is the government that passed the laws to increase administration costs with our health care and our insurance and government agencies. Obamacare and MNsure makes that worse. We talk about employment. Well, in my district, I have an employer who employs a little less than 100 people. Prior to Obamacare being implemented, they moved all their employees except for management to 29 hours a week. I talked to some of the part-time workers now. They're working 2 and 3 part-time jobs to make ends meet. Now, I don't know how that figures into the unemployment rate, but I do know this. We've changed the way we figure unemployment. We don't count discouraged workers. And I'll tell you, there's a lot of discouraged workers out there. And really, our unemployment rate is probably at least twice or more than what we're reporting to the public if we'd use the old way of figuring it. In addition, members, I just want to compliment Representative Dean for his chairmanship of the HHS committee. I would say, members, regardless of which side of the aisle that you are on, everybody on that committee cares about the most vulnerable. They want to do what's right, okay? And Chairman Dean had unlimited requests, and he has limited resources. But one of the highlights, of course, to me is the increase in funding for the nursing homes, also the 5% campaign. Members, we can't, with the basic health plan, they're being shifted to the exchange to the silver plan. They're receiving additional state subsidies. One of the benefits that hasn't been mentioned is that the doctors and hospitals will actually receive higher reimbursement rates from the private sector plans than the government plans. You know, I'm so tired of hearing the demagoguery of the private insurance industry, you know, as being the culprit in higher health care costs, when in fact the private insurance industry has bailed out the government programs for decades through cost shifting. So the reason your premiums are going up exponentially is because doctors and hospitals have cost shifted their losses from Medicaid and Medicare to the private insurance market. It is government programs that are corrupting the system. And when we have the baby boomers being productive and working, that will work. But when they move to retirement, it won't work. So I'm already keeping it down. The point is this. This is my final point. Look at our gas prices, members. How many here enjoyed the fact that our gas prices have gone down? I think all of us have, and our constituents have benefited, and we've actually received higher tax revenues. Question, did government bring down the gas prices? Or did the private sector, through innovation and competition, bring the gas prices down? I think we all know the answer. It was the private sector. That's what we need in health care. We need less government, more competition, and private sector innovation, and we can solve the problems with our baby boomers retiring. We will never solve it with more government, more mandates, and more laws. We'll only wind up with forced rationing. I see somebody's waving a white flag over there. Do you want more or less, Representative Davis? Okay. With that, members, please vote green. We have to bend this cost curve for the sake of your children, your grandchildren, but especially the elderly who will face forced rationing if we don't bend this curve. Thank you, Mr. Speaker and members.
The member from Douglas County, Representative Franson.
Thank you, Mr. Speaker. Members, when I look at this bill, and I'm going to be voting yes, I see opportunity with this bill, a lot of opportunity for a lot of people. And I'm just going to share a personal story about a few bills that mean something to me. When I was 3 weeks old, my biological mother died unexpectedly, and I went to a foster home until I was 6 months old, or my grandparents took care of me until I was 6 months old, and then and many of you know my grandfather and Grandma Peter Benzoni and Grandma Mary Benzoni. And they took care of me until I was 6 months old. And then I went to a foster home because Grandma Mary and Grandpa Pete were retired. And so I stayed there until I was 2 when my dad was able to get me back. And by that time he had met somebody who then became was stepmom, and they weren't.
Members, please take your conversations to the alcove or to the retiring room. Representative Franson.
They weren't married at that time, and the court system apparently did not really care about that. And so I went to live with her, and my dad sailed on the Great Lakes, so he wasn't home very often. And through a series of events, I was able to make it to my senior year in that home when I decided that I had just turned 18 and I wasn't going to stay there anymore for many, many reasons. And I went to school the next day. It was on a Friday morning when I had just had some conversations with my girlfriends and decided that I was going to leave home. And that wasn't exactly one that I really thought out well. And so the plan was that I was just going to move from house to house, staying with my girlfriends. And it was that weekend we were trying to, you would think your parents would come looking for you, but they didn't. And so I was just going to move from house to house. When a family from school that Monday, in my high school, because I went to school the next day, or on that Monday, said, you really can't move from house to house. You need stability, and we want to take you in. Which was, a good thing. And so that's what I did. And I managed to graduate high school. I made a decision to go to college. Going to college was a little tough because I didn't have any parents to sign a FAFSA form. My uncle had to vouch for the fact that I was an independent student so that I could go to college, because that's what I wanted to do. Very determined person, and I always I always push my boundaries to prove to others that I can do things that they don't believe that I can do for myself or won't be able to achieve. And it took a long time to learn not to please others, but to do things for myself and not for other people. So in this bill, we have, I believe it is Representative Will's bill regarding the Homeless Youth Act, which when I left my home, I don't think that there was anything, although I didn't go looking for things either. I was 18, didn't really know anything about help. So that is actually a very good thing. And sheltered, and with that Homeless Youth Act is the sex trafficking piece for that as well. And you know, members, I'm so thankful that there was, I did not have to resort to that situation. But there are a lot of children that when they leave a toxic environment at home, they're looking to survive, and they're not looking to be exploited. They don't think that that's what they're doing is being exploited. And that's what they're doing in order to survive. And I've gone to numerous sex trafficking seminars, and it is absolutely heartbreaking to hear the horrendous situations that the girls are in. And I'm actually very happy that Representative Lesch wants to work on expanding that age of what is defined as who is sex trafficked. So I look forward to working with him during the interim on that issue to expand that age. The next big issue that I have that's really important to me is the 5% increase for the home and community-based services. I've got such a soft spot for the elderly and for our disabled. And, you know, there's one lady that works at a home, and her name is Carmen. And not only does she work at a home for our community home and community-based services, but she also works as a server at a diner as well. So this is a place that I go in a few times a month to have breakfast with my Democrat friends and find out what's going on, what they're thinking, and helps me be a better legislator. But I also get a chance to chat with her when she's working. And she's working 2 jobs, so I know that she's going to be pleased with this increase, and her friends that work right along with her. Because for the individuals that live in the homes, it's so important that they can keep staff, the same staff, because they're all family. They are family, and they consider themselves family. The next big piece for me that I've heard time and time again was our nursing home funding. And it's very disturbing that the governor did not put any funding for our elderly in his first budget, and then a measly $25 million in his supplemental budget, basically saying, oh, the elderly are an afterthought. And the Senate, I believe, has the same language as the governor, $25 million. And members, for me, being someone who values life at the beginning and at the conception, absolutely, beginning at conception, and also valuing life at the end, it's very telling that there are many in this body that don't see that full circle. So if you don't value life at the beginning, how can you value life at the end? And so my grandma Mary, who took care of me for 6 months of my life and continued to be very influential in my entire life. My grandfather was the first to go, and I made it just, as he was dying in the hospital at St. Mary's Hospital in Duluth, and I walked into the hospital, and he grabbed my hand and he said, "My beautiful grandchild, I am so proud of you." And he made me promise that I would look after my Grandma Mary. And she moved down to the Apple Valley area and lived in an apartment there. And I went down there with my daughter every other weekend and cleaned her apartment for her. And we would play Skippo and we would play Uno. That was our thing to do. And then she had some major health issues and ended up in a nursing home. And when I went to go visit her in that nursing home, it was where I realized that I didn't know if I would be able to maintain my promise of taking care of Grandma Mary or making sure what she was taken care of. And she asked me if I was happy with her living in that nursing home. And I took her hand and I said, "No, Grandma, I'm not happy." And I know she was getting good care, but I had to be honest with her. And then she moved, from there she ended up in a group home. And I visited her, and it was during the campaign year of 2010. And I visited her and told her I was running for office. And my grandparents were staunch Democrats. And I showed her the lip piece, and she said, "Wow, you're running for office. Your grandfather would be so proud. And did you know that your uncle voted for our new president?" And the caretaker there grabbed the lip piece and was chatting with me, and she said, "You're a Republican, aren't you?" And I said, "Please do not tell my grandma." Shortly after that, days after that election, Grandma Mary passed away. So I don't ever know if she knew that I won the election or not, but I know she was proud. And so funding nursing homes for me is very personal. In Representative Bud Nornis's district, there's a Good Sam, and Good Sam borders along my community. And in the fall, we had a forum there, and he had all the candidates promise that we would roar like a lion for the residents and for the staffs. And so I'm asking each and every one of you here in the body to not only roar for our elderly with this funding, but also roar for the rest of the individuals that are being helped in this bill. The disabled, those that are being sex trafficked, those that have children that are being abused, infants that are born alive as the result of an abortion. And the list goes on and on and on. So I want you to roar like a lion, even with this bogus fiscal note that allows you to give the narrative to the public that there are no cost savings in our bill. Because you got this fiscal note, I'm going to call it Fiscal No Gate, so that you can tell the people of Minnesota why you're voting no for disabled people, why you're voting no for our elderly, why you're voting no for children, why you're voting no for those who have been sex trafficked. And that's really sad. It's very sad that politics has become so polarized. It's very sad that you would rather talk about a government shutdown than do what is right for the people of Minnesota. Thank you, Mr. Speaker.
The member from Candy, Ojai, Representative Miller.
Thank you, Mr. Speaker. Members, I would like to thank Chair Dean and the members of the committee for all of their hard work. I can tell you, coming from Candy-White County, of course, I spend my time out here during the week. I have an apartment. I can tell you that I tend to stay here late and get here early in the morning. No matter how late I am, I found people. I found Chair Dean working. No matter how early, I saw the CA Holly Iverson working. My roommate is Representative Backer, and he spent many days and nights on this. There were big challenges ahead. I believe that all the people involved with this did a fantastic job, and I encourage people to vote green on this. The one thing that I want to talk about is I want to thank them for including, Mr. Speaker. Thank you. I want to thank the committee for including the work that I did with Safe Harbor and increasing the funding for that. These are girls that we are talking about, 12, 13, 14, 15 years old. We had the opportunity to tour Heartland Girls Ranch out in Benson, which does a fantastic job with these girls, and we're going to be able to further the funding on that. This is a companion to the work that Representative Pino did in public safety, where they're going to be able to take care of the law enforcement side of this. I think this is going to be a real good part. We talk about protecting the most innocent, the most weak in our society, and this is going to do that. So thank you, committee, and I ask for a green vote.
The member from Blue Earth, Representative Considine.
Thank you, Mr. Speaker. This actually wasn't part of what I was going to say, but Representative Gruenhagen, the Saudis flooded the market with cheap oil. That's why gas went down. Good gracious. End of March the 20th, visiting my father-in-law in the nursing home. He had back surgery. I got into a discussion with the administrator at Hillcrest Nursing Home. She started asking about how things were going. And after a while, she looked at me and said, "I remember your father being DFL." And I said, "Yeah, he was." And I said, "So am I." And she looked at me and she said, "Well, why are you saying so many nice things about Republicans then?" And I said, "Because we're working together in a bipartisan manner to try and get Minnesota's problems solved." And I told her about Representative Schumacher's bill, $200 million for nursing homes, even though we acknowledged in the committee that that probably wasn't enough. I told her about Representative Hamilton's bill and how disappointed I was I couldn't sign on for 5 and 5, but again, we talked about it, you know, it really wasn't enough. Then I saw the targets that following Tuesday, and I started having some concerns. And now we're down to 138 million for the home for nursing homes. The 5% is 1 year and then it's gone. I would like to quote one of my fellow freshmen from the Aging Committee about the second day. "This is an embarrassment. It is unacceptable. I don't know how we can go with a surplus and still leave these needs unmet." I will be voting no.
The member from Washington, Representative Schoen.
Thank you, Mr. Speaker. I was working on some finer details with Representative Davids over here. Well, boy, this bill is something, isn't it? We, you know, the money in this bill is, and unicorns are alike. They're part of a big fairy tale. And, you know, you're talking about, we have 300 million savings that are going to be booked in as a mandated piece of this legislation. And we're calling the fiscal note made up because it doesn't match up with what you want. And what about Greater Minnesota? You know, those of us in the metro, Representative Dean and I live in the metro area. We live within 30 miles of a bunch of hospitals. HCMCs, Regions Hospital, you know, those will be there. We're going to have those for a long time. But if you're out in the communities like Benson, Glenwood, because they already lost one of those hospitals out on Lake Minnewaska once in Starbuck, Elbow Lake, Thief River Falls, your providers are scared. Those are safety net services all over the state of Minnesota that could literally double and triple the mileage people would need to get to a hospital. Because when you talk about the possibility of double-digit rate cuts or reimbursement cuts, they're on the brink already sometimes. I mean, you're talking about the possibility between that fiscal note and the $300 million you're trying to say that the commissioner is supposed to renegotiate at approximately $285 million difference. That's going to be on the providers, like our small town ambulance services that are doing 100 runs a year maybe. How are they supposed to survive and still be in your communities? I guess we could just wait for another service to buy them up and they'll come from further away. And I heard this bill talk about responsible budgeting for the future. Well, if you're one of those people that decided to grow up and, you know, that Representative Marquardt's buddy little Johnny got a job, and here he is going to be a care provider and he's going to get this 5%. Well, he's not getting that 5% right away. And after a year, we're pulling the rug out from little Johnny and saying, sorry, we're taking that 5% away. It was just good for a year. The reality is, let's just get the glitter out, saddle up a unicorn, and ride this fantasy into conference committee and hope we can come out with a nonfiction tale of how we're going to take care of Minnesotans.
The member from Hennepin, Representative Freiberg.
Thank you, Mr. Speaker. I served on the Health Policy Committee for the first time this session. I learned a great deal about our healthcare delivery system and what Minnesotans expect from it. One thing I did not hear from Minnesotans is a desire to get rid of Minnesota Care. Now, when it was created, Minnesota Care was an innovative and bipartisan program. It still is. It has stood the test of time. It provides affordable health care to thousands of low-income, working Minnesotans. Monthly premiums range from $4 to $50. This bill will cause 100,000 enrollees to lose their health insurance. Many of them are in greater Minnesota, in what is supposedly a session devoted to that part of the state. And why? Because Health and Human Services was given a target requiring the committee to cut $1 billion, billion with a B. And what are these $1 billion going towards? Tax cuts most Minnesotans will never see. This isn't serious budgeting, and it's picking one group of Minnesotans over another. Under this bill, costs for enrollees will rise. Benefits will be fewer. Market uncertainty will be created. Unworkable timelines are put in place. Women's reproductive choices are interfered with. At-risk individuals and families will fall through the cracks. With a $1.9 billion surplus, we could do so much more. We could improve access to child care. We could protect our seniors and our most vulnerable. We could expand health care. I urge members to oppose this short-sighted legislation.
The member from Beltrami, Representative Purcell.
Thank you, Mr. Speaker. A couple of things here. The horse isn't quite dead, so I'm going to give it a go. The only thing I really want to say, and heard a couple stories, and I'm going to tell you about a meeting that Representative Hancock and I had back up in Bemidji, back in February, I believe, with folks from the disability community, and they organized that to kind of give us an earful, and they were all worried about the folks that work with them in the home health care. And one of the things that we heard, I suppose more than anything else, was what the need was. And we heard some of these folks of the disability community gave testimony that was set up so they could talk to us. And they gave us their feedback on one of the things that they feared the most was inconsistency in the workers that cared for them. And some of them need quite a bit of care. Some not quite so much. But what I remember the most, Representative Hancock and I are sitting up at a table up front, and we're all done, and everybody's getting ready to file out of there, and this one lady come over, and she couldn't talk real good. And we were at a table that was about as high as my little desk right here. And she wasn't that much taller than that desk, and I reckon she was 40-something years old, maybe 50. And she put her hands right on the table, and she looked right at both of us, right in the eye. I made eye contact with her. I'm sure Representative Hancock did too. And she said, "Please help us." And I said, "Well, we'll do the best we can do." And I looked over at Representative Hancock, and we'll do the best we can do. Members, this isn't the best we can do. With a $2 billion surplus, we're going to give workers a pay increase for 1 year, and then we're going to, what then? Take it away? So we'll be back up in our districts telling our disability community, oh, well, we didn't have enough money. $2 billion wasn't enough money. We couldn't do it. So here's the conundrum that's created out of this bill, and probably the biggest reason I can't vote for it is that little bit of a woman that come over and looked us in the eye and said, "Please help keep our workers working for us. We want consistency, so we don't have to, so we know who those folks are that are taking care of us." And so with a $2 billion surplus, we're going to give them funding for 1 year. Don't think that's right. And I think we'll all find out about that when we get back home. So vote no on the bill.
The member from Traverse, Representative Baker.
Thank you, Mr. Speaker. We'll correct that and say from Candy, Ojai, if that's all right. Members, I just want to speak briefly that I think there's a lot of really good parts of this very good bill. I especially want to talk about the mental health expansion. I think that they did some really good things with the committee. I was also fortunate to sit on the HHS reform committee and learned a ton as a freshman. Seeing the good policy work that we've done here, supporting growth in the mental health with children and adolescents, the acute needs of mental health, the good work that has been done with chemical dependency providers. They got money for the first time in about 7 years. I'm really proud of that assistance we're able to provide. And again, I just cannot thank the committee enough for their hard work. It's not easy saying no, because there's other things that I also wanted in this bill, but we just couldn't do as much as we wanted to do. Saying no is not fun to do. And I knew coming down here as a freshman, we needed to do that like I do in my business. At sometimes we can't buy all the equipment that we really want to have in our kitchen, or we can't buy the carpeting or the silverware or the plates that I really need to have. I have to limp along for a while. But members, I just hope that we come back and keep fighting. I hope we keep coming back and fighting for the extra 5% that we need here, and a little bit more for chemical dependency, a little bit more for that transportation bill that Member Norton brought up, Representative Norton. I think that's a really good idea, and I think we should fight for that another day. But let's not stop fighting for those things. But we just can't do it all today. But I think this is a fabulous bill. I'm very proud to vote green, and I can't thank the committee enough for all their hard work, and I please ask for a green vote. Thank you.
The member from Sherburne, Representative Zerwas.
Thank you, Mr. Speaker. Members, you know, I guess I'm a little disappointed in how partisan the debate has been. I find it interesting that there are all these big priorities that the minority is concerned didn't get funded. You know, it was 2 years ago when your party passed the biggest tax increase in the history of Minnesota. And in $2.4 billion of new revenue, you didn't do anything to address the MA dental reimbursement rates. You didn't do anything to address the MA spend down. You didn't do anything to address MA EPD for people working with disabilities so they can work to their full potential and really bring the full meaning to their lives. I find it interesting that you did nothing for nursing homes during that time when you could have done rebasement of rates. You did nothing across the board for rates. So, members, I think you look at a bill that has so many good things, where we've moved the needle on so many good things through MA spend down, MA EPD, MA dental rates that right now we're 50th in the nation for our pediatric MA dental reimbursement rates. This bill addresses that, and it moves that needle. We heard in committee and funded in this bill is to address supplying a better way to purchase and a cheaper way to purchase durable medical equipment for patients that are at home getting life-saving care. This bill makes that more affordable and that bidding process more competitive. We have the bipartisan ABLE accounts bill included in here that was made possible through federal legislation by Senator Klobuchar. That's a bipartisan measure that's in this bill. We have we heard from a group of people concerned about allergic reactions. And we heard a very sad and traumatic story of a child that had an allergic reaction after having a pancake, members. And we came together and said there ought to be a way to make those EpiPens available more readily for those types of emergencies. That is in the bill. Members, we have the Smile Minnesota dental grants for $1 million in mobile dental care for rural Minnesotans, for patients that would be too difficult and too cumbersome and too expensive to drive for hours into the metro area for their dental care. This bill addresses, for the first time for MA patients, to allow what private pay insurance patients already get, and that is quicker access to mental health care through getting mental health care from physician assistants. That measure is in this bill. We heard from a broad coalition from Greater Minnesota, from law enforcement, and from the mental health community about the huge push that we've had for not sending people to jail that deserve mental health treatment. Representative Hancock brought a mental health diversion bill that's funded in this bill. So I think we could talk about some of the things that you don't like in the bill, and I think there was some real exorbitant, colorful language early on. I think we were told it was criminal, and I think we used a lot of real descriptive words. But members, this is a bill that goes a long way for helping a lot of Minnesotans. It's a bill I'm proud to support. It's a bill I think we should all be proud because we're moving the needle and we're going to provide extra help to so many Minnesotans that for years have come to the legislature and asked for help. Members, finally I want to mention funding in here that wasn't in the governor's budget and it isn't in the Senate budget, but the funding for the Minnesota stroke system is funded in this bill, and that system would go away 3 years into the program if this funding wasn't in there. And members, it's something that obviously is very close to my heart. Members, it was just over 14 months ago, in January of last year, when I was driving down Highway 10 in Elk River, and I got a shooting pain in my head, and I felt my right arm go numb and my right leg go numb. I pulled over to the side of the road. I dialed 911. I was transported down to Abbott Northwestern Hospital to the intensive care unit, where promptly and quickly I was diagnosed with, in fact, having a stroke, and they immediately started the TPA, the clot-busting medication, to treat that stroke within hours. Luckily, I was able to regain all of my faculties. Members, a third of all Minnesota residents live greater than an hour away from a stroke system certified hospital in the state of Minnesota. This stroke system protocol will guarantee that no matter where you are, luckily I was in Elk River, no matter where you are guaranteed to fall under the same protocols and get the same health care and your best chance at a positive outcome. This bill funds that. This bill funds that for greater Minnesota. I want to give my hats off and respect to Chair Dean and to the committee for really a valiant job on hitting a very aggressive target for getting a bill that truly represents progress and real reform, and members, really moves the needle and makes an impact in areas that have not been touched in this budget in decades. Thank you, Mr. Speaker.
The member from Hennepin, Representative Loeffler.
Thank you, Mr. Speaker. Members, this bill tries to do a lot of things, but it does it on a really shaky foundation. And while Representative Knobloch isn't in the room, he needs to look at the handout on the statewide health improvement program, because this was created in a bipartisan way when Governor Pawlenty was governor, and it is to bring down the cost of health care long term. It is one of the nation's best and most evaluated approaches, using communities across the state to bend the health care cost curve. And you can see from the handout on the back, compared to our surrounding states, we have stabilized the growth in obesity. Obesity is the cause of a third of all cancer diagnoses. Cancer's other third is caused by tobacco. The health improvement program works to address both. We have lowered the rate of youth use of tobacco from 18% to 10%, and we've reduced it for adults by 4%. For every 1% decrease in the current use of smokers in Minnesota, it would be an annual savings of $110 million. Figuring out what the MA portion of that's $20 million a year. This is the kind of thing that is going to not only save our health care budget from growing outrageously, but it is also going to save a lot of misery, a lot of surgery, a lot of desperation, a lot of lives. And this was defunded 100% in your budget. Also left behind were families and kids. Well, I'm not going to repeat things we've already talked about, but getting kids off to a good start has gotten a lot of rhetoric this session from both sides. And yet there's no money, not $1, for the 7,000 families, the estimated 12,000 kids who are on the waiting list for basic sliding fee child care assistance. That some of them have been waiting over 2.5 years. We know that the brain development of every one of us happened exponentially from birth to age 3, and it affects your lifelong abilities to learn and be successful. Those kids are sitting on waiting lists and will continue to do that. There's been no progress in helping our poorest families, so they will continue to get inadequate funding to meet even the basic housing costs, let alone gas money to go interview for a job, and they'll go to much more expensive shelters. Homeless shelters should not be our solution when they cost us dramatically more than giving people the dignity of staying in their current apartment and keeping their kids in the same school. Nursing homes got needed attention and funding, but left behind in your nursing home plans were the responsible people who pay for their care out of their own checkbooks. Minnesota has had a long-standing policy of rate equalization, that the rate a nursing home is paid is the same whether you're writing it out of your own checkbook or it comes out of the state treasury. Equal rates would result in huge increases for those responsible seniors who have saved to pay for their own care when their nursing home is scheduled to get rate increases of 20, 30, 40% or more. That not one hearing focused on the impact of these rate increases on these responsible citizens is amazingly disappointing and irresponsible. They have absolutely no protections in the bill before us, except the goodwill, perhaps, of someone who's setting the rates at the local level. But that rate equalization, our tradition, would increase their rates too. I had thought that with a $2 billion surplus, we could do better for our people with disabilities. 3,500 people with developmental disabilities will stay on the waiver rating list. Some improvements were made in the administration of those programs. We're going to get some people off, but we're still going to have thousands waiting for the kinds of services that can help them be more successful. And for those of you who don't serve on Health and Human Services, that direct care workers, our home and community-based workers, are the backbone of the system. They do physically and emotionally difficult work. And we heard testimony from the providers that they were having a hard time filling positions because people don't want to work for $11 an hour. And they can get more money working at the retail stores. Sadder yet was hearing from the consumers and the families who talked about the constant turnover in caregivers. Every single one of us is just an accident or a terrible diagnosis away from needing those supports. And I got to tell you, if I get there, I don't want a different person every day showing up to give me a bath and get me dressed. That's what happens when you're dependent upon the care of an unstable system. What do we reward these workers with and help solve those providers' problems? A one-time 5% in the second year of the biennium, and then it goes away. It's like a little bonus. It doesn't with a $2 billion deficit or a surplus, we should have been able to get $90 million to give them a 5 and 5. These are people working for some minimum wage, but most around $11 an hour. That qualifies them for Minnesota Care. Oh yeah, you're taking that away too. This budget just leaves too much on a shaky foundation of unproven and fragile savings that are not yet proven in any way, and I doubt will ever be able to materialize. Human Services is a system of supports that makes it possible for people with disabilities to lead a life of dignity. It provides home cares to seniors at lesser costs than a nursing home. It stabilizes the lives of those with mental illness and helps poor kids get off to a good start. All of that is put at risk in a budget based on risky and unproven strategies, defunding proven programs that will reduce future costs, and setting up future cost increases in these needs when people go to high-end services and when property taxes rise to meet the gaps that we leave behind. I urge a no vote.
The member from Ramsey, Representative Lilly.
Thank you, Mr. Speaker and members. Much of this has, of course, been said, so I'll go through it all again. Thought I'd make some friends. No, you know, when I was put onto the Aging Committee, I was pretty excited, actually. We're sitting on a $2 billion surplus and building off of some of the work that we did last year. For some of you, we have a lot of freshmen that were here. Representative Hamilton encouraged us, I think, every day to do some stuff on the 5% with Representative Newton, and we did that in the end of the day. And you know, a lot of that went to the workers, but I was really excited to be on this committee with a $2 billion surplus, and I thought, you know, we're going to be able to do some really good work. And I got to meet Representative Schumacher. Everybody said he's really bright, and he is. He's quite talented, and took this issue very serious and took the committee serious. As you've heard from everybody so far before me, starting with Representative Franson, Considine, I can go around the room, but a lot of this stuff, and I remember Representative Keel, she didn't speak tonight, but she had a very personal story about how healthcare and senior living and how that affects us all personally, and I'm sure if we went around the room, we could spend a lot of time doing that. But it's sad to me with our with the $2 billion surplus. I challenge the Chair Schumacher as he goes forward into the conference committee that he tries to do better and to lock this down and to do well. You know, we talk about the disparities. One thing I do want to talk about, you know, you need to look at this sheet. I got to be careful because you guys will all start laughing when I start calling what it is. But there's, just take Representative Schumacher's district real quick. There's 2 cities, for example, and please take a look at it. And I realize we need to do a better job to help protect the homes around the state so they're not shutting down. But in all sincerity, take a look at it because it's just some of this is kind of tricky. Like here's 2 cities. I just picked it out. I'm not a mathematician, but so Tyler Healthcare Center is getting 48% in Representative Schumacher's. At 40 miles away in the city of Tracy, Prairie View is getting 12%. So here's you know, one of my dear friends, Representative Gunther. His home is going to get, it's a Mayo facility in Faribault, is getting 64%, which I'm not saying if it's right or wrong, I'm really not. But we need to figure something out, because you look, Representative Slocum, she has a son in her city and it's getting 1.2%. So you might kind of go, oh, that's okay. Well, it's kind of a little, you know, they're in a minority. Maybe that can happen. Well, there's some of you guys on your side too. There's a facility in Anoka. I was pretty tight with Representative Abler, my chiropractor, adjusted me a few times. She's got an Anoka Rehab Center, Zippo. Lunan, Shakopee, St. I don't know how to say it, Gertrudes, sorry, my apologies. But it's in Shakopee, 0. So, and I'm not saying what is right or wrong, but please, take a look at it. I'm not, I think reforms are good. So, Chair Schumacher, as you go forward, please look at this and figure, do the best you can, fight for all of us. Try to come up with a good position. All along, we kind of stressed the workers. We kind of talked about that. I know it's no secret that I care about workers. I'm not going to get into that very long, but just that was basically all our amendments to make sure that much of this money went to workers. And at the end, we had a chance. The chair took us down to Faribault, and we had a tour. And I was really struck by a gentleman. I think he ran the facility in Mankato. And he was an Iraqi veteran, and he turned us and he says that the folks that we've heard about that are taking care of our elders and our needy in our society, he called them heroes. And so that's what we're dealing with here. It's important work. I did appreciate working with Chair Schumacher, and I trust that he's going to go forward. But with the $2 billion surplus, it's hard not to go back to see that we could probably do more, but.
The member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. Well, members, this bill is bad for Minnesota's health. This bill is bad. I heard one of the members on the GOP side say this is full of reform. Well, members, this is full of reform, all right, but it's conflicting and unworkable reform. And if you're looking for real reform that actually saves money, you'll have to look somewhere else because it's not here. It's not reform when you just cut agencies of government and call it savings. Not telling them how to do it, not telling them what jobs you don't want them to do, just cut them. That is not reform. And when you book savings that can't be achieved, that is not reform. Even your Minnesota Care repeal, which really is a repeal, Representative Mack, is not any kind of reform. And in fact, if you look at the fiscal note for that, it's probably not even achievable. Now, I know you've got a number there and you were able to book that number, but if you look at that fiscal note, it tells you some very interesting things. One is that it simply ends Minnesota Care on January 1st. But there are some problems with that because it may not actually be doable to drop Minnesota Care on January 1st. It requires some changes to MNsure, to do some kinds of programming to achieve the supposed replacement of Minnesota Care, and it's very doubtful whether those changes can be made, and at the very least, it will divert resources from changes that MNsure is already making to be able to do the kinds of things that all of you have complained that they don't do. So all of the back office functions that they are now putting a lot of resources into fixing, you are now in this bill asking them to divert resources from and start going in another direction to try to achieve this repeal of Minnesota Care. Another thing that would happen that the fiscal note talks about is that 10% of the people on Minnesota Care would just plain be left behind, would not have any insurance. So even if it were true, this fiction that these people are somehow going to go off into a better world of health care, which is a fiction, 10% of them clearly are going to go from having very good insurance to uninsured. And finally, that so-called reform increases costs for everyone else who's buying insurance. The fiscal note tells you that putting that population into MNsure is going to increase everybody else's health care costs by 5%. So that's a pretty poor reform, members, and of course those people who are being dumped off Minnesota Care are going to have the option, the wonderful options, to pay more and get less. But that's not the only problem with this bill. I wish it were. This bill is full of reforms that conflict with each other. There's no vision in this bill. There are multiple visions fighting with each other. That's not reform. That's throwing our healthcare system into a great deal of uncertainty, and it affects everyone in Minnesota. So here's what I mean. So you've got Representative Mack's bill that fixes MNsure, has a bunch of fixes in it, also asks us to ask the Department of Human Services to get a waiver so that people can buy the qualified health plans from health insurance companies and still get the subsidies. So it's doing that. We don't know whether we would be able to get the waiver. In fact, those who are experts think we probably would not. But that's in there, fixing MNsure and changing it substantially and letting it continue into the future. And then in the same bill, you are repealing MNsure and having us use the federal exchange instead. So you're putting Minnesota Care clients, patients, onto MNsure, and then in the same bill saying, let's get rid of MNsure and just send everybody to the federal exchange. That doesn't sound like reform to me. And finally, you're expecting MNsure to do a whole lot more with this Minnesota Care repeal, but you're not providing any funding for it to do that. That doesn't seem like a very good plan. It's not really a vision at all. Then you've got plenty of conflicting other policies in this bill. For example, you're raising some rates in the bill, and that's a good thing. But then you've got rate cuts in the bill, which Representative Thiessen talked about many hours ago, that depending on how those rate cuts would roll out, you are cutting the very same people whose rates you're raising in the bill. That does not make very much sense. And you're giving some bonuses, rate increases to people like the people who take care of our elderly and disabled in the community. You're giving them bonuses, this one-year bonus that you're calling the 5%, but you're also kicking them off of Minnesota Care, thereby raising their insurance rates and giving them worse coverage, because many of those people are the ones who are on the Minnesota Care program. So you're saying that you're doing a lot of good things, and we've heard from a lot of the GOP members about some of the really great stuff that's funded in this bill. And indeed, there is an attempt to do some good things that a lot of the members agreed with on both sides of the aisle. It's great to see that the GOP members, for once, really recognize that Minnesotans have needs that are not being met. And of course, the problem with all of this is that as much as you say you're committed to these needs, you're really not, because you're paying for it with bad checks. And that's the problem with your bill. So we can stand up and say we're for homeless youth, and of course we are. And we can say we're for raising certain rates, and of course we are. And we can say we want to do all of these wonderful things for people, but you are paying for it with bad checks. And that is an unfair and, in fact, downright mean thing to do to the people that you say that you are trying to help. And all of this in a year when we have a $2 billion budget surplus. Now, we've heard a lot of angst about sustainability, and Representative Knobloch handed out a graph showing how health care costs have been going up and all of that stuff. And Representative Dean said, let's stand on a ladder and look out 6 years. What do you see? Well, when I stand on the ladder and look out 6 years, I see a lot of tax cuts. I see $5 billion in tax cuts that are going to make everything you want to do for the vulnerable and needy in Minnesota unsustainable. And you're doing it. It's not happening to you. Of course, we know that costs are growing. Why? Because our population of older people is growing. People are living longer. That's a good thing. People with disabilities survive their injuries often, and they live much longer than they used to. Somebody with Down syndrome who used to have a lifespan, a life expectancy of 20 years, now has a life expectancy of, I think, 50 or 60 years. That's a great problem to have. But those folks cost money. They cost us. We have to pay for that. So that's why costs are growing, members. So what are we going to do about it? We do need reform. We need real reform. But just telling agencies to cut their budgets by 15%, that's not reform. And making up fiscal notes is not real reform. And unfortunately, you missed some opportunities for real reform. You really did. So there's an opportunity to do some audits of the health plans where we pay them billions of dollars every year and we don't know really how they're spending our money. That's something we need to pursue, and I hope we will in the conference committee. Another really great reform, like Representative Norton's reform around non-emergency medical transportation, that's real reform, an opportunity that you missed. Because the only reform you seem to be interested in is one where you can book savings today, not one where you can set us on a course for sustainability tomorrow. And there's really something wrong with that. Because what you're doing in this bill is not about sustainability at all. It's not about reform. It's simply about saving money so that you can spend it on tax cuts now and into the future. This is truly about greed over need. It's really a shameful, hurtful bill, and I'm really sorry that that's the case. But I'm going to vote no and ask other members to do the same.
The member from Hennepin, the Minority Leader, Representative Thiessen.
Thank you, Mr. Speaker. Well, we're going to be passing the biggest budget in the history of the state, and this is going to be part of it. You're going to be passing the biggest budget in the history of the state of Minnesota. We're here at a time of a $2 billion budget surplus, and yet this is the bill we have before us. A representative on the other side made the point or tried to make the point about the investment we made in long-term care last year, Representative Zerwas. In fact, Representative Zerwas, in a time when we had a $627 million budget deficit, we actually found more money to put in long-term care than you're able to cobble together in this budget tonight. You talk about rates increasing. The fact of the matter is you're making significant deep cuts to rates in your bill. Hospital rates could go down 22% under the legislation in your bill. Those are rural hospitals. That would cause rural hospitals in many of your districts to close. That's what you're proposing in this bill. You are, whether you like to believe it or not, you're actually going to make tens of thousands of Minnesotans have less access to health care or lose their health care. And that is going to have an impact on providers, doctors, and hospitals. Putting people in MNsure is going to drive up everybody else's health insurance rates across the state of Minnesota. So all of your constituents, even if they weren't on Minnesota Care before, are going to see their rates go up as a result. You're going from Minnesota Care to We Don't Care. That's what this bill is about. That's what you're doing in this bill. And of course, you're not even paying for it. And that maybe is the most troubling and disappointing thing about the whole bill. Representative Erdahl asked a good question. He said, where's the money going? If you look at Representative Knobloch's chart, you'll see that in this decade, healthcare costs for public healthcare programs have essentially been flat. You know where the money is going? The reason that you have to purportedly cut $1 billion, although I think if you actually ran Representative Knobloch's numbers on that all funds budget, you'd probably be spending what was projected because you're not really making cuts, you're just pretending to. But where all the money is going, the reason you have to fashion your budget this way is because they're going to Representative Davids, and they're going to the owners of Mall of America, the owners of Walmart, the owners of the skyscrapers in downtown Minneapolis. That's where this money is going, Representative Erdahl. It's not going to the people of Minnesota. It's not going to their health care. If you're searching for money to pay for the more money you claim you want in higher ed, the more money you claim you want for the K-12 system, vote against Representative David's bill tomorrow. Then you'll find your money, because that's what's going on right now. So members, you know, I've said enough probably about this bill. I really do think we're perpetrating a fraud on the people of Minnesota, and particularly the most vulnerable people on Minnesota with this bill. And I would urge you to vote no.
The representative from Hennepin, the Majority Leader, Representative Pepin.
Thank you, Mr. Speaker and members. We've had some really interesting conversations tonight. I haven't spoken much tonight. I have to say I was pretty disappointed in the earlier attempt to refer this back to Ways and Means, and I didn't want to address it then because we had a lot of work to do tonight because that's our job as leaders of the state. But I think we all know it was a political game. The conversation had to do with this fiscal note. This fiscal note, which was requested this afternoon, 2:05. It magically came in at 5:53.
Mr. Speaker, point of order.
Magically came in.
Representative Thiessen, please state your point of point of order, excuse me.
Thank you. I rise for point of order under Masons and would ask that the Majority Leader actually tell the truth. The fiscal note was requested many days ago.
Mr. Speaker.
Representative Dean, for a purpose do you rise?
Under what point of order does the Minority Leader rise?
Minority Leader Thiessen, under what?
I'll withdraw the point of order. I just wish the Majority Leader would actually tell the truth.
To the Majority Leader, Representative Pepin.
Thank you, Mr. Speaker and members. Well, obviously, the minority Leader doesn't want to hear what I have to say, but I think it's important, since we had this big show, this theater earlier. This fiscal note was requested this afternoon at 2, and somehow it magically came in at 5:53 today, long after it had gone through Ways and Means, after we'd already started the debate on the floor. When we had Representative Loon's bill in House File 2, it magically took 9 days to get here. And when did it come? Again, right when we had it on the floor of the House of Representatives, so that we had to send it back to Ways and Means and slow the process down. Because what the minority is trying to do is be obstructionist. Once again, it's an attempt to be obstructionist. Now, you might ask, why did this happen? Why this $285 million that you claim as a whole? Well, let me tell you about that. I'm not sure if everyone's had a chance to look at the audit report, but I want to read a few things, and I want you to consider that as we talk about what you call, Representative Schoen, you called unicorns and glitter. I want to point this out to you. In November 2014, DHS, and this is right in the OLA report, you can all read it. In November 2014, DHS postponed the review of about 600,000 medical assistance recipients who enrolled before October 1st, 2013. DHS hopes to conduct these reviews between March and December of 2015. So over 600,000 eligibility determinations weren't made. 600,000. So apparently one agency that works for the governor, who coincidentally doesn't support our bill, his agency didn't do eligibility requirements for checks for 2 years. 2 years. 600,000 people. The report goes on to say, but as of late 2014, some individuals in public health care program had not had their eligibility reviewed for 2 years. 2 years. People were on it for 2 years without anyone checking at the department whether or not they were eligible to be on the program. And you can run and hide behind the fiscal note and say that the fiscal note says we don't have the money, but you know that this has not been reviewed, these eligibility determinations have not been made, so there are people out there, lots of people, I think 17%, when they did the sample, 17% of the people were not eligible for the public programs that they were on when the OLA finally did the report. And OLA has been working on this for a lot longer than the 4 hours that apparently took the one agency of the governor to make a determination on another agency of the governor. Does anybody else find this ironic? Because I'm pretty sure the people at home find this ironic. You know, the people sent us here to be good fiscal stewards of taxpayer dollars, and what they got was MNsure, a system in which 140,000 people lost their plans. And we have an agency of the governor who didn't bother for 2 years to check people to see whether or not they were eligible for the program that was paid for by taxpayer funds. Billions and billions and billions of dollars go towards healthcare services. And it's our job to make sure that those services are directed towards the people in the state that need them. But we have an agency that apparently isn't doing their job. And now, you want to hide behind the fiscal note about whether or not there's any waste in the system? I encourage you to read the report. And after you read the report, come and talk about whether or not you think it's true. Because the Office of the Legislative Auditor is well respected by both sides of the aisle. There have been members many times on both sides of the aisle that have talked about this nonpartisan office. Very well trusted, as opposed to political appointees of the governor. And that's fine. Every governor has political appointees who have a reason to make fiscal notes, which is why the Speaker and the Majority Leader of the Senate earlier put forward a bill to create an office of, internal office of the budget office, like the Congressional Budget Office, so that this problem wouldn't happen. But members, the righteous indignation that we heard on this was absolutely ridiculous. The actual waste and abuse is probably far greater than we budgeted here. So I just needed to point that out to members. I just couldn't sit here and listen to this, unicorns and glitter, going on and on and on about this. I've said enough about that, but I want to talk about why we should vote for this bill, and it's a really good bill. And I have to say, Representative Dean, Representative Mack, Representative Schumacher, as well as Representative Vice Chairman McDonald, Vice Chair Peterson, Vice Chair Tice have worked really hard to bring reforms to the system, which haven't happened in the last couple of years because we've had runaway spending with nobody wanting to address the problem. And so thank you, those of you who've worked on this. This bill does a lot of great things, and it uses taxpayer resources wisely. It protects aging adults' quality of life. $138 million for nursing homes. And while a lot of people have given lip service to that in the past, we actually provide it here. It provides a statewide reimbursement which will strongly assist nursing homes in Greater Minnesota. Again, we have been focusing on Greater Minnesota all session, Representative Marquardt. And this bill is geared towards nursing homes and geared towards Greater Minnesota. And that's really important to me personally, nursing homes, because my mom was in a nursing home before she passed away. And I really cared a lot about those workers. And the reason I cared about them was because I wanted to make sure that they were able to take care of their families and feed them. But I also wanted to make sure that my mom had consistency in the people that helped her in her day-to-day tasks. So we're putting our money where our mouth is in this bill, and we're making sure those people are taken care of. We're also putting $90 million towards a 5% rate increase for home and community-based services in this bill, increasing the wages of hardworking caregivers and increasing the quality of life for Minnesota's vulnerable and elderly, as well as $52 million to counties for child protection services. And again, this bill protects Minnesota taxpayers by requiring the Department of Human Services to request a federal waiver to allow individuals to have access to the same tax benefits outside the exchange that exist currently within the exchange. It expands right for consumers and makes the healthcare market more competitive and consumer-driven. This saves taxpayers an estimated $300 million by requiring the Department of Human Services to conduct an audit for public programs, an audit which is obviously desperately needed, according to the OLA, and which we all know. So again, you can deny and run from the problems. You can deny that there's waste in the system. But when you deny that there's waste in the system and you try to hide behind a fiscal note, you know who you're hurting? You're hurting the people of Minnesota. Because the people of Minnesota expect us to be good fiscal stewards, and they expect us to audit government services and make sure there's not fraud, make sure there's not waste, and make sure there's not abuse. That's our job. So members, in conclusion, this legislation makes important reforms that will save taxpayers money while prioritizing our aging population and protecting our most vulnerable citizens, and I urge a green vote.
The member from Rock, Representative Schumacher.
Well, tickle me pink, Mr. Speaker and members. We have a pretty good loofah bill, style bill here in front of us. We fund our priorities and bring reform to a long-term care system that hasn't seen this type of change in 22 years, according to the great Bob Held. But I do have to take issue with one point when we're talking about the kind of funding that's gone on over the last few years in this area. And if we're looking at what was spent over the previous 2 years versus what we're proposing here, I look back at a press release that was handed out during a press conference held by the DFL on the last Friday in January of this year, where it's touting the $232.5 million that's put into the long-term care system, which is true. That's accurate. That's good, and we needed that. The industries needed that, and the people that they take care of needed that. But when you look at the budget that's in front of us tonight, and you look at lines 283, 270, 294, and 2179, you look at House File 316, you look at what we do for the 5% campaign, you look at House File 614 of the workforce development and the healthcare workforce that we do with the Minnesota Department of Health, you see that in fact in 2 years we're spending $10,671,000 more than the $232.5 million that was touted for over a 4-year increase during the previous 2 years. So I just wanted to make that point. Members, we do need your support on this. We have to have a strong position to Itasaka, and going into conference committee to try and get the Senate and the governor on board with some of the changes that we're trying to do here. So please vote green.
The member from Dakota, Representative Mack.
Thank you, Mr. Speaker and members, and thank you for a lively debate. Thank you, Chair Dean, for all the work that you've put into this. Members, as we close out tonight, I realize that after being here for a handful of cycles now, you start to realize that no matter how hard you work or what kind of progress you're making, it's never going to be good enough. And maybe that's fair, because we all know, after you've served here for about 2 days, that the list of requests and the list of asks are always far longer than the amount of resources in your hands. And that will always be the case, because as long as there's any amount of resources, there's going to be a demand for those resources. But members, the bill in front of you address, I think, an impressive list of those requests that the people out in the halls, that Minnesotans have been asking for. It delivers real reform in a desperate way to MNsure, and to a failed program that has failed the people of Minnesotans desperately. And we try to put some small corrections in place with my bill, House File 5, if we're not able to repeal it altogether. Members, it delivers dental reimbursement increases that have been desperately needed. As much as was asked for? No, but a step in the right direction. That's been long overdue. Representative Schoen, you raised concerns about rural health care access issues. We all acknowledge that that's a concern and that there's a pipeline of workforce issues and things that we address. But members, this bill delivers some real reform right away with some of the options that telemedicine would give us. Representative Considine, you say our 5% is not good enough. Well, I would argue, remember, it's the best offer on the table. The governor and the Senate put nothing in for that community. And so while I understand that maybe one time in 2017 isn't what everybody in this room wants, it's the best offer out there. So I think we should fight for it. We didn't have one advocate last week say, thanks for that, but no thanks. Give it all or take it all away. They had the courtesy to say thank you for fighting for us. Thank you for giving us at least that. We'll come back next year. We'll keep fighting. And we agreed to keep having that conversation. But for now, we got 5% in for 2017. And they said thank you. So I don't know, Representative Considine, or those who criticize that, if you'd rather us have done nothing. But we did what we thought was best with the resources in our hands. Representative Freiberg, you are concerned about families that are going to be stuck out in the cold with our transition of Minnesota Care. Well, members, I think that's a much more honest approach to the looming crisis coming at us with the basic health plan. Instead of letting that train crash, Representative Dean came up with an innovative solution. Now, agree with it or don't agree with it, but at least we're being honest with the Minnesotans and the real crisis that's at hand if we don't do something with the direction that Minnesota Care's handled. We've had a great program. We've been a leader in Minnesota Care. But we took a major wrong turn a couple years ago with adopting the basic health plan. And now we're trying to right-size that. And we'll go into conference and have that fight and have that discussion on how we fix that. but at least we're leading and we're being honest with the people of Minnesotans in offering them a solution. Members, this bill delivers on real support and real reform for our counties, with some simplification that they've been desperately asking for to kind of streamline some of their systems, make sure that they can be more accurate in their eligibility determinations. And members, probably one of the things I'm most proud of in this bill is that it delivers the greatest commitment and resources to our child protective services. Again, it is the best offer on the table, more than the governor offered, more than the Senate offered, to make sure that we are protecting the ones that are most important to us, our youngest kids who are put in terrible situations that they didn't ask for, they didn't deserve, and we need to step in and make sure that we're protecting and defending them with everything we have. And our bill does that. Remember, we hear that this bill lacks vision. I couldn't disagree more. This bill has vision for our nursing homes, a vision that we have never seen before. This bill has vision for our child protective services. This bill has vision for how we can better support our disability community. This bill has vision for how we can empower the individual. Members, we hear a lot about the surplus and what's responsible and what we owe Minnesotans. And members, yes, there is a $2 billion surplus, and we could all fight for days on how we should best spend that. But what is responsible, members? To just spend that one-time $2 billion surplus with promises that we cannot sustain into the future, like we've been doing in healthcare, that's not responsible. That's not fair. That's a one-time surplus, members. Yet we hear proposal after proposal tonight that we should be plugging that into the Health and Human Services budget. And I don't necessarily disagree with that, but it's not honest because that money continues to be needed long after the surplus is spent. And we're doing nothing to bend the cost curve with that, members. So I think this bill is responsible in how we handle that surplus and the kind of promises that we're making going forward. So members, in closing, I've come to terms with the fact that it's never going to be enough. But it doesn't mean you stop fighting. Rather, it means that you sharpen your vision for what you know is possible. You're willing to fight for bold ideas and bold reforms, which I believe this bill does. You're okay with taking an inch of progress when you know that you're pursuing a larger goal. And you seize major opportunities when they're right in front of you. And that's what I believe this bill does, and that's why I'll be voting yes. Thank you so much, Chairman Dean, for your leadership and your bold ideas and bold reforms in this bill, and hope you guys can all vote yes. Thank you, Mr. Speaker.
The bill author, the member from Washington, Representative Dean.
Well, thank you, Mr. Speaker and members. Thank you for a great debate this evening on this bill and on the healthcare system in Minnesota and on our services to needy Minnesotans across all our programs. Thank you to Chair Mack and Chair Schumacher. Thanks also and particularly to Representative Kresha for his work on child protection, which is in this bill, which is funded at a higher level than either the Senate or the governor. Thanks especially to my friend Representative Hamilton, who fights tirelessly for the people who deliver care across the state of Minnesota in the homes and communities. People really back-breaking work all across the state of Minnesota, doing it because they love it. They have no greater champion in this building on either side of the aisle than Representative Hamilton. And I don't say that because he's sitting next to me. I say that because it's true and that the people out there, I think, believe it and know it. Representatives, we've heard a lot tonight about why we shouldn't vote for this bill. And we've heard about the reason for this is it's not because it doesn't do enough of this or that, but because that somehow that the savings within this bill cannot be realized. So that's the supposition. That's why you're all supposed to vote against it. You know, and I think about that, and I think, well, we can't do this in Minnesota, but we can do it in other states, in Illinois and in Pennsylvania and other states that, you know, are trying to do this because every single state in the country is having their budget eaten by Medicaid expansion. That's why they're doing it. That's why we need to do it. But somehow say that Minnesota can't do this, even though we rank 50th in the country in recovering money from waste that we have within our system. We can't jump up from last, not even one spot. Departments can't do it. We can't find anything. We're doing absolutely everything that we can do. And I think, you know, I look at the response from the other side of the aisle and I think, methinks thou dost protest too much. You know, I'm just a little bit taken aback by it. I'm thinking, we really have to be 50th? We really can't do any more? So then I think, what is with this fiscal note that just suddenly jumps from the state office building today at noon, at lunch today, somebody decides, let's go get a fiscal note. Normally it takes several weeks, for some people, you know, a week or at least to get this back. Oh, here it is in a couple hours. What would you like to say? You know, poof, there it is. So suddenly this is a good reason to vote against the bill. This is why you should vote against the bill. But I would challenge members on the other side of the aisle to maybe just think a little bit longer term and take a little bit different vision on this and really look at what the bill does. Because this bill really does address some of the pressing needs that we have in the state of Minnesota, in our long-term care facilities, nursing homes across the state of Minnesota. It's not just a big deal for the people who live there, the moms, the dads, the grandmas, the grandpas, the great-grandmas, the great-grandpas. It's the people who care for them. In little tiny towns and small communities, you know what? A nursing home is a big deal because it's an employer. It's a big part of that economy in the state of Minnesota. This bill addresses that for the first time in a generation. And Representative Schumacher, who led the Aging Committee with the youngest member of the legislature in tow, leading that charge, I think did a fabulous job. So Representative Marquardt, when you go back to your district and you're going to say to your district the $3.7 million is not funny money. It's not pixie dust. It's not unicorns. You know what? They're not going to think that's very funny, just as a bit of a tip. That's real money. And if your excuse for not delivering that is that we can't find the same kinds of waste, fraud, and abuse that we found in other states across the country, we can't jump up from number 50, that's probably not going to work out very well. So I would challenge you a little bit on that. You know, Hubert Humphrey said that we should challenge the moral test of our state is how we treat the people in the dawn of life, the children. And in this bill, we look at the unborn, we look at the kids, we look at the vulnerable, disabled children, and I think we're doing a pretty good job. He said you look at the twilight of life. Your moral test is how you treat people in the twilight of life. And you look at what Representative Schumacher has done and Representative Hamilton has done, and you test that and you say, how are we doing? We're doing pretty well when you measure up against what we're doing in the Senate and the governor's got on the table. How are we doing with people in the shadows of life, the sick and the needy? The disability community appreciates the work that so many of the members on this committee have done to improve the lives of those that really struggle the most in the state of Minnesota, and their family members and their caregivers do as well. We really did meet that test, and I thank every single member on both sides of the aisle who helped do that. We may not have a bipartisan vote, but I've said it before and I will say it again, that health care is too big an issue to be solved by one side or the other. We need to move forward in Minnesota and find common sense solutions, particularly for middle-class Minnesotans who are struggling especially right now. So, members, I want to thank each and every one of you, whether you worked on the committee or not, because I know you all have that in your heart as a goal. I would appreciate a green vote.
Seeing no further discussion, the clerk will take the roll on the bill. The House is under call, members. Please vote.
Mr. Speaker,
Representative Thiessen, for what purpose do you rise?
I rise under Rule 2.05. State the reason I'm not voting.
Mr. Speaker, I move that all those not voting be excused from voting.
Representative Pepin moves that those not voting be excused from voting.
I would request a roll call, Mr. Speaker.
Roll call cannot be requested when the board is open, Representative Thiessen.
All right, well, I'd like to debate the motion then.
Representative Pepin, to your motion.
Mr. Speaker, I'm not sure if the motion is debatable or not, but the motion is just simply a move that those not voting be excused from voting. I don't know what the discussion would be.
Representative Thiessen.
Thank you, Mr. Speaker. Well, under 2.05, a member who doesn't vote really at any time, but under call in particular, is supposed to explain the reason that person's not voting. And we had a lot of debate tonight that I think some people are interpreting as partisan gamesmanship. Now, the fiscal note was actually asked for about 10 days ago. I asked that the department start working on it because Representative Dean and Representative Knobloch refused to ask for a fiscal note on a piece of the bill that was in the legislation. But this is not coming from a partisan place, members. To most people in Minnesota, the details of our state budget don't matter. That's the reality. What they care about is whether our schools are funded, whether our police are on the street, our firefighters are responding to emergencies, whether nursing homes and hospitals are operating at high quality, whether there's affordable options for higher education. That's what they care about. But they do expect us to care about our budget. This really isn't about playing a partisan game. This is serious work. They count on us to care about the details. That's why they send us here. And more importantly, we should care. It's not just because we took an oath of office to care, and it's not just because we're making promises to seniors and our most vulnerable that we may not be able to keep. That's not really the most fundamental thing. More fundamental than that is taking actions like this bill are ultimately corrosive to our politics and to our democracy. When we start making public policy based on hunches and suppositions, or worse, like tonight, on things we know to be untrue, we undermine our ability to solve problems. We undermine the trust that people have in this institution. We can't talk to each other, but we can only talk past each other.
Mr. Speaker?
Representative Hamilton, for what purpose do you rise?
I'd ask the Sergeant at Arms bring in the absent members.
We don't have any absent members, Representative Hamilton.
So
Well, Mr. Speaker, point of parliamentary inquiry.
State your point of parliamentary inquiry.
What order of business are we on? I believe we're in the middle of a roll call.
We are on a motion to excuse the members who have not voted from voting.
So,
Representative Thiessen.
Mr. Speaker, members, and this is serious. We can't have meaningful conversations with each other, and we have no basis to solve problems with each other when we can't even agree on the facts, when we can't rely on the information we're given. We can't be good fiscal stewards. But more important, and probably the worst part of it, is we can't have a meaningful conversation with our constituents. We can't talk to them like Representative Pawlowski often talks about what the consequences or the benefits of the decisions we're making are going to be. And because of that, we can't talk to them about how we should solve together the big problems and challenges that we face. So here's my frustration. I don't know
Excuse me, Mr. Speaker.
how to make people out there care about
Mr. Speaker, point of order.
State your point of order.
Mr. Speaker, we're on, the motion is 2.5. I'd made a motion on 2.5, every unexcused member to vote. And this is not a debatable motion if you read 2.05. The question must be decided without debate.
No, that's, Mr. Speaker, that's not the...
Mr. Speaker, advice?
Mr. Speaker, advice? Mr. Speaker, advice? Mr. Speaker, advice?
We're not under a point of
Mr.
order.
Speaker,
Representative
I withdraw
Pepin.
my motion.
Representative Pepin withdraws the motion to excuse
Mr.
the absent
Speaker.
members. The clerk will call the absent members.
Thiessen, Thiessen, Thiessen.
Mr. Speaker, I would like to state my reasons for not voting as stated in Rule 2.5.
Mr. Speaker, point of order.
Representative Dean.
Thank you, Mr. Speaker. Mr. Speaker, I rise under Minnesota House Rule 2.04, explaining or changing a vote. And it says, a member must not explain a vote or discuss the question during a roll call. Clearly, Mr. Speaker, we are under a roll call. Representative Thiessen is trying to speak last, have the last word, which I think is, I guess, the custom and usage of the House. It's disrespectful to the majority. It's disrespectful to the majority leader in particular. And I think, Mr. Speaker, that you should find the point of order 2.04 well taken. We should finish the roll call, and we should move on with our business.
Mr. Speaker, advice? Mr. Speaker, advice?
Representative Dean, I'm going to defer ruling on your point of order. We have opened the roll call. We have a member that, when his name was called, has refused to vote. He is now explaining the reason he's not voting, to which point, in an undebatable fashion, I will put the question to the House, shall the member for the reason stated be excused from voting? This chamber will then vote on that. Representative Thiessen, continue explaining your reason for not voting.
Thank you, Mr. Speaker. And I am almost done. And again, this is more serious and not intended to be a partisan thing, because this is what this body should be about. But my frustration is I don't know how to make people outside this chamber care about the way we do budgeting in this body. And whether we are true about it or not, it's hard to make people out there care. But I do care, personally. And that's where the frustration for me is coming from tonight. And so I'm going to do what I can. And that is the reason, even though I oppose this bill, that I'm not going to cast a vote for this bill, because I do believe that it is based on things that are far from reality, that it's based on false premises, that it's based on false promises. And because this bill is going to head us further and further down a path I don't think we want to go down, to a point where we're never going to be able to recover people's trust, and we're never going to be able to restore the vibrancy of what should be a democratic process. So members, that is why I'm not casting a vote for this bill tonight. And I hope in the future that we're able to move forward in a way that actually is founded on a common set of facts that we can agree on, because it's only then that we can start to solve the problems facing this state.
Members, Representative Thiessen has given his reason for not voting. I immediately now will put this question to the body, and we will take a voice vote on this. Shall the member, for the reasons stated, be excused from voting? All those in favor of excusing Representative Thiessen from voting on this signify by saying aye. Aye. Those opposed, no. No. The motion does not prevail, and the member is not excused. Division has been called. All those in favor of excusing Representative Thiessen from voting on this question, please stand. Members, please be seated. The clerk will close the roll. Somebody found their button. There being 72 ayes and 60 nays, the motion passes. The bill is passed as amended, and its title agreed to.